So good morning. My name is Elizabeth Rosa. I'm the events manager for the Sub-Saharan Africa region at the U.S. Trade and Development Agency, and I'll be your MC for today. Just a couple of housekeeping remarks before we get started. The Wi-Fi is Radisson Guest. All you have to do is select that, accept the terms, and then you're good to go. The restrooms are in the back left corner within the room. There's also available simultaneous translation. If you need from Portuguese to English, it is channel 1. If you need from English to Portuguese, it is channel 3. So we'll go ahead and get started. I have the great pleasure of welcoming Heather Lanigan, our Regional Director for Sub-Saharan Africa at USTDA, to open us up with welcome remarks.
Good morning, everyone. It is so great to be back in South Africa and see such a full room today. Really looking forward to this discussion. As mentioned, Elizabeth mentioned, I'm Heather Lanigan. I'm the Regional Director for Sub-Saharan Africa at USTDA. And on behalf of USTDA, I would like to warmly welcome you to this workshop focused on regulatory convergence for healthcare products. This 2-day workshop and today's discussion will focus on pharmaceuticals, and then tomorrow we will continue the conversation with a focus on medical devices. This workshop is a focus on Southern Africa, but it's a part of a 5-part series. First one was in Kenya last November, and some of you were there. And the other 3 will take place on the continent over the course of the next year. The next one, I believe, is in Abuja in July, so very much looking forward to that and hoping some of you will join us in Abuja. But today we are very honored to be joined by such a distinguished group of experts from across Southern Africa and the United States. Today's participants include regulators, government agencies, pharmaceutical companies, and private sector healthcare champions. I would particularly like to recognize the presence of 6 regulators and healthcare agencies who have joined us for this workshop, including leadership from the National Department of Health of South Africa, the South African Health Products Regulatory Authority, the Botswana Medicines Regulatory Authority, the Namibia Medicines Regulatory Council, the Angolan Regulatory Agency for Medicines and Healthcare Technologies, and the Ministry of Health of the Republic of Mozambique. Thank you very much for joining us today. I will say that I had first planned to recognize every single individual, but I realized it would take about 15 minutes and probably not the right way to start a workshop. So all protocols observed, and thank you for being here. Our objective in hosting today's event is to provide a platform for a dynamic and action-oriented discussion regarding regulatory practices for pharmaceuticals. Collectively, of course, we recognize that we all aspire to simplify the trade of pharmaceuticals, which will facilitate faster access to and a wider range of life-saving products for all Africans. Throughout the day, the workshop panels will discuss best practices and identify the next steps to strengthening the enabling environment for pharmaceuticals and improve market access for essential medicines throughout the region. In the discussions, which we really do intend to be dynamic and interactive, we'll focus on lessons learned from Zazibona, how to approach sustainable financing models, digitalization in the context of regulatory harmonization, regulatory capacity building and leadership development, and stakeholder perspectives of pharmaceutical regulatory pathways. While I recognize that all of you in the room will be driving pharmaceutical access across the continent, my hope is that you will consider the US government, including USTDA, as a trusted partner in this process. And several of our US government colleagues based in South Africa who are experts in this space will be joining us, including representation from USAID, the US Department of Health and Human Services, and the US Department of Commerce. But for those who have not worked with USTDA in the past, I'd like to provide some very brief context of our agency's role in healthcare. USTDA is the overseas project preparation agency of the US government. And we work alongside and in support of US industry to support the development of infrastructure in emerging markets around the world. Africa is certainly one of our largest portfolios, and I'd like to think it's absolutely due to our strength of our partnerships, and obviously the drive for infrastructure growth across the continent. Our current portfolio includes approximately 100 projects at the early stage project preparation, which are designed to mobilize over $15 billion in financing in sectors such as digital infrastructure, clean energy, transportation, and of course, healthcare. If I were to think of one overarching statement of our healthcare work, which is very difficult, I would say that the overall goal is to provide healthcare access for all. And as such, during the US-Africa Leaders Summit in 2022, USTDA launched the Coalition for Healthcare Infrastructure in Africa, alongside US industry. The coalition's goals are to work with African stakeholders to develop resilient infrastructure, strengthen accessibility and effective delivery of service, and support a stronger enabling environment across Africa. And during this workshop, I'm pleased that several of our partners from the coalition will be here, including US Pharmacopoeia, USP, and the USA Healthcare Alliance, also known as US AHA. As mentioned, USTDA is the project preparation agency of the US government, and we work very closely with both the public and private sectors to provide grant-based project preparation assistance. This includes feasibility studies, technical assistance, and pilot projects. Our current portfolio spans 12 countries and includes focus on hospital infrastructure, logistics of healthcare delivery, and healthcare regulatory system strengthening. One illustration of our regulatory work, which I always talk about, not just in South Africa, is our partnership with SAPRA. USTDA supported a project that provided technical assistance in capacity building to further increase the efficiency of pharmaceutical, medical device, and in vitro diagnostic project registrations and approval. We are very honored to work with SAPRA, and so pleased that we'll be joined by Dr. Semeti, the CEO, and her colleagues here today. So thank you very much for joining us. We're very proud of our partnership. And the second very important part of our program too is partnership building. Of course, this workshop, which you're all present at today, but we also host events such as reverse trade missions to the United States. Last August, for example, we hosted a health innovation reverse trade mission, which included delegates from South Africa and Kenya, and was focused on innovation and technology for healthcare. It was a fantastic reverse trade mission that went to Washington, D.C. and Boston and exchanged best practices. I know several of our delegates will be joining us over the next 2 days. Not sure if anyone's here quite yet, but we'll look forward to welcoming them. In closing, I share this context of USTDA very briefly so that I hope that those who have not worked with us will consider us partners going forward. And of course, during the next 2 days, I hope that you'll be able to interact with our team, who is based over here at this table. We have Elizabeth Rosa, the events manager who you just met, Sarah Witten, our finance implementation manager, Mohammed Essay, who is our representative based in South Africa and covers Southern Africa, Matt Schwab, who just joined USTDA 3 weeks ago as the country manager for Southern Africa. So what a way to join the region. And so I hope that the next 2 days we can also brainstorm ways we can work together. And then lastly, I would like to recognize the excellent team at the Corporate Council in Africa for organizing this event and convening such a phenomenal group of participants. CCA has been a fantastic partner of USTDA, and we are grateful to be working with your team. I'd like to thank Laird, Jo Melissa, Mariah, and Kirti. A big, sincere thanks to you. And now it is my distinct pleasure to introduce U.S. Consul General Vincent Spera, who leads the U.S. government at the U.S. Consul in Johannesburg, just up the street. CG Spera, thank you for joining us today. Thank you for your leadership. We look forward to your remarks.
All right, good morning, everyone. So Tuesday morning, sunny, and we're talking about regulatory convergence for healthcare products. That's a great turnout to see the enthusiasm and so much interest in this topic. So good morning, thank you, Heather, for the introduction. Again, I'm Vinny Spera. I'm the U.S. Consul General here in Johannesburg. I'd really like to welcome you to this USTDA hosted healthcare workshop, and I want to offer a special welcome to those of you that have traveled to Johannesburg and South Africa for this event, not just our colleagues from the Corporate Council in Africa, it's great to see you all again, but also those from the private sector and government entities that have come here. I know we have a full agenda for you during your time at this workshop, but I do hope you'll have a little bit of time to explore the city while you're here as well. But of course, we're here for this workshop, and we really are delighted that you've decided to spend your time with us. The work we're going to do over the next 2 days really is a continuing signal of the U.S. government's broad and continuing commitment to positive health outcomes broadly across the continent of Africa. For years, we have invested in health workers, in testing, in infectious disease treatment, and I think importantly, relevant to this topic, strengthening public healthcare systems in general. And so much of that work has been successful because of, and only because of, the partnership we've had with host governments and the private sector all across the region. Many of you know last year we just celebrated the 20th anniversary of one of our signature healthcare programs, PEPFAR, the US President's Emergency Plan for AIDS Relief, and that supports host governments all across Africa, and all across the world for that matter, in controlling the spread of HIV and AIDS-related diseases. And just to give some context, in South Africa, our largest PEPFAR program, in those 20 years, we've invested $8 billion in HIV and AIDS treatment, which has saved millions of lives. And it's also important to note that that investment and engagement happens at all levels. It's not just work at the national level, it's all the way down to the neighborhood and community level. Over those 20 years, for example, we have supported 1,250 community-based organizations really working in neighborhoods and in townships all across the country. And so that's the big picture. But I also want to emphasize that we work in some specific focus areas as well, and I'll obviously touch on the regulatory piece. But we have a DREAMS program as part of PEPFAR that focuses on HIV prevention programming for adolescent girls and young women. In the 7 or so years of DREAMS in South Africa, we've already reached 100,000 beneficiaries, trying to keep them with positive long-term health outcomes. We support the implementation of voluntary medical male circumcision, which reduces the risk of HIV infection in men by 60%. And we also look very closely at the crossover between HIV and TB, including drug-resistant TB and HIV-TB co-infection, working hand in hand with public health facilities. So that just kind of frames the big picture of, tip of the iceberg, of course, but on some of the things we're doing in health. But I also certainly want to touch on regulatory pieces, given the theme of this conference, workshop, today and tomorrow. One entry into that for us has been through our Global VAX program, where we've been working to provide a holistic response plan for COVID-19 preparedness, specifically in South Africa. That included some very close work with SAPRA about introducing COVID-19 vaccinations into private primary health facilities, mobile vaccination outreach to priority populations, vaccine demand generation, and health system strengthening, all of that really relying heavily on a strong regulatory environment to enable that important work to happen. So as I said, in South Africa, we've been working with the SAPRA, South African Health Products and Regulatory Agency. I know there's some of you here, I'm sure other regulatory agencies in other countries, we've done similar work around COVID-19 and other health interventions. Moving forward, our Food and Drug Administration and our government more broadly believes that the establishment of the African Medicines Agency is really critical for the development, approval, and manufacturing of quality, safe, and effective medical products in Africa. AMA would support strengthening the regulatory capacity on the continent by promoting harmonization, post-market oversight mechanisms, and innovations to prevent shortages, improve emergency preparedness, and increase access to high-quality products. That's what we get at the foundational elements Heather was talking about, bringing high-quality medical services and accessibility to medical products to all people across the continent. So to that end, we're working very closely with our African partners and hope to support the AMA to create access to life-saving therapeutics and innovation. I know many of you are from the private sector, and I certainly want to emphasize what I said earlier, that we fully embrace the private sector as a partner in all of this work, especially here in Johannesburg. We have so many US pharmaceutical and medical device companies operating here, if not headquartered here. It really is truly a regional hub, and we maintain a strong commitment to working with all of you as we continue this work moving forward. So as Heather said, your participation in this workshop is going to continue these and other important discussions, especially those focusing on the harmonization of regulatory frameworks across the SADC community and then throughout the other events in the series across the continent as a whole. As was mentioned, there'll be sessions on anticipated regulatory developments as they relate to both pharmaceuticals and medical devices. And we know that through these discussions and the relationships that will be developed and be deepened over the course of the next 2 days. We hope to identify efficiencies and improve governance and transparency, which will allow for increased market access for essential medical products across the continent. So as we've said, there'll be representatives from US and Southern Africa pharmaceutical and medical device companies, government representatives, multilateral partners, and we know that's going to allow for productive conversations and result in tangible outcomes, not just this week, but in weeks, months, and years ahead. So with all that said, I am positive, and I know this will be a meaningful and productive 2 days. Thank you for joining us. Your being here, such a great turnout on a Tuesday morning, really does demonstrate the depth and the breadth of the commitment and dedication to fostering a meaningful partnership between Southern Africa and the United States in an effort to promote positive health outcomes across the region. And I very much wish you a dynamic and collaborative workshop. Thank you very much.
Thank you very much, Consul General Spera. I now would like to welcome Professor Nicholas Crisp, who is the Deputy Director of the National Health Insurance for the National Department of Health of South Africa. Professor Crisp, we warmly welcome your virtual participation.
Thanks very much. Good morning, Madam MC, Ms. Lanigan, Mr. Consul General, and all the delegates present. Thank you very much for inviting me to address your meeting today, and my sincere apologies, I can't physically be present in the meeting in the room today, but my program just couldn't fit into the travel to and from center. I've been asked to make some opening remarks for this workshop, and I hope there will be some robust discussions, proposals for tangible interventions, and that you will achieve the objectives of the workshop. South Africa is in the process of transitioning to national health insurance. The bill has been passed in Parliament last year. One of our key objectives in the national health insurance is to ensure that all citizens have access to good quality health services, and that includes health products, irrespective of socioeconomic status. In other words, no financial barriers to healthcare access. So as we transition to our national health insurance in this country, a stable and predictable supply of health products is critical to enable equitable access to health. But we cannot talk about equitable access without the other two pillars, which are availability and affordability of health products. These three pillars, access, physical access, availability and affordability, are important to realize improved health outcomes, to narrow the gap of inequality, and to position us to better respond to health crises and threats. Underpinning these three A's are principles of quality, safety, and efficiency, and it's the responsibility of national regulatory authorities, and in our context, SAHPRA, whom we're very proud of, to ensure that the medicines registered and moving through our supply chain are of good quality, are safe and efficacious. Public health is currently faced with a plethora of challenges. Just a few, for example, South Africa continues to be challenged with a quadruple burden of disease, which includes communicable diseases, the growing threat of non-communicable diseases such as obesity, diabetes, and cardiovascular disease, an epidemic of violence and injuries. In the South African development community, we face a trio of communicable diseases, HIV, TB, and malaria, and a rise in non-communicable diseases. And globally, as we all know, there's threat of more emerging infectious diseases. According to the WHO, 1 in 10 health products are falsified or substandard in Africa. So we have a lot of work to do. And in terms of this, the SDG 3, we have 2030 as our target year to end the epidemics of AIDS, tuberculosis, and malaria, and to reduce by 1/3 premature mortality from non-communicable diseases. To respond to all of these public health security threats, we require cutting-edge innovations and a health system that is agile and responsive, and regulatory systems that are stable, well-functioning, and integrated. COVID-19 highlighted to us the urgency for us as African countries to be self-reliant. We need to organize ourselves and to collaborate to mitigate, detect, and respond to all threats. As we work towards achieving the 2030 SDG goals, we need efficient systems in place to fast-track the registration of new novel drugs, regimens, and to increase the number of generics. This will also then drive down the costs of health products for us. We need to coordinate and intensify efforts for market surveillance to curb the emergence of substandard falsified medicines in our supply chain. As SADC countries in particular, we have disparate regulatory functional capabilities, but we need to streamline our processes, leverage each other's expertise and capabilities, maximize the use of our limited resources by reducing duplicative regulatory processes and the time taken to grant marketing authorizations or registrations. As of October 2023, it's only South Africa and Tanzania that have obtained the WHO Maturity Level 3 certification as benchmarked against the WHO Global Benchmarking Tool. In 2014, the African Medicine Regulatory Harmonization, or AMRH, was launched, and they launched 11 centers of regulatory excellence covering 8 different regulatory functions. The purpose of these centers of regulatory excellence is to provide training programs in regulatory science, promote operational research, and contribute to skills enhancement. 3 of these centers are located in SADC, focusing on quality assurance and control and medicine registration and evaluation. These achievements indicate that as a region, we do have the capability and can certainly optimize synergy to foster innovation and achieve our collective goals. Harmonizing regulatory systems and functions across the region through collaboration and cooperation can contribute to faster access to quality, safe, and efficacious health products. Regulatory convergence and harmonization will yield multiple positive benefits. For manufacturers, for example, reducing duplication and dossier submissions and shorter timelines for approval. For patients, for example, contributing to the improved access, availability, and affordability of quality health products. And for enabling resilient health systems by facilitating access to quality assured, safe, and effective medicines and other products. Furthermore, harmonization can be an enabler in fostering local and regional manufacturing and pooled procurement. These initiatives can contribute to reducing the cost of health products. So in the next 2 days, although I'm sorry I'm not able to join you, may we have honest and robust discussions and find synergies and opportunities to improve efficiencies. Unfortunately, I'm not going to be able to stay the duration of the workshop, but I'm sure I'll get lots of feedback from Dr. Sameti and the colleagues in the room. I thank you and wish you well.
Well, thank you, Dr. Crispin, also CG Spera, and also Heather for those wonderful opening remarks. So one last point before we get started. We would like to thank a few organizations that have been essential in the success of this workshop. And here are their logos. The Innovative Pharmaceutical Association of South Africa, the Southern African Medical Technology Industry Association, Medical Device Manufacturers Association of South Africa, Southern African Laboratory Diagnostics Association, Federation of African Pharmaceutical Manufacturers Associations, and the University of Cape Town. So without further ado, I'd like to start the first session, which will be called Lessons Learned from Zazibona, Where to Next? So I'd like to invite Kirti Narse, from the Senior Advisor from Corporate Council in Africa, to introduce your panelists.
Good morning, everyone, and welcome to the first session of our Pharmaceutical Day of the workshop, where we will be discussing lessons learned from Zazibona and where to next. So I'd like to, at this point, invite the panelists to join me on stage, please. So we're very privileged to have such an exceptional panel here, both with representatives from the private sector as well as heads of regulatory agencies from around the region. And we will be taking a few steps back to look at what has the progress been made with Zazibona, what were the early beginnings, what were the lessons learned, the challenges experienced along the way. And then private sector colleagues will also share with us some of how they viewed and experienced the Zazibona processes. We'll then end off the session, we're talking about where to next. How do we really institutionalize regulatory harmonization within the region? What is the vision that everyone has on how this process will work and eventually be incorporated into the African Medicines Agency, which, as we all know, has a continent-wide network. So I'm going to ask our panelists to briefly introduce yourselves before we get into the discussion.
Good morning. My name is Ntsotsolele Kaho from Botswana Medicines Regulatory Authority. I'm a manager for human medicines. Thank you.
Good morning, everyone. Thank you for inviting us. My name is Tumi Semente, and I'm the CEO of the South African Health Products Regulatory Authority.
Good morning, colleagues. Thank you for the invite. My name is Christine Ledimo, and I'm the Regulatory Affairs Senior Director for MSD, covering the entire sub-Saharan region.
Good morning. My name is Lorraine Danks. I'm a consultant with the Bill and Melinda Gates Foundation, working very closely with Dr. David Bukanga on our African regulatory system strengthening work. Thank you.
Good morning, everyone. My name is Francina Nambahu, and I'm the Registrar of Medicines from the Namibia Medicines Regulatory Council. Thank you for having me here today.
Thank you for those introductions. So with that, I'd like to get straight into the discussion and start off with the first question to the panelists. Maybe we start with Namibia and Botswana, who are founding members of the Zazibona process, to take a few minutes to reflect on what was the journey that you experienced in terms of implementing Zazibona. Maybe share with the audience some of the early beginnings, some of the challenges and opportunities that we experienced. Maybe Ms. Kaho, if you could start.
Thank you. I guess at this point I'll just go straight into the Zazibona, the topic of today. I thought I'll have an opportunity to talk about my authority, where I'm coming from, but looking at the time, I'll just go straight into the Zazibona. As we know, Zazibona is a collaborative registration procedure for the SADC. It started in 2013. Botswana was fortunate to be one of the 4 founding member states. So the Zazibona name came from Zambia, Zimbabwe, Botswana, and Namibia, which were the founding member states for the initiative. So it started in 2013 in Namibia, and at the beginning it was a pilot. It was supported by WHO, World Health Organization. It was the sponsor. So it started as a pilot in Namibia. Then later on in 2015, it included all the SADC member states, the 16 member states. And at the moment, there are 13 member states that participate in the collaboration, and some are coming as active. Active member states will be the ones that are actively doing the assessments of applications. Others are coming in as observers. So in the beginning, it was not easy, because we came as different countries with different registration requirements to the first meeting that occurred in Namibia. So at that meeting, that's when we decided that it's very important to harmonize our registration requirements, because we came in with different types of applications. Namibia came with their requirements, Botswana, Zimbabwe. So then we can imagine the pain that the applicants were going through in compiling those different applications to satisfy each country requirements. So at that meeting, we decided to harmonize the requirements. We even harmonized the assessment templates. That's when we came up with the SADC common technical documents, which are current requirements for Zazibona, registration requirements. So the only difference will be module 1, which is country specific, but most of the documentation is similar for all the country. So at that meeting, we saw the importance of collaborating. We saw, because it benefited us as countries, because some of the documentations that were coming were really not necessary, were not helping in the review of the submissions. And that time it was paper work. You can imagine the number of submissions. We were still using those papers. That's when we decided to go into the electronic submissions and allow applicants to submit at CTD format. So it was very important because we came as different experts. Some of us didn't have the required skills to assess, but with WHO facilitations, because most of the initial sessions there was a lot of training, because there was need for capacity building for assessors that was identified. So most of the Zazibona initial stages, it was mainly trainings and joint assessment, where we'll be able to assess together and discuss applications together, assess, and then second review each other and learn from each other's assessment reports. So it was a good platform for capacity building and also for stakeholders, because I think at that time we were able to consolidate questions like assessments that went to applicants. We were able to come with a common list of assessment, list of questions. So I think the applicants were also in a position to learn from our assessment outcomes what is required in the harmonization or what information is critical to put in a dossier submission. So, I think
Yes, thank you for that. I would just like to start off by saying that Zazibona is really a great initiative which created and established confidence in regulation of medical products and related substances within the SADC countries, as highlighted before, the first 4, and then now a wider network. For Namibia, for example, at that time we went from having one assessor who was trained through the Zazibona initiative. So what it really presents is a cascading of expertise. Through that one expert, we're able to train and employ and grow the number and the capacity. And I think that's one of the biggest wins for SADC, in that we are able to develop expertise within a limited resources setting. We don't have to send everyone to the Harvard of regulations, but with one, we're able to cascade and create more assessors, more GMP expertise through the SADC initiative. We have also been able to improve cooperation within the member states of the region, and the network is greatly beneficial to the country systems. For example, when we started with our regulations, the exposure to the SADC forum and eventually also to other world forums of regulations has enabled the country legislative reforms to improve, in that we are learning on the ground, and with those learnings that we are picking up at these forums, then we are implementing at country level. And as we have gone, we were able to really, in a confined space, better our legislative framework within Namibia. And I think this is also replicated in other countries within the SADC and Zazibona initiative. Also, the building of trust within countries, and I think this trust also enables and facilitates access to medical products. We are able to rely on what other member countries or other member states have done and rely upon that regulatory decision. For example, in Namibia, we have SAPRA and Zimbabwe as countries that we rely on. And I think that trust has actually enabled and continues to foster and increase access to medical products for the people in the region. Also, the networking with other agencies within the region. But what Zazibona also has done is that it's able to bring the world to Southern Africa. Through Zazibona, there are networks created through the Zazibona office, which then at country level are also beneficial to improving the regulation of medical products and related substances. Farm access, for example, and many others are good examples that not country specific, but through a region, and that is beneficial in that many more can benefit through one email, one phone call, or one initiative instead of individual countries approaching partnerships. So I think it enabled that smart partnership, and that also cuts cost and creates a better framework for working and benefiting a whole lot more countries within one region. Also, I think what we can also add is that the expertise development within SADC and within Namibia, where expertise have been achieved to assess specific molecules, vaccines, biologics, and so forth. And this is also through the larger network that is created through the Zazibona initiative, also with the WHO, and that link is a train that takes us to many other platforms that we're able to develop our frameworks. And all in all, really, it's just that Zazibona it's our starting point, and it has grown and grown. It's also giving us the confidence to do better and improve from where we have been. At country level, we can see the changes, and that's why we are yearning for more, because we know where we're coming from, and we know definitely where we want to go and end up. Thank you.
Thank you for that. Dr. Sameta, I want to come to you. South Africa joined Zazibona a little bit later. What was your experience in joining the process once it was a little bit more established? And Francina also mentioned key issues about work sharing, collaboration, and trust. How do you think that these factors have evolved over time?
Thank you. So, I mean, South Africa's experience has certainly been a pathway that is beneficial to us. Within our Act, we have built in there that we will participate in collaborative review platforms, but also adopt reliance. And so being able then to participate in this regional program has been beneficial. It does have its challenges, and we engage quite often as heads of agencies around some of these, and I'm happy to touch on those a bit later on. In terms of trust, I mean, certainly, as Francina says, being able to, as Africans, sit in a platform wherein we're all looking at the same common dossier, where we've tried to harmonize the requirements where possible, particularly for Module 2 to Module 5. I think just being able to have that capacity on the continent, as we are one of the regional economic areas that are doing this collaborative review platform, has been beneficial, because one of the conversations that we're having is the need for us to strengthen the regs, because we realize that even if AMA will be in place in future, you will always have a need for recs. There'll be certain products that you do want to go through such a mechanism. And again, because we all have limited resources, we have to leverage on all of these different review platforms.
Thank you. Christine, maybe you can comment what has been the experience of the private sector in navigating the Zazibona processes.
So maybe firstly, I just need to share that from an industry perspective, there are certain elements that will make joint assessment procedures, as in Zazibona, attractive. And the first one, which is a major one, is the harmonization of the regulatory requirements, and also just in support of the AMRH initiative. And short approval timelines, again, because we understand that it's joint assessment, it's work sharing, and this should cut down, and the experience from industry is that the approval timelines should be shorter. Submission over one portal, I think also Zelena touched on this to say that we also submit, it's one dossier submission, and we only receive one set of queries from the regional regulator. And resource optimization, it's something that is very important for us as industry, as we do recognize the resource limitations that we have in the African continent, and particularly in the SADC region. And what has since happened since then, there was actually a survey that was conducted with industry to try and find out what industry's experience was specifically with Zazibona. And of course, most of the offices in Johannesburg, they do also manage countries which fall under other regs, like EAC as an example. But from a Zazibona point of view, industry did agree that there was harmonization of requirements from a regional level, and generally speaking, although approval timelines were not exactly adhered to, they were definitely seen to be much shorter as opposed to submitting and following the national submission pathway. And it was also seen that there was an optimal use of resources. There were, however, challenges with the process. I think having highlighted what really worked with the processes, and some of the challenges that were noted was that although one dossier was submitted via Zazibona, once it got to the NMRA level, it was seen that some of the regulators were reviewing the dossier all over, and applicants were, receiving additional queries, and I'm not talking about country-specific queries, it could even be in Module 3, that would then be seen as though a new technical review was being conducted in that dossier. And in the countries that also didn't do that, there were not clear timelines in terms of when the registration certificate can be issued. We have seen a difference where some national regulators issued their registration certificate within a year, and for some regulators, 6 months would go by where you're trying to locate someone who would be responsible to issue that certificate without success. And our interpretation was that there was somehow a misjointment, whatever term I'm trying to use. There wasn't a clear joint between the regional and the national procedures, that although the regional procedure worked, but once we get to country, there aren't very clear guidelines that link the national requirements to the regional ones. And another concern was that perhaps there wasn't that much of a transparency. Applicants were not able to plan because you never knew how much the regional procedure would take, although we're saying that it was still, generally speaking, shorter than the national procedure. But there weren't very clear and timelines that were adhered to both at a regional and the national level. But I think also, as the other regulators have shared, we really have come through a long way from there. And as we're speaking now, there is a pilot that is ongoing on cost recovery, centralized procedure. And I think it's something that I'm quite excited about, industry is excited about, and we're looking forward to see what the outcome is going to be here. I must also state that there was very little to no engagement with industry, but as of 2022, there's been a lot of stakeholder engagements meeting together with the Zazibona coordinator, and it's really just yielding great results. Industry is understanding. I think there is a trust that is built. There is value proposition on industry to want to really participate in this initiative, and I think time will tell, but we're really just looking forward to this pilot and to see the improvement. Another thing, I know this afternoon there'll be a session on digitalization. There's also now portal, things just seem to be more digitalized. Again, just exciting time for us as industry, and just looking forward to the positive outcome of this pilot.
So if you don't mind, can I just add 3 points that I was going to make later on? So I think the point on the pilot is an important one, because we recognize that the initial mechanism where it was almost like a decentralized submission was not optimal. We didn't have the tools in place to track and coordinate, and hence this pilot, and we're hoping that with the implementation of the pilot, it will truly be a centralized submission, and you will be able then to track your application throughout. The second point is around the recommendations, and it's a challenge that we've recognized, and even with AMA, it probably will remain a challenge until we have a mechanism of how to address it, is the fact that recommendations from Zazibona are not binding. So it's still up to the member state, and it will be the case then with AMA, until we come up with the mechanism of saying, how do we make this binding? Because we always get questions from industry to say, why would it not work like EMA? However, the European laws are such that an EMA recommendation is binding, which is what we don't have in our context. So there is that conversation taking place within AMRH to say, how are we going to tackle that? The third point is the issue of country-specific requirements, and it certainly can be a challenge. And again, it's a conversation we're having, but we will always have in Module 1 primarily, country-specific requirements. But the key thing that we've recognized is that there must be transparency then around those requirements, so that then that even post getting a Zazibona recommendation, then what South Africa would require or what Botswana would require. So I just wanted to add those 3 points.
Thank you. Lorraine, you've been in the private sector now with Gates. Can you share some reflections on the Zazibona process, as well as some of the key issues that have been brought up of regional versus national, trust building, transparency, etc.?
I think many of the points have been touched on, but I speak from also experience in industry and with SAPRA, so I've seen both sides. Firstly, I just want to say that from a partner or funder perspective, Zazibona has been really, it's been a great success. They celebrated their 10th anniversary last year, and they've really recommended quite a huge number of products over the last 10 years. They've grown their membership from 4 to about 9 with some additional observers. So really, I think funders feel very comfortable working with Zazibona and want to support them. Yes, there has been successes. I think one of the main areas, or the one driver of success, was the heads of agencies. The fact that they invested and drove this initiative. There was a lot of buy-in from them, and it still continues. They own the initiative, and I think that was a huge, success story because of that. Also, driving this initiative through a hosting agency, with that hosting agency really playing a key role, has really that whole setup has really worked well. There has been challenges, as we said, the last mile authorization at NRA level. whether this is sometimes due to lack of digitization within the NRA. You know, they can't track these applications, they go back in the queue. You know, that's a real reality. And also, some NRAs use a FIFO approach, first in, first out. So regardless of, you know, whether it's a Reliance or a Zazibona application, it has to wait its turn. So those are issues that need to be resolved if one wants to see those timelines that Christine is referring to. You know, much shorter authorization at national level. And again, we spoke about the requirements, the additional requirements. It just highlights the fact that, you know, there's a need for harmonization. And the closer we can get to harmonization, the easier it will be for everyone. So those are points I wanted to make. And I think one of the main challenges, especially when you're coming from the funder perspective, is the, you know, the financial self-sustainability of this initiative. And that's the one thing I think also that there's been an active drive, Tumi knows, she's sitting on the financial committee, but active drive to make Zazibona self-sufficient. They've always had their GMP fees, but now also they've introduced a fee for MA, for marketing authorization. And that slowly but surely will make them stand on their own feet, and the funders can then pull back. Thanks.
I want to pick up on Dr. Samete's point on country-specific requirements, country-specific legislation. So we know that Lesotho has published its bill recently, and a lot of these country-specific requirements that companies need to comply with are actually in the principal medicines legislation. How do you see that evolving over time? And this is a question to the regulators. As we move towards more regional, economic community level processes, and then finally culminating into the African Medicines Agency. I know this is a challenging question, but I think it's a challenge that companies have to navigate in the present time on moving from regional to national processes to get marketing authorization. So, comments from the regulators. Maybe we start with Botswana.
Okay, thank you. I think currently our legislation, we've been trying to review them through the WHO benchmarking tool so that we are more aligned. Hopefully, most of us will align to the GBT tool. And as Botswana at the moment, our main from the country-specific guideline, the one that is giving us a lot of challenge, is mainly to do with the labeling requirements. That's where the challenge is. But as a regional bloc, we are trying to work on harmonizing the labeling requirements, which is the main one that is coming out to be a main challenge when it comes to country-specific requirements. So,
I mean, absolutely. The issues that a lot of these are either in our regulations or in our laws, right? So we cannot just change it overnight. It would need some kind of reform. But that said, I think there is a recognition that you do now have these differences. So you mentioned the labeling. In our case, for example, is the requirement for BE studies against the originator, which you may not necessarily always have. So it does pose some challenges, and other countries don't require that. And so I think we don't have an easy answer to these, but there is a recognition that at some point we will have to harmonize around those, and it therefore then needs that, together with our technical teams, we have discussions around this and really look at it from a risk-benefit perspective.
Yes, I will continue from where Timmy left off to say that there is recognition that the differences do exist, and I think what's important in legislative reforms is that the legislature should be willing to actually work with you to make this necessary reforms. For Namibia, for example, we hard at work advocating for the need to amend the legislation within global standards, like Botswana said, the GBT. We're also looking at the AU model law on the regulation of medical products. So without, I think the two prerequisites for this also is a political will, and where we're actually finding the harmonization initiative of SADC within the SADC setup. That's also a good advantage that we find ourselves within a political organization, from where we can also lobby to say that the country-specific legislative reforms are important to take place, to allow for harmonization within a legal framework to also follow suit, so that maybe 5 years down the line we may not be talking about these differences, that we are able to all seamlessly adopt what other countries are doing, and not only within the region, looking at where the research and development is emanating from. Perhaps after the regional cluster is sorted, we also need to look at what is happening elsewhere, so that we also play along with that, and pandemic preparedness, for example, as well. We have to speak in one language. The RECs, yes, but also globally. We all have to get there. So I think in short that was what I wanted to submit: political will, advocacy, and also the role of WHO and other regional and global players in the regulation of medical products. Thank you.
Thank you. Christine, would you like to comment from a private sector perspective?
I think Timmy did mention something very important about sovereignty, and I think as industry we do recognize that, and we do recognize also that we're dealing with a heterogeneous legal system where we're not able to just chop and change things as we see fit. I must also just take us back to COVID-19 pandemic and to see what happened. It was paramount that we get medications to the patients as soon as possible. And for this, I think it becomes very important for us to have a robust and adaptable and a strong regulatory systems, also understanding, taking into consideration sovereignty and the processes that needs to be followed in order to change legislations. Having said that, we just still want to put it forth that our aim is to make sure that patients are able to access the medicine that is required, and that for this we are also understanding also that there are procedures that need to be taken before laws can be changed and regulations can be updated, that we maybe just have some flexibility in the process for specialized medicines. You know, for example, if it's an orphan medicines, it really would be a shame that, you know, due to some law, we're not able to provide the medicine. All we are just saying is that we perhaps just need to be adaptable. We need to be proactive. There are a lot of activities that we know are happening worldwide where there's been a lot of progress that, you know, perhaps as a region as well, we need to be forward thinking and already start planning ahead of time before we are faced with these issues. I think another thing I wanted to mention, sorry, Katie, from just the previous discussion was just regarding the fee for service. So with this Zazibona pilot, there is a fee that has been implemented, and we also do appreciate the fact that for all the years, although there was no fee, the Zazibona pathway continued for the past 10 years without a fee, and now with the pilot, a fee will be implemented. And generally speaking, industry does support the fee, but we are asking that the fee needs to be transparent. Again, we need to be well aware of the requirements. If we're submitting a dossier regionally, it needs to be clearly communicated from a national point of view what additional information will be required, we are finding ourselves just being surprised. We do know of a standard list, but now and then there's additional information that is requested, and also just transparency in terms of the timelines where we will be. We do want it to be very sustainable, and I think Lorraine made a comment to that, to say we are in support to make sure that Zazibona is a standalone entity and it's able to sustain itself financially. And also on that point, we do support institutionalization of Zazibona as well. We do want the process to be simple, but we also want it to be very flexible, where it's required that perhaps the regulators can look at giving applicants waivers. And again, all of this is to make sure that patients are able to access the medicines that are needed.
So, Christine, just to follow up on that, you talked about the fact that in the early part of Zazibona, industry engagement was not where it should have been, and that things have improved significantly since then. How do you see industry engagement evolving even further to ensure this flexibility and adaptability that you refer to?
So I think, again, everything boils down to trust. I think, there just wasn't trust. Generally also speaking, there was a bit of suspicion around the process that perhaps certain applicants who were based in certain countries were favored over, there were just a lot of speculation. Again, it's because there was no collaboration. And really what we have seen from 2022 is that things can only get better. The initial discussion on 2022 was just to align and say, what is this all about? What is industry's frustration? And we have seen the discussions from 2022 to 2023 move into the suggestion of implementing this fee, which industry did support, but said that we are supporting a fee for service. There need to be an equivalent service that is provided to industry. And from then we have seen now this year, we've seen the pilot has been implemented. We've also had a stakeholder engagement meeting where we spoke about the digitalization, the centralization of the process. So I've only shared what has happened in just less than 2.5 years. So we're really looking forward in anticipation in the coming years, and even just improvement of the current digital system and the portals, how things will improve from here. But for now, we're not seeing, there isn't anything that is alarming on us in terms of the procedure, because we're just seeing improvement year after year.
Great. You want to add something? Okay. Lorraine, you are now with the Gates Foundation. What is the role of Gates in this process in terms of capacity building, process improvement? Maybe you can share with us what you are focusing on at the moment.
Look, it's not just the Gates Foundation that supports Zazibona, but I happen to be on the panel, so I don't mind speaking to it. But the foundation has been integrally part of Zazibona's journey over the last couple of years. Generally, the foundation funds the quarterly joint assessment sessions, virtually or in person. Also, we have funded the metrics tracking system, the portal that's been spoken about. So, but not just from a financial perspective, but also hopefully as a thought leader. And also rallying support, other support for Zazibona. I think the first partner that was there was WHO, who really assisted. So if you look at all the stakeholders, it was really a multi-stakeholder approach to get Zazibona where they are today. We had AUDA NEPAD, a lot of interaction with various stakeholders. But again, I think key to all of this was the heads of agencies. They really drove it. They actively sought support from the different partners. That's basically where the foundation is coming from, what we're supporting. But like I say, we are only a small part of the cog, and there are many, many other partners supporting. Thanks.
I'd like to open up to the audience to see if there are any questions from the audience.
Thanks very much for the panel and the discussion. My name is Mandy Swanepoel. I'm from Westgrow, a Western Cape trade and investment promotion agency. And I recognize the role of the regulator, and you guys are often stuck between a very hard place, a rock and a hard place, being responsible for patient safety and products that are entering the market, but also getting the resistance from the industry to try and be economically viable and access or provide the access of the products to the patients. What do you think, as a collaborative, is most needed for you guys to be efficient and respond to both the need within the legal parameters as well as the industry requirements? So do you need funding? Do you need capacity? Do you need support? Do you need more harmonization? Do you need advocacy for legal changes in order to be efficient and responsive? Thank you.
Who of the panel would like to take that question?
I'll give it a shot. Yeah, I mean, there's a few elements in your question, right? I think in terms of what we need, and Lorraine alluded to it, thought leadership partners, because we don't operate in a vacuum as regulators. And while today we're talking about Zazibona, but as partners, and I'm sure that question will come later, what support can we ask for from USTDA? We've been fortunate in getting support from them. But if you look, there are other collaborative review mechanisms across the continent. You look at the Access Consortium, you look at Project Orbis, that involves some of the established regulators. I think what would benefit us is being able to sit in a room with them and understand how they tackle issues such as local requirements, because they do have that. How they were able to establish some of these platforms, but also how we can participate in that. So I think it's the Access Consortium that looks at oncology products, and it involves like the FDA and a few others. And a question would be, why can't we have one of the regional economic areas like Zazibona or one of the regulators participate in that? Primarily, if we know that those products will come to our countries at some point. So if we then are either observers or if we participate in that review by, say, Health Canada together with FDA, by the time we receive it, we're then more familiar with it, and we can then apply reliance. So I think kind of facilitating those types of engagements would certainly be beneficial. And then again, lobbying, various stakeholders, particularly from a legislative perspective. It's always beneficial when industry can put their voice on the table, and a range of other stakeholders. I mean, if I look at reliance, it certainly is a mechanism that has yielded efficiency. In our regulator, we're seeing that we are applying reliance to about 30% of our applications, which is not optimal. And so I guess an ask to industry here is around, again, as you engage with your headquarters, etc., ensuring that when we do then require reliance documents, we can then get them on time. So it's I guess a lot more collaboration and thought leadership partnership is important. That's my view.
Yes, and if I may add to what Timmy has said, really, if I can just say seamless access to information and other regulators. If we, for example, have to look at the concept of reliance, it's very, very difficult for some authorities to have a connection to another authority. How do we break that barrier? Instead of it taking me 2 months, can it take me just an email and I know where to land so that I can facilitate for the patient because I think the access to information within other regions and with other regulators is really a stumbling block for enhancing and facilitating access to medicines and medical products for the region. And also within other regulators, it doesn't have to be medicines, customs, for example, and so forth. Alignment, because in order for me to tackle falsified and substandard medicines, I need a network within other regulators. If we can somehow get a way of collaborating and really aligning the laws or the guidelines or the policies at country, international, and global levels to help facilitate in whatever way the regulation of medical products would actually be beneficial. We have, I think I had a conversation with South Africa, and it's like Namibia's coastline is so long, it's so big. How do I regulate appropriately? I need to rely on the customs or any other enabling body, the legislative or the criminal law in the country. What is it saying with regard to regulations of medical products? As a regulator, I could have the perfect law, but if it's not aligned to anything else in country, it becomes pointless. And I think that's also one of the challenges that we are experiencing, that let regulations not only consist of boardrooms of medical regulators, but we need to bring other players to the table so that we have a one-stop solution for everything.
Sorry, could you?
Yeah.
Can I just make another comment? I think it talks to what you're saying, Francina, is talking to expanding Zazibona's mandate, you know, into pharmacovigilance, market surveillance, you know, those kind of areas, because it's only when you work together as a SADC region that the scourge of SF will be, you know, eradicated. Thanks.
So, Dr. Samete, what are regulators doing to collaborate with these other entities like customs, port health, etc.?
I'll talk about the South Africa experience, and it's probably similar with others, particularly for post-market activities. It's so critical that we work with a range of stakeholders. The issue that Francina talks about of falsified and substandard products. So for us, the Border Management Agency is an important stakeholder, the police services, the Hawks, and also now there's a matter that we're dealing with SARS around in terms of the tariff codes, aligning, you know, their act with the Medicines Act. Because many a times what you're finding is that there are elements that we would have in our act that don't necessarily align with what's catered for in other acts. And so these partnerships with a range of stakeholders is important. Another important one, Dr. Chris spoke to it, is our National Department of Health. So, you know, for us, collaborating with these stakeholders is critical to create awareness of the Medicines Act. If I look at the police services, you know, when there's a criminal case that's opened, because they're not familiar with the Medicines Act, some of the cases don't even go far. And so we've seen that we're going to have to train a lot of them on the Medicines Act specifically. So within particularly any post-market surveillance, you cannot do the activities alone. If I look at, you mentioned vigilance, we have to work if I take the vaccines as an example, we have to work with the EPI program, we have to work with the NISAC. When we did that very well during COVID, and we were able to deliver so much around vigilance. So we're very intentional about establishing these partnerships. And in addition, having MOUs then with regulators around our borders, and we've been working on this quite a lot, because we understand our borders on the continent are porous. So it is important that we collaborate with other regulators.
Ms. Kacho, would you like to comment as well?
Okay, I think they've said it all, but what I wanted to add to the question is like, as a region, we have harmonized registration requirements, and we want timely access of quality medicines to our patients and ourselves. So the stumbling block in reducing the timeline is mainly I don't know whether we need to engage more with the stakeholders on the requirements, because some of the information that is there, the delay is due to applicants not meeting the requirements, like the bioequivalence requirements that Dr. Whitmel has mentioned. So we have clear guidance on what is required for bioequivalence study, what is required for stability studies, and more often we see ourselves sending out the same list of questions to applicants to meet those requirements. So maybe there is need to engage our stakeholders on harmonized requirements on exactly what they need, what information is required to reduce asking a lot of questions. So if we can harmonize and have our stakeholders understanding the registration requirements. Thank you.
I'd like to go back to the audience to see if there's, okay, Ernest?
Hi, I'm Ernest Darko from the Broadreach Group. My question really relates to the element of institutionalization of, for example, something like Zazibona. And often found when you have initiatives like this, it also ends up becoming very person dependent, not necessarily systems dependent. So my question is to the regulators on the stage, were any of you not involved in Zazibona at the beginning and then came into your role, had to inherit it, and then how did you get onboarded into it, that you are this engaged with it now? I'm just curious, or were all of you involved from the beginning? I'm just curious as to that.
No, so for example, South Africa was not, we joined much later. And I think what has been helpful is the model that Zazibona has, which is different to the other regional economic areas, in that Zazibona is hosted within a single regulator, being AMCAS in Zimbabwe, and it's got technical staff that's supported and focal points. So from a kind of operational approach, it was certainly seamless to participate in it. Yes, the matter that I raised earlier in terms of a decentralized submission made it difficult, because then we didn't have our own internal mechanism to track Zazibona applications, and that's why we're quite excited about this pilot, because it will start to enable us to do that. And so two things. The first is having the head of the agency really committed and buy in and support this is important, but also then having the tools and the processes in place. You know, you can't manage what you don't measure, right? And it becomes difficult then in the case of Zazibona, when we couldn't measure what's coming in, what should then be finalized, because we didn't have those tools.
Yes, and if I can also add, is that for Namibia, for example, being a member state that started the initiative, it's more or less like it's a backbone. So when it's your backbone, you have to continue, and you understand, you build it within your process, and really recognize that it's enabling you to do better. So whoever then comes after, whenever, is that it's in there. It's imprinted in the work stream of the authority, and also within the SADC. I think we working made a submission to the Council of Ministers to imprint Zazibona within the SADC framework, that it is there, and not for now, but for more generations to come. Yeah.
Any more questions from the audience? Jeff?
Hi, thanks, Kirti. I'm Jeff Sturcio. I'm a board member of the Corporate Council on Africa. And you know, I've worked on and off on these issues for many years. I used to work for one of the large pharmaceutical companies active in Africa. And I have a question for you that relates to the broader program of African regulatory harmonization and the advent of the African Medicines Agency, because you've touched each of you has touched in different ways on the challenges of getting harmonization within SADC. That alone has been, you know, it's taken a decade and you're making good progress on it. But you've alluded to the fact that the other regional economic communities have their own harmonization processes going on. And ultimately, you're going to have to come together, either under the auspices of the AU or on the basis of the individual RECs working jointly together to solve the harmonization problems that are still there. So I wonder if you'd reflect on what you see as the path forward, because that's going to have to be done if the AMA is actually going to be a functioning entity in due course.
No, thanks. I mean, that's a great question. So at the moment, what's taking place around MRH, when was it established again? 2015 or so? But so there's the African Medicine Regulatory Harmonization Initiative, which in essence involves all 55 member states. It is supported, or the secretariat is Alda Nepad. And through MRH, we've developed guidelines that would be applied across the continent. And so we're operating with the mindset of saying, while we focus on harmonization, a lot of what we're doing within MRH can be the foundation laid for AMA in future. So at the moment, we've got technical committees that comprise members from across the continent, focusing on the various areas, inspectorate, we have one on vigilance, we have one on clinical trials, AVRF, we have one on registration, and we actually even have one that looks at the legal structures in the different countries. And so all of these technical committees have put in place guidelines and processes, and actually we're running a pilot at the moment for a continental submission. And I think the issues of harmonization, we may be able to resolve some of them, but I think the biggest pain point is going to be that are we able to have the various member states implement the recommendation from AMA? And because again, legally, and AU obviously wants all the member states to have their own sovereignty, we are going to have to find a mechanism of how to address that. But certainly the REC mechanisms and the MRH mechanism has been important, has brought about important lessons for us of what it is that we need to tackle. Thank you.
Yes, and if I may also add, with the AMA Treaty, I think you have member states participating in the MRH without necessarily having adopted or signed the treaty. I think this is in principle with no one should be left behind, that there's no intention to leave anyone behind, and I think that's a good thing. With time, even though member states have not signed the treaty, they are carried along on this bandwagon of really harmonizing and learning from the good intentions of the AMA. Thanks.
Yeah.
Morning, it's Sybil Sioka from Emperor Resources. Regulators don't work in a vacuum, and you work in an environment that has got a lot of pressure from various entities and organizations. The biggest one being political pressure. Do you have strategies to rebuff such pressure? And I would like Dr. Dumi to comment, especially because they did experience it during COVID.
Thank you. Yeah, I never thought ever in my life I'll be faced by a sea of red berets insisting that we register a vaccine. But I think two things. Firstly, I will say that from our national government, we didn't receive any political pressure at all. The Department of Health was very clear that if SAPRA makes a decision, they will recognize that decision. We worked very closely with them. I think you will always have some kind of political interest. I mean, the US also faced it, the FDA had a lot of backlash. But again, you always have to make sure that you make decisions that are scientifically based. And that has, for us, stood us the test of time. In addition to the political pressure, you also get pressure from society. If you reflect on the challenges we had around ivermectin, a lot of pressure from even the healthcare professionals. We dealt with a lot of court cases. One most recent outcome was that we won that case, and they'll even pay back with costs and all of that. But what we have always been clear about is that we will make scientific decisions. If we don't have adequate data, adequate information to enable us to make that decision, we will not. What helped, as I said, is that the national government didn't have pressure, and the support we got from the Ministry of Health as well as our board. Some of the decisions that we made certainly were nerve-wracking. We consulted extensively just to make sure that we're making the right decision. But it is certainly challenging for the regulator, challenging for the person who eventually puts their signature there. We had to have security assessments at my house. We had to vacate my house. So those things happen. But the key thing for us was that we will make evidence-based decisions, and that seemed to have worked relatively okay for us.
No, I think even for Botswana, we didn't have any political pressure. We had political interest, of course, because during COVID. But at home, we have a provision for exemption. But to show that we didn't have a lot of political pressure, they made sure that for COVID vaccine, they required scientific assessment. They wanted them to go through the assessment, even though they could have easily allowed them in. So for COVID, they wanted the regulator to have assessed the vaccines. So I believe we don't have political pressure. Thank you.
Yes, equally for Namibia, I think respect for rule of law is always the baseline. I mean, that's why we hear saying that the legislative framework hampers. And I think that's why it's important that we tread very carefully in how we draw up our legislations, because in the end, that's all we will have to rely, and that will be our only backup. Gladly for Namibia, really, and legislature always makes provisions for unforeseen, and within that framework, I think Namibia was able to circumvent, and not to the detriment of the public, but in actual sense for benefit of public health. So where you have respect for rule of law, the arms of justice always also apply to regulations of medical products, and this is why even advocating for countries to amend or uplift or upgrade their laws, that's why it's a tedious process, because it has to be done carefully so that we forgo or we don't have the accusations that it was done under duress, because then it's transparent for everyone. Thank you.
Thank you. I think there was a question somewhere at the back of the room. Oh, we can't hear you. Sorry, can you get to a mic, please? We can't hear the question.
That the regulators were just giving answers looking at their respective countries. But as Zasibona, do you sometimes face with this political pressure that comes across the different countries? Because in some instances, when you phone a country, they'll tell you, this is not your country, when you ask about some maybe regulatory requirements and all that. So you get that pressure that comes from Sub-Saharan.
I think it was earlier submitted that after Zazibona has done its dues, it's upon the country to adopt and register that product. And I think my answer will be backed in that when we are making regulations, these are publicly available documents, including the legislation, where stakeholders, and this is I think in terms of partnerships, including marketing authorization holders, manufacturers, or representatives within the country or the region, that there's that window of opportunity to submit concerns in guidelines developed and the legislations that are being adopted in country. So, and in short, no, there is no pressure from within the region. It's really an independent decision by the specific authority to adopt and register a product. But also, if we look at health has no borders. So sometimes really where a decision is being made for the region, I don't think it's a bad thing. A good decision, for example, where you have a pandemic and SADC, Council of Ministers then decides that this is the recommendation that A, B, C, and D be done for public health. That's the only perhaps scenario, but without pressure, obviously, in consultation and also backed up by science. Thanks.
Any additional questions from the audience?
If there's no other questions, if I may be allowed one more question. I think one of my big concerns is, with the fourth industrial revolution, we're going to see an explosion in new products, new tech, both medicines, devices, etc. And what really concerns me is, right now we're struggling to play catch up on what's already there. But yet what's coming is, I think, going to be almost like a tidal wave of things we need to, again, be able to assess, regulate, legislate, etc. And I'm just curious in terms of the approach that we're taking at the moment. Are we taking an approach based on we're trying to close current gaps we're seeing? Or are we taking an approach where we're looking at what's coming and saying we're preparing for, in essence, the future? Well, which is kind of the present, to be honest, right? But so I'm just curious in terms of the balance of how we're thinking about this, in particular as we're looking at Africa-wide harmonization, et cetera. Because to me, there's no point in creating something and then finding that it's inadequate then to still deal with all of these new things that are coming. And I'll give one example. I know I was part of a WHO working group that's now, for example, talking about some sort of process to register and regulate AI-based tools, for example. Right? And knowing the limited capabilities we have to do that, and if I say here's an AI algorithm, for example, that diagnoses pneumonia, who's going to do that? And are we preparing, in the strategies we're developing, are we preparing for that? Are we preparing still for old medications and old technologies that already exist? Just curious.
Yeah, I think that's the headache of every head of agency. It certainly is mine. So I always say to the team, we have to make sure that our processes are so efficient that we've got bandwidth to think about what's coming. AI is an important one, particularly now that we'll be regulating medical devices. The number of products that are out there for medical devices is much larger than medicines. Their lifespan is shorter than medicines, so you may regulate today and tomorrow, it's completely different because of a software change and all of that. So there's certainly an acknowledgement that we're heading into very complex areas. So what we have done, there'll be a few AI meetings for regulators coming up. I know the FDA is already quite, I wouldn't say advanced, but they're starting to address that. EMA is, and WHO is also developing some guidelines. And we're looking at AI not only for how others are using it for innovation, but also how we can utilize it internally to drive efficiencies. There's actually a project that we're doing supported by the foundation that's looking at how we can use AI to triage products, screen products, and all of that. Other important ones are cell and gene therapies. Again, we don't have mechanisms around that. So there'll be a meeting in Omaha sometime in May that we're sending some of our teams, again, to go and engage with some of the more resourced regulators where a lot of this innovation is taking place, and we then need to say, how do we respond to that? So I think within our regulator, there's certainly that awareness. Lastly, there is, so we have a number of engagements with industry, and one that I've also established is what I call a meeting with the captains of industry, wherein we talk strategy. And what I'm finding is that sometimes it's tough to talk strategy and the big things that are coming when you still have operational gaps, right? So we always kind of gravitate towards that, but I'm really pushing our local industry to have these conversations with us so that we can adequately prepare, because what it says is that our resourcing strategy is going to have to be very different. I mean, if I look at the skill sets we need in our medical devices area, I don't even think we have adequate skills in the country for the amount of products that are going to come through. So again, there is an awareness around it, and we are engaging with a range of stakeholders. And then lastly, from a regional and probably from an AMA perspective, is that what we've said, particularly because we understand that not all of us will have the required capacity and capability for some of these complex products, then these should then go either to AMA or to these regional platforms, wherein then you can leverage skills across the continent. So, the more kind of business as usual matters must come to the countries, and then some of these more complex ones more to AMA and the regional approaches. But certainly important deliberations for all regulators to be having.
Sorry, Gertie. Just to add on what Tumi is saying, exactly. Each level, continental, regional, national level, will have its own type of products that they would assess. There's already a guideline for a proposed guideline for the eligibility of products that would go through AMA. But not just that, the idea is that AMA will then also engage very closely with some of the recognized regulatory authorities, such as EMA. Should at the African level that expertise is not available, then there will be a lot of stakeholder engagement or RRA versus AMA engagements in order to be able to assess these products and also build the capacity on the continent. Thanks.
There's another question there.
My question is more of building on to what everyone else has been discussing, but I see that we didn't have a conversation on the other regional collaborative initiatives. So it's more to understand if Zazibona engages with the other regions, like your East Africa or West Africa, just to name a few. And if not, if they have any plans in doing so. And the basis of the question is primarily because when you see the successes and opportunities across the regions, they vary. So that would also help in Zazibona leaning into the successes of other regions for them to also succeed. Thank you. Yes, I think the platform to engage other regs has been established, especially through the AMA model, where you have expertise actually seconded or coming together from all regs. So AMA recognizes all the regs within Africa, and it now brings together those regs to discuss at continental level. And so then that cascade, the cascade will come from within the AMA framework to inform and share information among the regs. Yeah.
If I could add, there's also, so within the platform, so for example, the West African region, within their region, they also look at vigilance. They piloted a project for vigilance. So again, we're bringing that into Zazibona and saying, should we be, doing the same? So the platforms are there, and it's up to each one of us to say, how are you going to implement? And there's always learnings from each one of us. But again, to Francina's point, I think AMA will anchor a lot of what it is that we do, even from a harmonization perspective. I think it will certainly support.
Thank you. Unfortunately, we have run out of time. So I'd like to very quickly ask each panelist just in 30 seconds for any closing remarks. Francina, maybe you can start with you.
Okay, my closing remarks are really centered around information sharing, creating one highway to and from to everyone, to the better resourced agencies or organizations from where we can all learn from and from where we can all be capacitated better. Also that we are working within a streamlined resource place. So I think really what's important is that we carry along the countries to the vision of everyone being capacitated at the same pace within a limited resource setting. Thank you.
Thanks. I think it would be good to see Zazibona's impact on the health outcomes in SADC region. It is something that they're looking at doing, and it would be really good to see whether the initiative has, impact, especially when it comes to health outcomes. Thank you.
And for us is that we would really love to see alignment of the requirements both at regional and national level. As I've highlighted before, we are seeing challenges in terms of differences with the details and contents from both the regional and the national applications. We are supporting and advocating for common templates instead of country-specific templates. And again, I'm not referring to Module 1. We do have a clear understanding that those are country requirements 1. If we do not have this in place, it's just leading to duplication of efforts. It's going against what a joint assessment procedure is meant to be, and it just ends up taking us as applicants a much longer time to tailor-make our dossiers once it goes to the national regulators, and it becomes somewhat of a major roadblock. And we are just really looking forward to seeing regulations in country that will really just join the regional procedure and both the national procedures, and again just ensuring that we have expedited approval once we reach to the national level. Thanks.
Yeah, thank you. Thanks again for having us here as regulators. For us is to say that as regulators, there's certainly commitment to Zazibona. There's an acknowledgement of what's gone well and also what hasn't gone well. And we solicit support from industry on the pilot that we have kickstarted, but also solicit support in terms of compliance to the requirements, to the point that was made earlier. I think if industry and regulators can work well, in kind of along this pendulum, it'll certainly go a long way.
Okay, thank you for inviting us again. So for us, we are saying we are behind harmonization, and we call for more joint assessments, more harmonization of registration requirements so that we can ensure timely access to medicines. And we don't want to do duplication of work. So we should be able to rely on each other as regulators, and it can be made possible through this regulatory convergence. Thank you.
Okay, with that, I'd like to give a big thanks to all of and hand over back to our MC.
We're going to take a quick 9-minute break, just a coffee break. There's some refreshments right outside. So we'll like to just take a quick break and we'll see you back at 11:30. Thank you.
Good morning, everyone, and calling all those back at the snack station back into the room so we can talk about financing. Our session today, as Elizabeth, my colleague, mentioned, is on sustainable financing models for regulatory harmonization. I'd like to call up our esteemed panelists. We've got Marlene Rose Munsami, Head of Regulatory Affairs at Adcock Ingram. Please join us on stage, right over here. Chris Legrand, CEO of the Broadreach Group. Please join Marlene right here on the comfortable chairs. And then we've got a virtual panelist today, David Mukanga, Deputy Director of Africa Regulatory Systems, and he will be joining us from the Bill and Melinda Gates Foundation virtually today. We'll just give it a minute for our third panelist to join. Hello there, David. Hopefully you can hear us and we can hear you.
Good morning.
Wonderful.
I guess it is.
Perfect. Great. So the tech is working. So what we're going to do at the beginning of our session today is, in fact, thread the needle from USTDA's prior healthcare workshop, which we held in Nairobi. We've got a special video conversation that will kick off the session today from our colleague Peter Mamakos, who's the health attaché at the US Embassy in Kenya. He attended the prior session and has some remarks in regards to this topic, in particular around sustainable financing models for harmonization. So what we'll do is, before we kick off into the panel discussion, we'll just sit and listen to his video remarks, which will lay the foundation for the topics that we'll go through today. Thank you.
Thank you for inviting me to speak at this important forum on regulatory convergence for health products. I'm pleased to see this discussion following on from a similar successful panel discussion we held in Nairobi last year that was co-hosted by USTDA, US Department of Health and Human Services, and USAID. The COVID epidemic made clear that countries had become too reliant on very narrow global supply lines for health products. Moving forward, we know the diversification of global supply lines is critically important, not only to help ensure the availability of health products around the world, but also to allow for more equitable access. The Biden administration has clearly stated that it understands the importance of this diversification and it wants to help other countries to achieve greater self-sufficiency. One of President Biden's top advisors recently declared that our approach involves working with our partners to ensure they are building capacity, resilience, and inclusiveness too, and that we are unambiguously committed to not leaving our friends behind. We want them to join us. In fact, we need them to join us. When it comes to medical products, this diversification cannot be achieved without stronger regulatory systems. Strong national drug regulatory authorities are critical not only for patient safety, but for healthy competitive markets. For both the United States and African governments, building regulatory capacity is a win-win solution. Strong regulators can not only approve generic products more quickly in support of African manufacturing, but they can also allow for more rapid and efficient reviews of innovator products coming from the United States. None of this can be possible without a strong foundation of adequate financing for regulatory authorities. In the United States, we have transitioned over the past 30 years to greater reliance on user fees to finance regulatory activities through a series of reforms, including the Prescription Drug User Fee Act, also known as PDUFA. It's important to emphasize a few key points about these laws. First, the laws create a process for continuous improvement. They don't view financing or regulatory reforms as one-off activities. They build in an automatic review process every 5 years that must include extensive engagement with stakeholders, most notably with industry representatives. Second, the laws set clear metrics and targets that the drug regulator must meet on an annual basis. In fact, if FDA does not meet these targets, it will trigger an automatic reduction in the fees it can charge. In other words, FDA is held accountable for its performance. And of course, one of the conditions set by the World Health Organization to certify a drug regulator as meeting maturity level 3 benchmark standards is that the regulator must demonstrate financial autonomy. User fees can be a way of providing a direct funding stream that allows this independence. On this basis, industry has become a partner in ongoing regulatory reform in the United States. In fact, this system has worked so well that with each of these 5-year reviews, industry has consistently supported increases in the regulatory fees. They do this fundamentally because they believe they are getting value for money. A more efficient regulator means more rapid reviews, which helps them get to market more quickly. Moving forward, African governments should also draw upon the lessons of our successful PDUFA approach as a way to chart their own pathway. And finally, greater use of reliance mechanisms among regulators can also promote greater efficiency across the continent. Implementation of some types of Pan-African solidarity with regard to regulatory standards will be vitally important to ensuring the success and sustainability of African health markets. Thank you for your time.
Thank you again to Peter for those opening remarks. And I think that lays the groundwork in terms of the conversation that we'll be getting into today. From the earlier session, there was some discussion around resources to achieve some of these goals towards harmonization. And of course, one key component when we talk about resources is the funding models necessary in order to get to that point. Funding constraints are generally a challenge globally, but particularly across the continent with various macroeconomic challenges at the sovereign level impacting government funding and others. So what I think will be interesting today for us is to unpack the variety of financing models that are out there. We can talk everything from user fees, which Peter mentioned in his earlier remarks, to central government funding and budgeting, to international aid through agencies such as ourselves, USTDA. And by way of reintroduction, as my colleague mentioned, I'm with the U.S. Trade and Development Agency. I'm the regional manager for finance and implementation based here in Johannesburg, covering sub-Saharan Africa. So really excited to get stuck into this conversation. One of the things that we'll be talking about this morning is the optimal financing methods for national medicine regulatory agencies, or NMRAs, which is necessary in facilitating this transition through to harmonization. In particular, we'll also talk about how to benefit from cost efficiencies, things such as work sharing models, for example, mutual recognition agreements, MRAs, collaborative and parallel review processes, which can also bring down the costs of harmonization, which kind of goes part and parcel to this conversation about getting external funding as well. So successful implementation of work sharing models can help impact resourcing for the positive, of course. So just to reiterate, in case anybody was stepped away while we were doing quick introductions earlier, we've got virtually on the screen here David Mukanga, Deputy Director of Africa for Regulatory Systems. He's with the Bill and Melinda Gates Foundation. To the furthest on the panel here, we've got Chris Legrand, CEO of the Broadreach Group. And of course, we've got Marlene Rose Munsami, Head of Regulatory Affairs for Adcock Ingram. So we've got a variety of perspectives today as well. We've got private sector, we've got consultancies kind of straddling both US and the region, as well as nonprofit organizations. And of course, if there's any regulatory specific questions, I may look to some of the regulators from the earlier session in the audience to address those as well. So as we kickstart, my first question to the panelists is this. As we move towards regulatory convergence and work-sharing models, sustainable financing of regulatory agencies will be critical. What is the current status of financing of regulatory agencies across the continent? And if I could maybe start with Marlene on this one.
Thank you, Sarah. Just to clarify my introduction, I'm actually the Head of Regulatory Affairs for Adcock Ingram OTC Division only. So just moving on to responding to the question, the current status predominantly is through government funding, which is based on national budgets. And this type of funding mostly caters for facilities for capacity building and to focus on some of the core operational needs of the NMRAs. Then we also have user fees and charges, which are mostly for example, for marketing authorization applications, for retention fees, renewal fees as well, and also clinical trial applications. And GMP inspections, etc. So those are the types of activities that directly impact applicants. We also have resource sharing, which was touched on quite extensively this morning with the Zazibona collaboration work sharing. Across the country, across the continent, we have ECOWAS in the West Africa region. We have the EAC harmonization in East Africa. We have IGAD in the northeastern parts of Africa, and then also ECAS, which is in Central Africa, and then in addition to that, we also spoke about the African Medicines Regulatory Harmonization, within which there's at least 7 work-sharing groups covering pharmacovigilance, generics, clinical trials, and some of the quality aspects as well that was touched on in the earlier session. So there is already a lot of work-sharing initiatives and resource sharing that's going on across the continent. And then some capacity building, specifically capacity building initiatives, which Africa is taking advantage of, is the WHO Stringent Regulatory Authority collaborative registration procedures, which allows for a priority review process to be followed by various countries, and which allows for simultaneous registrations across various countries in Africa once the process has been completed. And then we also have, more recently, the Swissmedic Marketing Authorization Global Health Products Initiative, where Swissmedic supports sub-Saharan Africa and other low and middle income countries to ensure that they leverage the expertise of Swissmedic, as well as ensuring faster accessibility to new chemical entities, as well as other products that are already registered, but for example, with extended indications. And then international funding is also very much active in Africa. International funders tend to favor WHO-listed products. It's also more temporary, project-driven, and sometimes more specialized. So those are 5 types of funding that most of the NMRAs are engaging in.
Thank you so much for giving us that background, both from a regional and a global perspective. And I think your last comment really touches back upon the theme of this session, which is sustainable funding. And I look forward to unpacking that further. You know, of course, it's helpful to have project-driven funding, but how do we get that on a more sustainable basis to ensure that continuity of the pipeline. I'll also pose the same question in terms of the current state of regulatory agencies' financing status to Chris as well. Chris, over to you.
Thanks. I think I'll leave some of the Africa-specific funding dynamics to David. I think David's probably a little more versed in that. I can actually speak a bit more back to the PDUFA experience because I was sort of firsthand involved in that back in the early 1990s when I was fortunate enough to be seconded into the US FDA at the Office of the Commissioner level for several years as a consultant, but sort of deeply embedded in what they were trying to do right at the time that PDUFA came to be. And I think there's a few important things around PDUFA. Number one, it's now into its seventh 5-year cycle. When that first hit, there was a lot of concern, I think, on the part of many that it would be regulators then beholden to industry. I think that hasn't actually borne out. I think what you've seen over these last 30 some odd years, you've seen drug approval times in the US FDA drop from well over 2 years to well under 1 year. You've seen in the early 90s, more than 70% of new products that came into the US markets were approved first outside of the US, and now that's exactly flipped. 70% of new products are approved in the US first before they actually go out into other parts of the world. So I think the dynamic worked, and we haven't seen the sort of unfortunate safety instances that a lot of people thought might happen with regulators being sort of too cozy with industry. I think that what it caused was a level of mutual accountability and transparency that I think is essential. And as we think about back to the African continent, some of the lessons we could learn, and I heard that actually earlier this morning, creating this level of mutual respect and trust driven by accountability. So in the early 90s when PDUFA came to be, there were requirements, I think as our video showed, there were requirements for US FDA to report out on its total time to decision, and what came to be known as the PDUFA date, which was the point at which you could expect to have a decision from the FDA. This created a series of stakeholder engagements with industry, with government, with other outside stakeholders, some representing consumers, for example, that drove, frankly, better accountability and better transparency. So I think that was really important. You might also know that modeled after PDUFA, about 10 years later, on the devices side, there was a MDUFA that was put in place, and that's now entering its 5th cycle. So that's proven to be highly effective. At the early stages, of course, it took a while for these user fees to gather steam, but by 2022, user fees were representing about 45% of US FDA's total $6 billion budget. Now that's an enormous budget, by the way. Lots of user fees collected, but up to about 45%. I think there's probably no one right answer on what the right blend is, but and maybe David could highlight some more details on what's going on across the African continent. But that's just a little bit of background on what has worked pretty well from the user fee perspective at the FDA.
Thanks, Chris. And I think that's really interesting to contrast your experience with PDUFA. And for anyone who's a layperson like me, I believe PDUFA is the Prescription Drug User Fee Act of the United States, and I would assume the MDUFA is the Medical Devices User Fee Act. So I'm sure everybody in here already knew that. But I think it's really interesting to see that evolution that occurred in the U.S. In terms of the mix of fees versus funding centrally, and if there's any learnings that can be taken from that for the continent as well. David, anything further from your perspective in regards to what you're seeing in terms of the current state of affairs for funding of regulatory agencies regionally?
Oh, Sarah, thank you very much. And I want to thank again the USTDA for bringing us together, and great to see lots of friends in the room there. It's a pity I couldn't join in person. I think Marlene and Chris have really set the stage very nicely and described the mix in terms of funding that regulatory agencies are able to access, whether that's government funding or grants and donations or fees, etc., for their work. But I think I'll just add that as we think about regulatory harmonization, convergence, work sharing, we need to remember that the national agencies on the continent of Africa, I think as is the case in Europe, where there's a network model, are really the bedrock of work sharing. They provide the expertise that does the work, but they're also the recipients and beneficiaries of that work. So I think any efforts around convergence and work sharing and so on, without these agencies being adequately resourced, will not be successful. So we have to think about those national agencies and really work with them to support them in building their systems maturation to be able to get to a level of financial viability and sustainability. I think for me that's just one addition. The other one is to just add that a handful of agencies on the continent have built a good mix, and Chris referred to this. I don't think there's a right or wrong answer. It varies quite a bit. Even when you look internationally, the TGA on the one hand is 100% industry fee dependent. And then, you have those that are a good mix, like the FDA, you look at the EMA, 90% fees, 10% state, etc. But on the continent, there are a lot of agencies also that are still heavily dependent on government revenue for their support, and the fees and donations are small. But there are a number of them that have got, I think, a fairly good balance. And while not 100%, fully resourced, they're on the way to getting there. And I think that mix is also a discussion that happens at the country level between the government, the Department of Health or Ministry of Health, and the regulator in terms of what's the right mix that is appropriate for them. I think when SAPRA was building its most recent fee model in 2018, there was a very deliberate discussion, and their treasury, if I remember at the time, said, look, we cannot allow our regulator to be, fully, 100% funded by industry. We want to chip in and be a major contributor to that. That's the position that South Africa took, and and that's working for them. When you look at countries like Zimbabwe in the region, almost 100% funded, perhaps 85% is fees and then some grants, and that's working for them. So there isn't right and wrong mix here. Thank you.
Thank you, and I think that's really interesting, and thank you for raising the example of South Africa and SAPRA as well. One of the questions that I had as we were having this conversation is, does the independence and sort of the restructure of an agency like this allow it to access new sources of funding that they perhaps may not have had access to in the past by virtue of being fully funded by the ministry or the sovereign? And so this maybe goes back to some governance and structural questions as well. And it might be interesting to sort of compare and contrast that. So that kind of leads me to my next question, which is looking forward, based on what you see across the continent and also the learnings from the US, from Chris's perspective, is what do you think needs to change in order to allow for financing to flow effectively? What are some sources of funding that maybe aren't utilized to its full potential at this point in time that regulatory agencies should be thinking of to access further? And again, cognizant that our panelists aren't regulators themselves, so this is maybe more of a third-party view and opinion, but I think it'd be interesting to just kind of unpack your views on that. I don't know if anybody wants to take this one first. Marlene? Yeah, thanks.
So I think maybe the first point is to consider diversification, so not being fully reliant on one specific type of financial income. And I think it's also to ensure that the NMRAs have a level of independence and autonomy as well. increased government government investment, again to reduce the dependence on other types of income and to build stability at the NMRA level. Just a view that I received from a health authority anonymously as well was perhaps public enterprises should be an avenue to explore as well, just to maintain some level of autonomy. So while receiving government funding, to still be able to have efficiencies within their own operations. I think transparent financial management will also be key, and this is more to ensure accountability and transparency in the management of the finances at NMRA level. It will also help to build trust with the various stakeholders and to ensure that spending is done with due diligence. Public reporting will also encourage some transparency and accountability. And here it would be reporting not just on the regulatory activities, but also on performance metrics that have been measured, similar to what's happening with the FDA. And then regulatory impact assessments is another avenue to pursue as well. Regulatory impact assessments, it would be desirable to have those done before regulations are rolled out in order to understand the impact to agencies as well as to the industry. And also not just in the regulatory space, but all aspects of operating in the industry. Public-private partnerships, this is also another area to increase some interaction and collaboration, to improve efficiencies, to leverage clinical expertise, to explore more opportunities within research and development, and technology transfer as well. Just having received very direct feedback from one health authority as well, more support is required from industry to support technology transfer. And then to have more risk-based approaches for generic applications, that would also be a good way to go forward.
Thank you, Marlene. And I also I'm looking to our prior panelists, SAPRA and our Botswana colleagues in Namibia. If you had any comments or thoughts in terms of your experiences in this space as well, would love to hear from the audience if you had any thoughts on that. And I'll see if anybody does want to provide their anecdotal experience. Otherwise, we can circle back on that as well. Any thoughts in terms of what's worked well for you as regulators in this space? Thank you.
For Namibia, we're still fully funded by the ministry, by the state. However, there's been flexibilities in grants and other ways of funding through initiatives of health strengthening or public health improvement, where Treasury actually is flexible in that kind of win-win partnerships within other forms of within the Ministry of Health. So even though we find ourselves in such a setting, there's been a great impact on our operations through partnerships that we've had with donors and so forth. Yeah, but we also advocating for the semi-autonomy to work on that, primarily because of the sustainability and to increase the funding pool that we could have access to. Thank you.
Fantastic. Thank you so much for that. Well, with that, I'll swing back to Chris in regards to your thoughts from, I know your experience is on the FDA side and in terms of what you're seeing in the US. Are there any learnings from the FDA and also within the FDA itself, looking forward, what should they be thinking about financing models going forward?
Yeah, sure. Just to go back to that PDUFA example, one of the things that the PDUFA funds allowed FDA to begin to do was better harmonize even within the agency. In fact, a lot of what I worked on was data and system standardization and harmonization just within FDA, which was from center to center. They didn't even talk to each other. You might not know that. And it also fostered the sort of international harmonization under the auspices of the ICH to build the better bridges between the US and Europe. So I think those sorts of user fee models enable a lot of new things to happen that when you're purely state funded, it's really hard to do. You're beholden to that state, and you really don't have the flexibility. It also, again, back to what I said earlier, gets industry at the table. I think part of that challenge, when you think about this blended model, is state officials and industry officials frequently just don't talk the same language. So some of it is just learning how to talk to each other. State officials need to begin to understand what really drives industry around economic ROI. And industry needs to get that what the state, in this case an FDA or SAPRA or whatever, is trying to do is to protect the public and at the same time get viable new medical products out into the marketplace. So they each have a role to play. That sort of tension can actually be healthy, and so I think having industry at the table is critical, and to build that sort of trust. And again, back to I think what maybe it was David was saying was, leading to digitization. And we'll talk about this in a session later today, but to enhance the work sharing across a continent like Africa, having better digitization that you can actually share work product, that you can share the data more easily, and share that data and the KPIs with industry. Now, those are all kinds of things that I think these sorts of user fees can help fund as the continent expands.
And the earlier session spoke quite a bit of trust as well, and so I think this goes back to the point of the bridging the gap, maybe in certain instances mistrust between the private sector and public sector regulatory bodies. And I actually have a follow-up question for you, Chris. Based on your expertise of user fee models, what are the advantages and disadvantages of user fee models, the potholes, if you will, that organizations should be wary of going into shifting to that source of financing? And what should agencies be thinking about when designing fair and sustainable user fee models?
Yeah, I think certainly getting industry at the table to say what makes sense. Again, if the public sector or the state sort of unilaterally makes those decisions without industry at the table, it's not going to work that well anyway. I think it's important to have the transparency where both the public sector and the private sector can see what the drivers of effective review and approval are, and post-market pharmacovigilance, that we ultimately, I think we're actually trying to achieve the same things, but sometimes we have different ways of getting there. So I think important to just get at the table. It's one of the things that, back to the US FDA model, industry was at the table. Industry does advocate for continued renewal of the PDUFA legislation every 5 years. If they didn't agree with it and they didn't agree to those sorts of fees or the levels of fees, they would, and the industry, as you know, in the United States is quite powerful, PDUFA would have died. And so industry is fully supportive because they know they have a seat at the table, they have a voice. Even though they're regulated, they actually want the regulator to be successful because they want their products out into the market. I remember some years ago when I had the fortune of running a life sciences CRO for a time, the pharma industry was, what we got pounded on as a CRO was every day that you're late in getting my clinical data done is potentially a day later of getting it approved, and it could be $1 million a day. That was our marching orders. So they have a real economic incentive to get things through quickly, but also thoroughly by the regulators.
And very interesting about that sort of feedback loop that's occurring on a consistent basis to allow for PDUFA to continuously be extended and successful in terms of raising fees and things like that as well. David, same question to you in regards to sort of a look forward. If you can kind of look at an ideal scenario in terms of various funding sources for regulators across the continent, what do you see? And from a Bill and Melinda Gates Foundation perspective, you know, how has your organization's funding assisted in some of these harmonization efforts across the continent?
Oh, thank you, Sarah, and Malene and Chris have provided very, very helpful context there. So I'll not repeat, some very eloquent points that they've put across in terms of systems transparency, the interlinkages, the digital platforms, etc. I think just a couple of additional reflections. I think one is, as we have worked with regulators on the continent, not just on the core work sharing and supporting harmonization, etc., but also on the particular topic around financing and sustainability. One of the things that we have found with some of the regulators I found useful is their requests to us and support for the development of financial sustainability plans. Whether at the regional level or at the national level. We've supported in a couple of countries and are currently supporting in a couple of countries, where the regulator works with the stakeholders in the country, including industry and the government departments, budget, finance, Ministry of Health, etc., to say, what's the right mix of funding that we need, when it comes to industry fees, what should we be charging, how do we manage that, etc. So that's an important piece that we found useful, and for other funders in the room, I think that's something that would encourage you to look at and consider supporting our regulators in terms of thinking about and funding the development of those, either through consulting support or other types of support. Related to that, Sarah, you wanted to interject?
No, I just wanted to comment on that to say, that's such a great point to bring the various stakeholders to the table, and also from the central government's perspective, ensuring that their funding is aligned with the national priorities as well. I'm sure is part of this consideration in regards to strategic alignment of funding sources. But sorry, I didn't mean to interrupt, so please continue.
Absolutely, great. Now, related to the development of these, financial sustainability plans for the regulator, is again part of that stakeholder engagement is the government. In certain jurisdictions, we see that even when the regulator has developed a plan, the government is very reluctant to allow the regulator to retain the revenue from industry, because that increasingly, once they have structured that nicely, becomes increasingly a large source of revenue for them. But, in certain jurisdictions, that goes to Treasury, but the Treasury allows the regulator to use those funds to, do their work, have the capacity that they need to do their work and continue to mature and to grow as an agency. But in certain jurisdictions, that revenue is not fully allowed to flow into the regulator, and the regulator then struggles to attract, to retain, to develop its talent, and to do the work. And so this is another important area that I think we as partners, governments, partners that support on the continent could play an important role in providing advocacy and sharing experiences from your countries, like the US. If you work in a particular country, say, this is how the USFDA has done it. These are the struggles they had before we had PDUFA and so on. And this is what it has meant for them and the ability to do their work. So that's another piece that would be very helpful that we as partners could play on the continent in supporting regulators. Then the other one is, we have begun to see, certain regulators building business units within their agencies as another way to build their own muscle. They can compete for grants. They're looking out for grants and writing those grants. They're leveraging their capabilities. If they're very good in a certain area, they're offering that as a training opportunity for others. and talking to partners and charging, beginning to charge tuition fees, for other regulators to come and benefit from the experiences that they have. So this kind of creative thinking, I think, is very helpful in enabling agencies to advance and mature and be able to raise the resources they need, because it's not just about, for example, getting to maturity level 3 or maturity level 4 or become a WHO listed authority. You need to stay there. And the heads of agencies who are in the room there will tell you, those who've reached ML3 and ML4 and so on, the effort that it takes to stay there, and so it's not just about getting there, it's about staying there, and they need the resources. And I think we as partners can play a very critical role in advocating with the governments and others to say, you need to resource the agency to be effective and play its role. And this is the value that will accrue to your country's public health and to the region and to the globe. Thanks.
Thank you, David. And I think you gave us a lot of food for thought. Your earlier point about successful funding models and commingling of fees with Treasury in certain instances. I think there is definitely scope and a need for advocacy in order to push things in the right direction, to allow for ring fencing, and we're talking about sustainable finance, but also self-sustainability. We need to put the right guardrails in place to enable that to happen. We've just got a little bit over than 10 minutes left in the conversation, and I wanted to swing it to the audience. If there was any Q&A from the audience, we'd like to take it at this stage. If you could just state your question, and if you have a particular panelist that you would like to ask the question to as well.
Hi, my question is to David. In terms of regulatory convergence and fees related to regulatory convergence, and specifically, let's look at Zazibona. While, I think we have stepped on reviewing harmonized fees through Zazibona, we're still seeing NMRAs requesting national fees, and those fees are still at the level of a national submission, yet they have the power now to recognize Zazibona registration. And is there any work being done with the NMRAs to recognize those fees through the regional process? And then, in addition to the fees for registration of medicines or health products, we have other fees such as GMP, life cycle updates. Those as well are we looking to harmonize that across the region? Because that then, impacts eventually the patient. If we want to register a product, we need to make sure that, we try and limit the fees so that we can register across the region for all patients, right? And at the end of the day, both the regulator and the industry need to put patients first. So is that something that is being considered? And then how transparent is that going to be to industry and to other regulators in terms of what those fees are? Thanks.
I'm looking to our panelists. I don't know if anyone has sort of hands-on experience with Zazibona, but if not, I'm actually going to look to the audience from our earlier panel to see if some of the regulators might have some thoughts on that question in regards to harmonization from the funding model perspective. Anybody with experience on Zazibona able to opine on that?
Sarah, I could take that. I could take
thanks,
that.
Dave.
Happy to take that. Yeah. No, thank you very much. Fantastic question there. And I think, the regulators in the room, could complement or add or offer a different opinion to what I'm going to offer here. But certainly, I fully agree that we need to be mindful of, the fees that are charged. At the end of the day, that's going to impact, what is paid, whether that's paid by a public payer or out of pocket, etc. At the end of the day, that's going to have an impact. So finding the right balance, financing the regulator to play their role, to have the system that's able to deliver on their work is critical, but at the same time finding that right balance. I fully agree with you. what we have seen in the region, not just in Zazibona, and Zazibona's fee, as you know, is recent, just this year. You know what they're charging for the centralized pilot. They have been charging for inspections of manufacturing facilities for a few years. And that's true of East Africa, West Africa, and the other regions. The ESC is just beginning, is just going to be about to start doing that as well. And I think one of the conversations we've been a part of with AUDA NEPAD and others under the MRH is, at the regional level, could you think about harmonizing the fees that the regions charge, taking into account, you know, perhaps the size of the region and other factors, but make sure that they're not huge distortions in terms of what those charges are. So that's one conversation that is ongoing. But in terms of the national, you know, once Zazibona is charging those fees, it's a tough lift to go to the country and say, you know, because you have paid a fee for an assessment at the regional level, you know, would like to now pay half or 30%. That's a process that involves legislation and so on. So it's going to be a tough lift. My sense is that perhaps the region is not yet there in doing that. But as these regional work sharing efforts begin to mature, I think regulators may be open to have that dialogue and say, you know, if you've had already a joint inspection at the regional level, perhaps we don't need to charge you inspection fees because you already have that. We're going to rely on that, etc., and do that. But it's a heavy lift in terms of legislative changes and considerations that need to happen at the country level to say, you know, we will only charge you a portion of the registration fee because you already paid at the regional level, or AMA for that matter, when AMA comes into play, you know. So as these platforms mature, I think things will change. But for the moment, at least the discussions I've been a part of, they're quite emotive and difficult when you ask countries to consider these issues. Thanks.
Thank you. Any other questions from our audience? Gentleman in the back over there.
It's not a question, but I really want to just kind of reiterate a point that was made earlier, as it mentioned, that came in terms of governance, especially around fees. I think it's really important that, you know, the governance structures be put in place to really make sure that these fees are used appropriately. I can give you an example. It's not in Africa, but another region of the world, whereas you have a situation where the regulatory authority and there's the lab, they are, you know, distinct from one another. The regulatory authority, the lab actually charged fees to support the regulatory authority for registration of products. And as a result, there's been a negative impact on like post-market surveillance, you know, because they don't get any fees from doing post-market surveillance. So that's the negative impact of it, because it's again a shift to, you know, where the finances are versus where the public health priorities are. And again, it hasn't happened in this region of the world, in Africa yet, but one thing that I do see a similarity in is when you have countries where the regulatory authority and the laboratory are not part of the same system, so like you see in many of the Francophone countries. But again, it's just something to take in consideration, not just there, but overall in terms of making sure the proper governance structure is in place.
That's a great point. And Chris, I think you've got something to add here.
Yeah, I think probably a couple of pieces from what David was speaking about, as well as Lawrence. You know, I was hearing this morning in the Zazibona panel. One thing I would just say as a point of encouragement is when you end up dealing with these sorts of human issues, really, political, policy issues, systems issues, they inevitably take way longer than you might think they should take. And so I would just encourage to be patient and keep at it. And like even if you look at EMA and it's standing up EMA and what it does and the harmonization it's had to have with all of its member states, it's still not working perfectly. In fact, if you talk to certain country level representatives, they would still be frustrated. So I would say don't give up on that. Don't give up on that regional harmonization. Don't give up on eventually getting EMA stood up. It needs to be funded, and I think ultimately it's going to need to be beyond just donor funded. I think that donor funding can help get it stood up, but ultimately countries and industry need to be behind it with their funds. And I would just say know that it's the long game, and stay in it for the long haul.
Thank you, and I think that is a great point of caution as well in terms of sort of unintended consequences of incentivization through registration fees and whatnot. So thank you for that comment as well. Any other questions from the audience at this point? Yes.
Just a quick comment. One of the things in terms from the industry side, Africa needs to be an attractive market, right? And if you look at big pharma, I think when I last looked at the data, Africa represents like 2% of big pharma's turnover, right? And then we're saying, yes, come register your drugs. Why? There's really little incentive in a model where it's how to put it? It's a push, not a pull model in terms of asking for come register your product in my country, right? And so to me, one of the benefits of regionalization or AMA could be we can consolidate demand, right? I may have 5 cases of this cancer in my country a year, but we have how many thousands across the continent, right? And then use that as sort of, in a way, as market leverage. But the better business pharma can do on the continent, the more you could actually increase those fees as well, right? As opposed to right now, I feel it's probably not the most attractive market we place. And this goes back to then having data, for example, on what actually is the disease burden and the demand and where it's located. And do we have providers there? For example, if it requires a prescription, do you have enough providers who can actually create the pull-through for that medication to actually access the patients at the end? Because that's another thing we often see is, yes, I've registered my drug, but I'm not doing any sales. Nothing, and then I'm not going to basically bother again after that. So I think it has to, we talked about working with like the ports and the police and whatever. We also have to make sure that the health systems are much more efficient at, in essence, delivering through the last mile so that, in essence, we do create a much more attractive market.
Thank you, and I think your point touches on the core of some of the fundamental challenges on the continent of fragmentation, size, and scale. And I think, of course, as you mentioned, this AMA and some of these other initiatives, the idea behind it would be to address that, to make it a more compelling market for entry by overseas providers. I wonder if, Marlene, you had any thoughts, from Adcock Ingram's perspective, deep expertise in the private sector in providing OTC medication and otherwise, how you view the market, obviously being a local player, understanding a lot of these dynamics to a much more detailed extent than some of these other foreign companies that may be looking to enter the market. So over to you for any thoughts.
Sure, thanks, Sarah. So I think maybe just from a local industry perspective, also focusing on generics, OTC medicines, and playing across Africa, and also, embracing localization, because Adcock Ingram is also very active in local manufacture. So I think there's a lot that can be shared from industry perspective in order to support NMRAs, and I think that we need to just find those opportunities to collaborate better so that those that information can be shared in the right platforms. It would also be beneficial to see how funding, is tailored to suit preventative therapies instead of, focusing only on treatments. And I think if we look at complementary medicines and just the consumer space and the OTC space as well, what can be done to help patients to, to self-care, to be able to be more well-educated in that area, and that will alleviate a lot of the health problems across the continent. So, just that holistic perspective.
Thank you so much. And I see that we are actually at time now. So Thank you again to our esteemed panelists. The themes that really arose from this conversation is the need for collaboration between governments, private sector, regulatory bodies, financial institutions, donors, and sessions such as these, information sharing, I think hopefully provides food for thought in terms of new and different types of financing models that could be explored out there. So thank you once again for your expertise, your diversity of experience and opinions. And with that, we'll close the session. I'll hand over to the MC. Thank you. All right. Well, thank you again to all of our panelists for this morning. We are now going to head to lunch, which will be one level up from where we are currently. I will note that there is one elevator. It is quite small, so there might be a bit of a queue. So I'm going to put up some questions here. In the second half of our sessions here, we are going to ask for your participation in our last session. So we'd like for you to kind of reflect on these questions here. And also try to join ahead of time as in our last session. We hope that it'll be very interactive and that you guys would also participate. So again, lunch will be, you'll just go outside, there's the elevator there, you'll go up one floor, and we'll be able to usher you to the space. So right now, it is about 12:32, and we'll ask for everyone to come back at 1:30. Thank you.
Welcome back. Hopefully you didn't eat so much that you're sleepy. We have now, I think a riveting panel, actually, that you'll see some threads from some of the things that we talked about earlier today coming back up again. And since I believe we have quite a large panel, and we've also got one person that'll be coming in virtually, we have a little bit more time than we originally thought, so I'm going to let you give a very brief couple sentence introduction of yourself. I won't try to do that, but when I ask you your first question. So the way we'll do this panel today is I'll set up a few opening comments, and then I'll turn to the panelists. I'll ask them a series of questions, and as we've been doing, by all means, be thinking of things that comments and questions you may have, and we'll try to engage you as well as we get deeper into the conversation. So the topic of this panel is digitization or digitalization of regulatory harmonization, and how can we foster regulatory harmonization within country, within region, and continentally through increased digitization. We see certainly AI, we talked about that this morning. We see all kinds of digital tools and solutions that are coming at us faster and faster. We talked this morning about the regulatory authorities, and can they even sort of keep up with what's going on from a digitalization standpoint. Importantly, though, is how can they leverage digitalization to make the regulatory environment more effective, more efficient, to be able to get products out in a safe and efficacious way to citizens across the continent. So with that, we're going to hear a bit from, we've got a regulator who I think is the one that's Mpako is going to be virtual, and is he coming in live? Do we have him? I don't see him on. Okay. We have industry. We have international representation with U.S. Pharmacopoeia, and so I think you'll hear an interesting perspective on digitalization and how it can not only fuel better harmonization locally and regionally, but ultimately set us up, there's Mpako, for a more effective continent-wide regulatory science and regulatory harmonization. So with that, let me go ahead and turn to the panelists, and I think we might actually start with sort of a broad perspective, and I think we'll start with Lawrence from U.S. Pharmacopoeia. And I think, Lawrence, what we might want to do is just have you give us a very brief perspective on, after you introduce yourself, on what are the standards that are being applied to digitalization that you're seeing globally, and how can they be applied back here on the continent of Africa? Lawrence?
Good afternoon, everyone. My name is Lawrence Evans. I am the Senior Director of the Global Health Technical Programs team at USP. And I work in the Global Health and Manufacturing Services Division, where I lead a team of experts and of scientists, primarily based in Rockville, Maryland, but some also based throughout Africa as well as Asia, that actually provide technical support and technical assistance to regulators, manufacturers, in a number of different areas. We're covering all the different regulatory functions. So that's just a little bit about me as well, about USP. I've been at USP now for 20 plus years, and for some of y'all that don't know, USP is a standard setting organization that's over 200 years old. So in terms of standards, we've been around long enough and we really know a good job, and we really know what to do. But those standards are a little bit different from what I want to talk about today and just want to mention about. So if I may, as I mentioned, USP, we've been around for 200 plus years, and we're developing standards to test medicines and medical products. But as it relates to today's discussion, I think one of the things is that people need to realize and understand that standards also apply in digitalization, and they are very, very important. I cannot, say it no less, but it's very important. I want to mention, a little bit why, and just talk about a little bit of these standards right now. Maybe I can start off like, what are these standards? If you think about a standard, it's really like that rule or the information that's structured and defined in such a way, so we can have things that are done uniformly. So that's one of the key things I think we need to know, just like what is a standard and how should it be applied in terms of data and digitalization. And it's not, and I mentioned a little bit more about some of the aspects of what that really looks like, but also, why are these standards so important as it relates to harmonization? We've already talked about this a little bit earlier today. Predictability, consistency, and one of the things is that it's in a form in terms of a format where IT systems can actually then utilize this information, right? And if you think about the types of data, there's a number of different types of data. And so if we talk about it from a global perspective, let's think about what standards right now are being out there. They are hundreds, if not more, more than hundreds of standards that are out there. And one of the simple ones that many of you are probably familiar with is really electronic CTD or ECTD. So that is really one of the basic standards that are there. But then there's also other standards if you think about some of the ISO standards, like IDMP, which is the identification of medicinal products. And so, I'm saying these things, but let's go back to the point is that if different countries use different standards, how can you then, be efficient in terms of your process? How can you harmonize? You can think about, give an example of just a simple difference in a drug name, can actually then cause so many delays. Then after that, country X will then go through a different process with country Y, and then if there's information that needs to be shared, it's a different name. So you think about the delays that can occur then. So that's why, I'm pointing out the difference, the need for an importance of a standard, of using of standards, data standards. Again, it's not just about, having information, that's one part of it, but having information that's usable. You think about when, in many of the companies that you probably work in, that you've probably gone from at some point in time, you've gone to a new platform, your IT system. One of the first things that they typically have to do is put the data in a certain format to move it, to then apply it to a different system. But one of the things is that, just that process can be, one of those things that can slow things down. And as a result, it's, what you've seen is that there's, lack of, what you can see is lack of standardization in that, when it comes to that data platform. So again, it causes you some delays in getting things forward. So that's what we want to try to prevent when it comes to, harmonization and as we move forward. Because again, if you have different, if the data is so different, how can countries even rely on that information? Again, I used the example about with IDMPs in terms of the names. Think about it, and it's not only from being efficient, from efficiencies, but also from a public health standpoint. And I'll give you an example in terms of with the names, because this applies not only to the active ingredients, the drug substance, but also those inactive ingredients. When you don't have standardized names, there's a possibility in that, an excipient could be different. And then also when a company is even, trying to utilize or get access to a new excipient, it could be the wrong one that could actually come up, could be deadly, or it actually can be cause, harm to those individuals, if you don't really, if things are not standardized. So again, we look at, the data and the information to be standardized. And I'm not just talking about names, but also in terms like calculations and also studies. Think about clinical studies and clinical trials as part of, that goes into your dossier on the ECTD. Many times, a lot of that data and information is in different formats. And so when you're trying to do comparability between trials, it's really hard to do that because, again, you're talking in different terms and and whereas then, you don't have that, you can't make that connection to other studies to really then compare your work to. So again, it goes back to that point about, the lack of harmonization, the lack of standardization when it comes to, just data and the standards. Again, I don't know how long I can harp on this point, but it's just it's so important in terms of, and just the last thing I want to say, because I know I've been talking, is that, Chris gave an example, like even when, USFDA, even within the various centers, how there wasn't harmonization in terms of the standards and that was actually then being applied within the FDA. But I think that's just a key point because, again, it will then help you in terms of what your efficiencies internally as well as externally.
Got it. Thank you, Lawrence. And just sort of picking up on this standards theme and how that applies to regulators as well. Let's just shift over now to the regulator's perspective. And Paco, perhaps you can just talk a bit about, well, a little bit on your own background, and then if you can give a regulatory perspective on how you're seeing or hope to see regulatory efficiencies through digitalization.
Thanks, Chris. Good afternoon, colleagues. I hope you can hear me. Thank you. And thank you once again for the organizers of this event. Really important dialogue that we need to have. For me, just as a background, I'll be very quick. My name is Mpako Ratlabian. I'm the manager, pharmaceutical evaluations, pre-reg SAPRA. I've been with SAPRA for quite some time now. I think I'm approaching 7 years, and I'm also been quite involved in Zazibona activity, which is our regional harmonization initiative, collaborative registration procedures. I'm currently also serving as a co-chair in the International Pharmaceutical Regulators Program, where we strive to converge and have a similar understanding and interpretations of the ICH requirements across all regulators. So that's from my background in a nutshell. I'll go into the topic. What we're trying to do, I think my colleagues earlier on in the earlier discussion would have highlighted the milestones and some of the challenges we face for Zazibona as an initiative over the past 10 years. But we've learned some lessons there, and we're currently trying to run a pilot. And in that pilot, we're trying also to see if our digital tools that we will use will be very efficient. I know we run into some of the challenges. I think the coordinator will communicate with those applicants that have sent the expression of interest. But while we are piloting that, we also want to pilot some of the workflow as well, and in terms of data monitoring and to see the milestones for our initiative if it's really working. So for us, digital technology plays a very important role in terms of providing an effective and less time-consuming way of managing databases, dealing with evaluations and work sharing where anyone could easily access the document, and it in fact improve trust amongst ourselves, and we could also leverage on such kind of technology to increase the reliance and implementations. And as such, I think from regional perspective, we've been trying so hard to align and have same standards as Lawrence has indicated. And I think it's important to invest in some of those digital tools, especially at the REX level, because the REX plays an important role in feeding into the NRAs themselves and as well as the work that we're trying to do at the continental level in AMA. And I think AMA has also been involved with there is an IMS technical committee which works on having some digital tools to assist the work at that level. So it's very important that we invest in digital technology to make our processes more efficient, more predictable, and also to be very responsive to our stakeholders, but also to be able to manage milestones and see if we meeting targets. So I think in a nutshell, for me, from the regional perspective from Zazibona, we will be piloting our pilot and see if the new digital platform that we're using or the portal is working. And of course, we could do with some of the investment at that level to make it even better for our stakeholders and in fact, to ensure that there is no delays. I think some of the challenges in terms of reliance and uptake is mainly trust amongst ourselves and also in terms of data sharing and additional regional requirements which sometimes might be delaying. So if we can harmonize at that level, at the REX level, we're standing a better opportunity to really make sure that product reach market in a timeous manner. I'll stop here, Chris, for the sake of time. Thank you.
Got it. Thank you, Mpako, and I'm sure that's going to generate a number of questions. I think it's probably a good shift over into industry. You mentioned, Mpako, about stakeholders and efficiencies within the regulatory environment. Perhaps, Gita, you could speak a little bit now from the stakeholder perspective on where you see ICT possibilities to be able to infuse regulatory efficiency.
Thanks, Chris. So hi everyone, my name is Geeta Singh. I'm the Regulatory Affairs Director for AppV in South Africa, and we manage registrations in 27 countries from South Africa. So it has been a journey, and I think in terms of digitalization, post-COVID, we saw fast tracking of submissions electronically, not just in South Africa, but in Africa as well. So that has definitely moved in terms of how we operate. So definitely digitalization is something that is here. We live in the fourth industrial revolution and it's not going to stop, right? So there's differences, and there's some countries that are accepting ECTD, which, you know, Lauren spoke about the standard, and that's exceptional. And then there are some countries that are still just doing CTD, and that is a NIS format, which, you know, is uploaded on their portal. And it's not a portal like in SAPRA, we have the FTP where you can directly just upload the entire dossier at one go, and it's pretty quick. But we have, you know, individual files that need to be uploaded, and that can take a week with no meetings, you know, to sit and upload your entire file. So I think, you know, streamlining the processes is critical. We need to have regulators come on board and collaborate to look at, you know, what is the best system and what is the most efficient system. And then sometimes we notice that, you know, documents are submitted and then we get questions and the document's already there, but it depends how you put those documents through. So when you look at an eCTD with the XML backbone, it's very much detailed. You can find your information very quickly, both from a regulator perspective as well as an applicant perspective, and it's, you know, it's tracked with a sequence, versus a NIS format, which is a little bit difficult, and that's where, you know, you may need a little bit more work and time to review that type of document. So I'd really like to see a push towards eCTD. It definitely is the better approach. And then maybe also just to touch on in this session, I know we've touched on it previously in terms of harmonization, but most of our countries take the East or the CTD, and the Module 1 is slightly different, but it would be nice to see harmonization of your Module 1 documents across countries. We see that the QoS and QIS, you know, a lot of our African countries are accepting the WHO templates, and we'd like to see that harmonized across countries. It definitely reduces the amount of workload from our side and then from the regulator side as well. And you know, at the end of the day, I think putting the patient first is most important and is key. And if we can get these digital platforms to work for us, then it's going to be that much quicker to get products registered for our patients. And that's, at the end of the day, that's what we want, right? Our patients to have those products and access to those products. Yeah. Thanks.
Great, thank you. And on that, why don't we turn to Christine, also from a industry perspective, but speaking of ECTD and the underlying data infrastructure required, can you talk just a bit about data, and back to what Lawrence was talking about in terms of data standardization, but what do you see as the possibilities, the requirements from a data transformation standpoint to ensure this regulatory harmonization?
Good afternoon, everyone. My name is Christine Ledimo, and I'm the Regulatory Affairs Lead at MSD. We manage all the English and Portuguese-speaking African countries. And I think just to come on to that question, Chris, again, it really just becomes very important. A number of my colleagues have already shared regarding AMA, and for us preparing towards the institutionalization of AMA, it's very important that we are prepared both from a national and from a regulatory level. I mean, we definitely have come a long way, especially pre-COVID, where we were still working very much on paper, and the COVID pandemic and the lockdowns really was a catalyst that really facilitated the transition from paper to electronic. And again, we need to remember that everything is for the betterment of the patient and to improve public health as a whole. So I would say that really we need to look at issues like the regulatory information sharing platforms, where we can also harmonize the requirements, work on global templates again, rather than having to custom-make the submissions, the dossiers, according to each country's requirements. As Geeta has also shared that, again, we do understand Module 1, and we keep saying this, and similarly, the regulators say that it's country-specific requirements. But if we think about it, what is it that makes it difficult for us to really just harmonize those country-specific requirements? In most cases, it's actually the same information, it's just formatted differently. The form has the same information, it's just a different format of the form. So we really need to start being forward-thinking, and even to an extent of talking about having information on a cloud where different regulators are able to access that information. That also speaks into reliance. We have had our regulators share their frustration regarding the reliance procedure, that they are not able to access the required reports from their counterpart from other countries. But if we look at this centralized portal, or an iCloud, if I could say, that it's a way of facilitating the regulators obtaining this information. I think we really just truly need to be forward-thinking. AI, we have spoken about AI as well. AI could be used even when we are validating the submissions that have been done. You could have a product either pass or fail validation following AI, but again, we'll need to be very intentional with this. It's just not going to happen, and we'll need to understand that we have capacity building, which is a major concern for us in a continent, and we also need to work on a workable, scalable business plan that is very simple for us to can build up on. So, I mean, there really is a cry for some of the regulators have moved forward quite a bit. They've made a lot of progress, but some a bit slower, and believe it or not, in some we're still talking paper submissions. So I'm really just hoping that through these discussions and the engagements that we will really just get a buy-in on some of the regulators to move on to digitalization.
Thank you. Puvi, Christine addressed this, what I'll call the unevenness of some who are still on paper, some who are using Excel spreadsheets, some who are using much more sophisticated technology tools. From your perspective, what do you see as the things that are working, what needs to be improved to create this broader harmonization across the continent?
Thanks. So my name is Puvi Naidu. I am the SSA Cluster Regulatory Lead for Pfizer. I've been at Pfizer for the past 12 years. And I think very similar to what my colleagues in the industry have been saying, what we are seeing and what is positive, and if we do need to look at positives that have come out of the COVID pandemic and the crisis, was the quick implementation and the quick movement from paper-based submissions. I think up until that point, like Christine has said, we were utilizing and submitting reams and boxes of paper through to SAPRA. Similarly, our engagements were face-to-face, and that was a quick movement to that virtual engagement that we've had with them. And in that way, being able to actually provide the Pfizer COVID vaccine was, a big plus in terms of that agility within the regulators, I think, across sub-Saharan Africa to make product available, to the public. So that has been a big positive that has come, I think, out of that pandemic. I think similarly we're seeing with the drive to ECTD, and a number of the regional economic communities looking at ECTD as the format for submission. That needs to be driven, and I know it is being driven via the industry forums in terms of guidelines. But what we do need to see and what we do need to build on is the harmonization efforts across sub-Saharan Africa, and especially with Emma coming on board, using what has been found with the MRH initiative to drive those successes. I think we've seen some successes in the East African community in terms of regulatory harmonization, guidelines, etc., and to use those best practices, both from a regulatory perspective, but from a digitization perspective as well. Thank you.
Got it. Thank you. And I think it's a good time to actually shift back to the regulator be able to give a response back to what you're starting to hear from some of the industry representatives around agility, enhanced agility with digitalization, in terms of addressing reliance in a more effective way. Mpako, can you just give a little bit of a review on that as well?
Thanks, Chris and colleagues on the panel. Yeah, I think I fully agree with the concern made by our stakeholders in terms of the improvement that we need to do and the speed that we need to move in terms of implementing these digital tools. I think from the international level, like I said, on the IPRP, this is exactly what we're working on in terms of harmonizing the requirements and having the same interpretations of ICH guidelines, so that you don't send your submission to this agency, you get queries, and you send them to the next, then you don't get the queries. So we need to standardize how we do reviews, and I think technology can also help us in that regard. And then in terms of the regional issues, we've had discussion as well regarding the harmonization, as the speaker has said, regarding the module 1. They've been back and forth. I think some of the impediment is mainly to do with the legislative framework in each individual countries. So it gets very difficult when you have to maneuver through the legal frameworks of individual member states. So that's maybe some of the challenges where we need to start working on it from the legal framework. And I think it will be the same with the AMA initiatives, because if the treaty is not binding and it cannot be enforced, then you're still going to face similar challenges. So from the legal framework, that's where we need to start. And then from there, it will trickle down into NRAs, and it will be easy once we start trusting each other as regulators. And of course, with the industry as well, trusting and having the same standard. I mean, if you submit to Africa, we don't expect you to submit a substandard dossier. We expect the same standard as you would have submitted anyway. So if the same requirements applies, therefore, I don't see any issue in terms of reliance. And from South African perspective, we've learned quite a lot in terms of the reliance mechanisms, and they really worked to a certain extent. Of course, not as we anticipated, but currently I think we're sitting at around 30% of our application are able to go through reliance, and we've seen some improvement in that regard. So I think I can pause here for now, unless if there's any other specific question related to me. Thank you.
I think we'll be coming back to you, but thank you for that. Let's shift a little bit now to AI. You mentioned AI. A couple of you have mentioned AI. We talked in the morning about AI and how even the FDA can't seem to sort of keep up with the dramatic changes that are going on in terms of bringing AI into medical devices and whatnot. Let's shift to Selo. You've got a legal perspective on some of this. Maybe you can talk about some of the opportunities and the barriers to digitalization, including AI. There we go.
Okay, cool. Okay, thanks, Chris. My name is Selo Maleti. I'm the head of regulatory operations, scientific affairs, as well as external engagements for Kenvue. Kenvue is the new established spin-off company that used to be called Johnson & Johnson Consumer. So, yeah, your question is interesting, Chris, when it comes to AI. I think one thing that I will start, with it's, issues around laws, and I think, what we need to look at is how do we evolve our laws, how do we evolve our systems as well as pathways in terms of managing, the kind of submissions that we have in the industry. And I think coupled with that, it's a question of trust and reciprocity. Because I think when you start talking about AI, you are bringing concerns around safety, and that's where elements like cybersecurity come into play in terms of like, how do we ensure that the use of the product is safe? How do I ensure that the regulator is safe or the manufacturer of the product is safe? And then where does accountability lie in terms of those particular products? And now, if you think about all these things, you then end up at a point where there is doubt and pushback in terms of like, do we allow these technologies into our lives or not? And as such, you then end up with resistance in the industry, not just from the regulators, but also from the users at the end of the day. Because I think when you're talking AI, there's a lot of things that are involved in terms of privacy issues, like who's open to access my information and stuff like that. So I think from that perspective, then we then need to look at things like data policy and what kind of laws and legislations are out there and regulatory frameworks that we need to have to support this kind of inventions. And I think from that perspective, it then becomes important that you have frameworks that actually support the capture, aggregation, as well as sharing of meaningful health data. So that's key for AI. And I think the other thing that we need to look at is how do we come up with fit for purpose regulatory frameworks for digital health? Because I think that's the key thing. And if we look at our legal framework, and I think it's a global challenge that we face today, that the laws that we have are geared for products that we have today, but not necessarily products of the future. And the question is, how do we proactively anticipate what's coming? Because I think earlier this morning, I think they were talking about the gaps that exist today. We kind of like are working in a space where we're trying to close existing gaps. But when you look at technology, it's evolving on a daily. So what you approve today is not necessarily what you're going to be dealing with tomorrow. So that's where the challenge is. Now you need to then look at foresight in terms of like, what are the future laws that we're going to put in place? And Dr. Smith touched on the issue of, legislative hindrances that we face from time to time, because you look at what Lawrence was talking about here in terms of standardization, but now every country faces a set of different laws that they have to comply with. Now, at the end of the day, if there's no standard set for that, then you are left with a state of disharmony, which is what we are facing in the continent today. So I think we need to look at the future that talks to evolving what is currently our legislative framework today.
Yeah, I think I would say this sort of runs headlong into what is almost by necessity when you start to change law when you try to harmonize laws across different jurisdictions, that's by definition a slow process. So how do you keep up with the almost daily move of AI? Why don't we open up to the audience in to the panel in general to sort of address some of any of these things that maybe you heard that you wanted to pick back up on, anything that any of the panelists would like to jump in on.
If I may, Chris.
Please.
So I think, you know, as industry, you know, we all want to register our products and have it there for patients, but then you look at the bigger picture and there's different languages in Africa, right? In terms of some countries are English, some countries are French, and then we also have some Portuguese-speaking countries. And then how do you, you know, meet all that demand? And then it becomes difficult from a manufacturing perspective to meet minimum order quantities for different packs for different countries, especially when there's some local requirements based on the legislation. So you might have registration numbers that's needed on the pack, you need the applicant details, and then there's a few other things. But I think it's time, you know, like Cielo said, we need to actually look at how we create packs for the future and how do we create a process. And a lot of the countries are already speaking about electronic leaflets as an example. So is QR code something that we could put on the pack which would have the different languages and then be acceptable across Africa, one pack for everybody, which will make life a lot easier in terms of manufacturing, but then, you know, at the end of the day, also making it available for patients. And we do find, you know, the difficulty there in terms of meeting those minimum order quantities at manufacturing facilities to be able to, you know, just have that product available for the patients. So I think a bit of future thinking, definitely. And then Mpako already spoke about, you know, how do we advocate and start talking about those things. And maybe it's not all of module 1, but certain sections, but which are those critical sections that we need to look at now to be ready for tomorrow.
Got it. Thank you. Any other panelists? Yes, Christine.
So yeah, I do completely agree with my colleague here. And just to add on that, I mean, this process of digitalization, we all agree that we are medical scientists. We're not really trained in IT. So I think it will be very important for us on how we scale up on this new process. We probably just need to apply a stepwise approach. And I think also just in this journey to ensure that it is one that is sustainable and it is robust as well. Silo mentioned some issues regarding, you know, even liability and patient safety and privacy also when we're using AI. And I think this is where, again, it's unfortunate. I don't know if we have members of academia who are joining us today, but I think this is where it's going to be very important for us. We don't have that type of training to can just really partner with them and to have a proper curriculum that is drawn up for a regulatory affairs scientist and for us to can have a better understanding. And most of us, I think we're just learning as we're going, or, you know, even our teenage kids are the ones who are teaching us about this, and we're coming back at work and we're trying to see how we can adapt that into how we are working. So I think it's going to be very important for us to work together with academia to make sure that we have a seamless transition onto this process. In as much as we want to transition and we are emphasizing on the agency, I think it's also very important in terms of how we go about it to make sure that it's stepwise and we fully understand what we are getting ourselves into. But I think something I know we don't speak about a lot, I think definitely we'll need some form of curriculum, IT, digitalization type of curriculum that is drawn up for regulatory personnel.
Great, thank you. Did you want to make a comment? Go ahead.
Maybe just a comment from my side in terms of digitalization, and I think what it has brought to us is it's closed the gap between the regulator and us as the consumer of that regulatory agency. Meaning that information is a lot more available, even to the public. So, you know, we're talking about QR codes, the use of QR codes, but the ability also for the public to go onto a website and be able to, you know, look at the latest product information, having to be able to access adverse drug event reporting has really closed the gap, and I think it's something that we do need to take cognizance of. But I think what is vital is the partnership between the stakeholder and the regulator, and to continuously look at improvements within that space, so that we have, fit for purpose. I know Selo was talking about fit for purpose legislation, but fit for purpose communication, to be able to constantly evolve and better the digitalization efforts. Thanks.
That's great. And I think just back to what I was mentioning in the previous panel, the user fees are enabled in many cases by having better digitalization to be able to track performance, KPIs. This is one of the things that I know the Gates Foundation is working on with various regulatory authorities, to be able to build a more of an infrastructure to be able to track performance. I think it was your SAPRA colleague this morning that said you can't manage what you can't measure. And so having that digitalization infrastructure is going to be critical, regardless of how much you adopt user fees. I think, and back to the standardizations effort that you mentioned, Lawrence, if there's anything else you want to say about that.
Well, yeah, just just a few things. One thing too, just to point out, I know a lot of times when people think about standards, they think about, undue, additional burdens. It should not be thought about in that particular light. And also, just to add to that, is that it should not be done, it can't be done at one time, I think, which has already been, emphasized by the rest of my colleagues on the panel. So identifying what are those priority areas in terms of those standards that you roll these things out. And then the other piece too is just the interaction between the regulators and the industry. Just making sure that they work together with this, because again, we see when the regulators and the industry work hand in hand. I mean, that's when they can come up with good decisions and then move things forward for the good of the patient. So.
Got it. Thank you. Why don't we turn to the audience now? Let's see what questions any of you might have of the panel, or other quick comments you might have. Ernest.
I think maybe two, a comment and then a quick question. I think the first comment regarding digitization, we've played heavily in the area of innovation and adopting innovations and technologies in public health for quite many years. We developed an AI population health and work productivity platform in 2014, which we've been sort of trying to roll out across various African countries, often with very little success, because we found like the innovation mindset is just not there, right? In terms of people want quote unquote proven innovation, show it to me, it's been done 2,000 times, in which case it's not innovation anymore, right? So we've struggled with that, and we've learned a lot of lessons along the way about digitization. And I think the one I wanted to share here is that technology, it's only an enabler, right? It's not the solution in and of itself. And I think we run into a big danger when we start to act as though technology is a solution. You want to tech enable the right processes and the right procedures. Technology in and of itself doesn't automatically create the right processes or the right procedures. In fact, if you tech enable the wrong procedures, you get very efficient on steroids, wrong procedures, right? So I think it's really understanding what was the problem you're actually trying to solve, what is the solution to that problem, and then to what extent can technology enable that solution or not. So I think I always recommend going back to basics and say, what were we trying to solve, as opposed to jumping in with digitization. And the question I had was, I do believe that because we've not, in essence, based on our current state of development across national and regional regulatory systems, we've sort of not done a lot of things others, for example, in more developed, economically developed countries have done. We've not gotten there yet. And my question is there an opportunity, do we have any opportunities like where you feel we could just do something better from the beginning, right? As opposed to we have to walk in their path along the way, always following them. Do we have the opportunity to just jump ahead and just do something radically better, even if it's in one dimension? And I'm just curious if the panelists could say, look, if there was one thing we could just do, even if do away with this and let's just jump to this. Are there any big bang opportunities to just do something really remarkable as opposed to marginally incremental.
Who would like to address that question? Yeah, no problem. Just while you're thinking about that, I was thinking this morning when we talked about reliance around AI medical practice and devices. There's no reason. There's the capability on the African continent to address these sorts of AI issues. You don't need to wait on the US FDA or on the EMA. There's no reason why we couldn't build that capacity here on the continent. Actually, what I think Urgis was saying is leapfrog other jurisdictions. Somebody from the audience want to address that question? Go ahead.
Maybe
Go ahead,
I'll take a stab at it because, I think the challenges that we've got across the continent are probably very different from the challenges maybe in other more developed, countries. And I think it comes down to things like what we need is a robust regulatory framework to expedite registrations, to promote access to medicines for all as quickly as possible. So, maybe where we're talking about leapfrogging is not necessarily the same issues that may be in other countries. I think we need to address, it is at the grassroots level, but I think we need to address that and how to leapfrog that issue that we have.
Other questions?
Can I take a step on it?
Of course, go right ahead.
So I think it's a very difficult question, and I always, start thinking about political will, and I think Africa struggles with political will. And if we have political will, I think we can drive data transformation that enhances operational efficiencies. That we can do as Africans, but we just need that will, because I think once we've done that one move towards data transformation, we will be able to drive a lot of automation, because I think we believe in a lot of manual labor, and we can do away with manual labor.
Thanks, Selo. Other questions from the audience? Right there?
Everybody, can you hear me?
Yep.
Okay, I have a question and a comment. I'll start with a comment.
Can you just introduce yourself first?
Oh, sure, thank you. My name is Eric Nietzsche. I'm with Global Bridge Pharmaceutical in Charlotte, North Carolina. So I'm glad to be here. Thank you. So the first comment about the gentleman that mentioned innovation in Africa. I think as a practicing pharmacist for 20 years in the US and learning much about Africa, originally from here, I think that we can innovate if we communicate with Africa. I think that if Kenya came up with M-Pesa before we in the US came up with digital transfer, we can do stuff with Africa first, solving our own problems. And then my question to the panel is, how is the communication between SADC, the East Africa, and the Central Africa regions? I think that if those agencies can communicate, then the issue of harmonization will be streamlined. Is there any body that put together those pieces? I heard about it, NEPAC. Is that a national African thing? Is there communication between those agencies to solve this harmonization problem?
Mpako, would you like to address that?
Thank you.
Yes, thank you. Yeah, so if you look at the work done by African Union Development Agency, NEPAD, through AMRH, and in trying to operationalize African Medicine Agency, we have different regions within the continent. So if you look at the committee representations of these technical committees, we'll have members representing SADC region, you'll have member from East African community, the West African communities, the ICAT and the North African communities, and Central Africa. So we made sure that our committee is representative of all the regions in Africa. So I think that's a starting point, and we're only starting with the pilot in the next few months for the African Medicine Agency. So yeah, I think we trying to harmonize across our each regions, and AUDA NEPAD is that body that coordinate the collaborative, and hopefully once we run the pilot and we learn some lessons, we could see where we can improve and learn from each other and harmonize as much as we can. Thank you.
Got it. Thank you. We'll have time for maybe one more question from the audience.
Maybe a silly question, but I'm just thinking
And
out
please
loud.
introduce yourself.
It's Mandy from West Grove. I thought if we're talking about harmonization and technology, I hear your point, is not there to solve the problem, but surely it can help with efficiencies in addressing some of the challenges from industry and from a regulatory point. Is there any case to harmonize the actual software and digitalization processes from a stakeholder and from a regulatory perspective? So asking the funders maybe that support the regulators to almost come in with a uniform system that can be deployed with every country, that it's the same interface for industry, maybe.
I know there's some efforts underway that have been tried there, and I know there's some technologies that several of the national regulatory authorities have adopted. Does someone want to address that in a little more detail? Anybody with a perspective? Go ahead, Gita.
Yeah, so I think first on the applicant side, from the company perspective, there's ECTD, which is electronic common technical document, and that is managed on a harmonized platform. There's 2 or 3 programs that can be used in terms of that submission. And then on the regulator side, a lot of the countries that we deal with have a regulatory information management system online, on board. You log in and you can see where your submission is. You make the submission electronically. So we do have that. And there is a lot of convergence. So we see the same system in Zambia, in Tanzania, and Botswana recently. So we're seeing similar systems. And I think the backbone of those systems are similar. And I think SAPRA's got a workshop on Thursday. We're looking forward to that. And they can talk to us about their RIM system. And yeah, we'll see what that has to bring. But definitely there is some harmonization on the systems front. But I think just to answer the question on innovation and what can we do now, and not follow the rest of the crowd, is to have that political will. And I think Francis mentioned this in the earlier panel. We need to have political will to make those changes in law to allow for recognition of registration through the harmonization process, rather than reinvent, the wheel every time we want to register a product in a separate country. It's just to recognize those processes. And yeah, political will is extremely important, and how do we do that?
Got it. Okay, that's the toughest one, I think. Okay, we're now right almost at the end. What I would like to do is allow our panelists just one last parting comment. What I'd ask each of the panelists to do is just one key takeaway that you think that the audience needs to hear from your perspective. And why don't we just start right at the end, Lawrence?
I would start with, when I started with standards. The idea is that, consistent data standards will actually help drive, the issues and actually kind of address the question you had. It's a start point, and I think without it, it'd be hard to actually move forward. But I think there are a number of different initiatives going forward right now, but also just there are other standards too that need to be understood and just need to be defined. So I think just, utilizing and starting with those certain standards that are already there with ECTD, as well as a few others like the IDMPs and those can be the great start point.
Thank you. Silo.
Okay, I think my parting shot is that current regulations ensure safety and effectiveness of traditional products. They do not fit the fast-paced innovation that characterizes software and digital health. And I think to bring safe and effective digital technologies into healthcare at a pace that actually matches the speed of what is possible and that patients really deserve, we must redesign our regulatory approach to accommodate shorter timelines and an iterative nature of software development, as well as drive awareness throughout the continent.
Thank you. And Christine.
My parting words again that where not necessary, we should not reinvent the wheel. If we do have these portals, these digital systems that have already been applied and have been tested and proven for years to work, that as the African Union, we should not be reinventing the wheel, then we should adapt these where they work. And I know it really, that was a very intriguing question again. You know, I'm still thinking about it, but I'm just thinking that probably for a state that we are in, more than thinking about innovation, it's just even just getting the basics right. And probably that's just where we are, that we want to make sure that the process, these digital process, these e-platforms are seamless. And it's just to call again on regulators to continue collaborating with industry on different forums. Like I know we're having one with SAPRA this week, and I think about 2 or 3 weeks ago there was one with Botswana. And it's just for pleading to the regulators that as they are progressing in these processes, to really just take industry along and to make sure that we continue with the engagements, including the pilots.
Thank you. Kita.
Yeah, I think we all spoke about it. So the African Medicines Agency is definitely something we're looking forward to, and I think key learnings from what WAHU and EAC has already done is there, and to utilize that to improve on the process that Emma will roll out. And then just on the digitalization piece, really end to end, from the time we make the submission right until we get that registration certificate, we'd really like to see a full end to end, not just making the submission and then waiting to see what will happen and when those questions will come out. And very, I think, also time bound. We'd like to see a lot more conscientious, decision making being done that is time bound in terms of screening your application right down to reviewing it, question phase, and then response, and at the end your final registration certificate. And we do see that in FDA and EMA. You can very much predict when you're going to get your application out. And I think that's what we want to see in these harmonized processes, to see a time bound process that we can actually, see when our registration will come out, and not, wait for too many months or years. I think that will definitely add value in creating a positiveness in Africa, and people will then want to come and register their products there because they know when they're going to expect it, and what type of questions to expect. So I think, really end to end and time bound.
Got it. Thank you. And Puvi.
Thanks. I think, my last comments is that digitization is a dynamic process. So it's not something that ends. It's something that you need to constantly evaluate, get feedback from your stakeholders so that you can continuously improve. I think in terms of, regulators assessing where they are currently, making those changes, and then from an AMA perspective, to use those best practices that they're seeing either within the national regulatory authorities or even in the regional economic communities, to utilize those best practices as they start to operationalize themselves.
Got it. And that's a good lead into our final comment from our regulator, Mpako. What's your final comment?
Thanks, Chris. I think my final parting shot will be to say let's invest in the RAC RECs, because they do directly feed into the individual NRAs. They do feed directly into what will happen at a continental level. So if we could invest in those digital technology around the RECs across Africa, that will help. And I think from an international perspective, there is work being done at an ICH level. If you look at the current revision of ICH M13, which wants to standardize the requirements for reference product for bioequivalence, so you could have study that could be accepted across regions. So that's what we're trying to do and cut off on some of the regional specific requirement where you find that maybe a reference product is not accepted for your bio study. So I think there's work being done across at all levels. Does need to be really streamline and engage, as the last question was, who's coordinating all these activities. So I think we need to continue, have a positive mindset to say this will happen, but we need each other to coordinate all this. Thank you.
Got it. Thank you very much. And we'll wrap up there. Again, thanks very much to this really esteemed panel. It's been a great pleasure, hopefully enjoyable for you, and you learned some things and had a chance to think about where we're going with digitalization of regulatory harmonization. And with that, I'll turn it back over to our MC. Thanks very much.
Well, thank you, everyone. We're going to now take a quick break, and we'll ask everyone to come back at 3 p.m. Thank you.
Thanks so much, everybody. It's a pleasure to be here. And I'd like to go ahead and just welcome the panelists to come on stage as well. I know we've got a few coming. Feel free to sit where you'd like. But I know we've got, I think, 3 people in person and 1 virtual. So I'm just checking, do we have connectivity to Maxwell Marks, who's joining from PEPFAR? I will assume that is coming. I'm going to go ahead and kick off. So again, thank you, everybody. My name is Andrew Fleming, and I'm the Provincial HIV Advisor for USAID's Bilateral Health Office in South Africa. I am based at the Johannesburg Consulate, which is a little bit of an interesting position compared to the rest of my colleagues who are based up in Pretoria. I'm lucky enough to work across USAID's full healthcare portfolio in a strategy and innovation role designed to really deepen our partnerships within different provinces, but also with the private sector, and find new ways to amplify our work to make sure that it is more impactful and sustainable as we move ahead. I'm really lucky that I get to work with other colleagues who are working alongside regulatory harmonization. So many of you have worked with Retibile Tsekoa. She's a fantastic person driving a lot of our work. But then, of course, I also get to work across the global health security team. And for instance, that's where we're doing a lot of our work with SAPRA to make sure that they're developing the regulatory control of vaccines and systems that they need to, again, not only implement their work in South Africa, but take the regional approach to really driving a lot of the work that's being done in harmonization. So I'm really happy to share the next hour with you. Earlier today, I know that panelists have covered topics like sustainable financing models and how to go digital for better regulatory harmonization. In this panel session, we'll be exploring some of the challenges to regulatory capacity building and regulatory leadership development in the healthcare space, along with some of the new ideas and initiatives that can help us improve that landscape. Enhancing technical abilities, organizational functionality, and collaboration across borders and products will be critical to the success of regulatory system strengthening and the implementation and sustainability of regulatory harmonization. We're going to start with a panel discussion of around 40 minutes and then move into audience questions. So I would say, as with other panel discussions, please save your questions to the end, and we'll have a great session. And as mentioned, there are headsets on the table for translation, interpretation, when we get to Dr. Jose Zinga. And we can, I'll give you another demo when the time comes. But the moral of that story is to put the headphones on, switch it on, and go to channel 1. So let's go ahead and jump in. Before we start, I just wanted to give the panelists a chance to introduce themselves. And so let's start from on my immediate left.
Afternoon. Okay, good. Afternoon, everyone. My name is Rangan Demirahove. I am a regulatory consultant, and today I'm representing GARD-P, which is the Global Antibiotic Research and Development Partnership.
Boa tarde. Eu sou José Schwartz Lelo Zinga.
Sou chefe do Departamento de Comunicação, Inovação Tecnológica e Modernização de Serviço da Agência Reguladora de Medicamentos e Tecnologia de Saúde, ARMED, e Angola. Obrigado.
Obrigado. That's the extent of my Portuguese.
Good afternoon, ladies and gentlemen. My name is Bada Parasi. Oh, good afternoon, ladies and gentlemen. My name is Bada Parasi, and I'm the CEO of the Innovative Pharmaceutical Association of South Africa, IPASA, based in Johannesburg. And I'm happy to be here. Thank you.
Thank you so much. And I know we were still looking to get Maxwell Marks online. Is that, are we still holding for Maxwell? Oh, great. Should we just go ahead and start, and then we can introduce Maxwell once he's able to get on? You know, after so many years of doing virtual attendance at conferences, we still have tech glitches that come about.
Can you all hear me now?
There we go. We can indeed. Can you hear us? We see your name.
Yes, I can hear you all. Sorry, the internet connectivity is a bit. You can't see me visually. I've tried to get the video on. So my name is Maxwell Marks. I work with the PEPFAR Coordination Office in Nairobi, but serving as a senior advisor for external relations and policy, and I cover not only the Kenya space, but also the Washington quarters, and now the Global Health Security Bureau, issues of legislation, the item on the table for an agency, local manufacturing.
The internet might be getting the best of us at this moment. So I think we can see if Maxwell might be able to improve the connectivity, or if it's on our side, we can see what we can do. But I think we can go ahead and jump in interest of time. And we can welcome Maxwell back when he's, oh, you're still here, great. Anyways, Maxwell, we will welcome you back on when we can get a better internet connectivity. But I think what we wanted to do is jump into some of the panel questions to start with. There are three topics I wanted to cover today. The first is technical capacity constraints. The second is sort of lessons that we learned from the COVID-19 pandemic. And the third is really looking at how do we future-proof capacity building. And I think all of these we ask with the explicit intention of trying to figure out the best way to turn our conversations here into action. You know, capacity development is something that we know, we all agree that we need it. It's one of these things that I don't think you have to argue that, you know, capacity development is relevant. Everyone says, yes, we would love capacity development. But I think the main questions we really need to figure out are, what are the specific kinds of capacity development that we need for better harmonization, and how do we make that actually happen in a way that drives forward investment, harmonization, and alignment across different borders? So the first that we wanted to look at is technical capacity constraints in the African regulatory landscape. We all know them. We're all familiar with what is holding our work back. But as Africa moves towards more innovative vaccine development and manufacturing, we need to figure out the types of skills that we need to go forward. And again, how do we make them come to life? I think a key to this part is building trust in the system. And we had a great conversation at my lunch table today around just how important that idea of trust is to make harmonization viable. We have to be able to trust our institutions, and we have to, more importantly, trust the people at the heart of those institutions to be doing what they're doing, whether that's for greater vigilance, greater monitoring, quality control, or shared regulations and approvals processes. That trust is going to be a core component of how to move ahead. So I wanted to explore this concept of challenges but opportunities in capacity building. And Dr. Zinga, I'm going to start with you. And I wanted to find out, considering Ahmed's role in Angola, what challenges have you faced in implementing new initiatives? And these are human challenges, so challenges about capacity. And how have you overcome these challenges to get better human capacity in regulation?
Esse aqui é grande desafio. Mais uma vez agradecemos a USTDA por ter nos convidado aqui, porque essa aqui é uma sala para uma verdadeira aprendizagem. Essa é uma escola. Em termos da regulação da Agência Reguladora de Medicamentos e Uso de Saúde ARMED, para falar da política da regulação em Angola, teve o seu início no ano 1992. Aí primeiro começou a primeira regulação no mercado farmacêutico. No 2010, ganhou maior potência o exercício da atividade farmacêutica em Angola, onde foram publicadas as principais leis para exercício dessa atividade, visando o fortalecimento da regulação em Angola. Aí foram publicados 2 decretos, a Política Nacional Farmacêutica e a Regulação Farmacêutica. Em 2021, onde tivemos maiores ganhos, foi a criação da Agência Reguladora de Medicamento e Tecnologia de Saúde, ARMED, que me trouxe aqui, tendo a sua independência, e todos os atos são assumidos em nome da ARMED. Anteriormente, os atos que eram realizados eram feitos em nome do Ministério da Saúde, e hoje fazemos-lo em nome da Agência Reguladora de Medicamento e Tecnologia de Saúde. Ganhamos a independência. E, em termos de fortalecimento, o nosso grande desafio nesse momento, estamos a lutar, é sobre o registro de medicamento. Nesse momento, começamos, a política foi publicada em 2020. Até a presente data, nós temos 2 medicamentos que foram lançados no mercado. No ano 2022, fomos avaliados pela GBT, que é Global Benchmarking, onde fomos avaliados 8 funções. A 9ª função, que é a liberação do medicamento no mercado, não fomos avaliados, pois Angola ainda não tem laboratório de controle de qualidade de medicamento. Mais uma vez, nesta sala, como dizia a colega da Namíbia, Francine, estamos numa organização política que pode efetivamente criar o lobbying para poder, de certa forma, criar energia junto das autoridades, porque Angola também tenha um laboratório de controle de qualidade de medicamento. O porquê que isto? Porque em 2027 nós faremos a avaliação final de GBT. E não tendo o laboratório de controle de qualidade de medicamento, a nossa atividade, de certa forma, não terá aquela classificação que nós queremos, que é o nível 3, aonde o medicamento que possa ser fabricado em Angola seja reconhecido em qualquer parte do mundo e dando maior respeito à nossa autoridade. Obrigado.
Thank you so much, and that was a great overview of sort of the journey that you can take towards getting to a point in that aspiration of wanting to get to not only producing but distributing as well, and I think many countries will share that. Ranga, I wanted to ask you, in what ways do you think international partnerships are important to enhance capacity building efforts across Africa? And do you know of any at the moment that have been successful? And I know so many people talk about capacity building, so it would be interesting to really get down to some of those specifics of what works, what doesn't, and maybe what we should focus on and what partners are best positioned to do it.
So to answer the first part of your question, I would say they are very important, extremely important. I think when we're sitting in this conference room, it's one example of those partnerships. The success stories that we were hearing today and how many donor partners and partners have come together with regulatory agencies and capacity built for them to be as successful as they are today is a revelation of the success of these partnerships. Some of the speakers earlier on were talking of how other regulatory agencies are actually have some partial funding from donor partners, for example. So it's all speaking to the success of these partnerships, and like I said, all of us sitting in this room is an example of that, and all the successes that have been talked about today is a clear example of how successful these partnerships are.
Thanks so much. And if we're thinking about it, what would need to be, I mean, is it good enough to keep going in the way that we've been going? Or what do you think we need to do more of or less of to make sure that capacity development happens in the way that we need it?
I would say there's no perfect system, right? We did hear some of the challenges that were raised by the regulators. So I would say continued engagement would help to understand the support that they need, to understand the areas that are lacking that need to be invested more in. So it is more or less of that continued effort of collaborative efforts between industry, between donor partners, between the regulatory agencies in that move. So, for example, when I was introducing myself and saying the company that I'm representing, that we also look into engaging with regulatory authorities and ethics committees to understand what capacity building they would need in terms of new initiators in clinical trials. I'm sure a lot or most of us would be aware of the time when we were going through the COVID pandemic and there was a new way of doing clinical research, adaptive platform trials, and it has proved successful in terms of the way we think and more or less diverging from the traditional way of doing clinical trials. So now as an organization, we do have a program on adaptive platform trials looking for a regimen to address neonatal sepsis. And in those efforts, we are working towards engaging with the authorities to understand how we can help them to understand this new way of doing clinical trials. Because if we look across Africa, there's not a lot of adaptive platform trials. So it's just an example from my perspective for the company that I'm representing as well.
Thanks so much. That's a really interesting point on adaptability of support and how, you can't just have one idea of a static kind of support that's needed. It has to be something that changes over time as health conditions themselves change. You also touched on communication and sort of that narrative that we're sharing with policymakers or others that need to hear it, and I think we'll come back to that later. But Bada, I wanted to go to you, and specifically, one of the things that I like to think about is if we're trying to harmonize regulations, and we're trying to do that because we all want to manufacture more supplies, drugs, and other commodities in Africa, and keep them within Africa as much as we can to strengthen our own health system, we need investment and we need partnership and support. Capacity development, of course, is a huge component of building that trust to the point where investors will come, to the point where governments will listen, and to the point that we can get countries to work with each other instead of sort of against each other in competition. So I guess the question that was on my mind is sort of what capacity development needs to happen now in this stage where we're still kind of trying to attract investment, and then what capacity development can we hold on until we get that investment and sort of that next level capacity development. So maybe like a phased approach. What are your thoughts on that?
Thanks for the question. First of all, I have to indicate that IPASA represents 27 member companies who are involved in the research and development of innovative vaccines, medicines, and quite a number of them diagnostics. Now, just to get to a bit of a history of the regulation system in South Africa, we know that during the times of the Medicines Control Council, the predecessor of SAPRA, we had very long registration timelines. And the whole aim government had with coming up with this new entity known as SAPRA was to allow for a regulatory body that would be more independent, that hopefully at some stage would be able to use its own funds to improve its ability to carry out its mandate. And to that extent, my members are quite prepared to pay what it takes as long as we can see the results in terms of increased and improved timelines. We have had a very good relationship with SAPRA, and to the extent that we can see that the amount of funding that SAPRA has been hoping to be able to generate in order to improve its ability to carry out its mandate has not been that easy, it's not been that achievable. Fortunately, we have very regular interactions with the regulatory authority in South Africa and in the region, and we have had a number of interactions that have included us as the pharma industry looking at what it is that we can do to assist SAPRA. And I'm going to say something that some might consider to be a bit unusual, but I really believe there is nothing perverse in the pharma industry saying, is there anything that we can help with in terms of assisting with the training of your regulators, because you need all sorts of strengths in order to carry out your mandate. And we would really like the opportunity to be allowed to pop into the resources that are needed for SAPRA to do that. The other thing that I would say is the regulatory authorities also need to realize that you have the kind of drugs that are needed on the market, but that are quite expensive because they are targeting rare diseases. And it's an area that I feel doesn't receive enough attention. It needs to be highlighted that we have millions of people on this continent who suffer from rare diseases, who often take up to 4 or 5 years before there is a diagnosis. And once there is a diagnosis, where is the will among governments and all other stakeholders to ensure that some research and development goes into that? Now, all it means is that we need a lot of capacity building, not only among members of the regulatory authority, but among all other scientists in the countries in the region who are involved in one way or the other to help towards ensuring that we reach that level of our countries being able to benefit from the latest innovations. We are particularly proud that SAPRA has managed to attain the maturity level 3 that allows it to regulate the manufacturing of vaccines. And our intention is that the ideal would be if more countries in the region would be able to attain that level of maturity. But for that to happen, a lot of capacity building is needed, yes. And we as the industry are saying, bring us into the room, let us discuss, let us see ways that we can bring in expertise to ensure that this is achieved.
Thanks so much. And maybe just one follow on from that. If I'm an investor, what are the expectations that I have of what capacity will already be on the ground before I'm going to bring a lot of resources? What do I expect to already be in place before I before I come?
Well, speaking from the point of view of a trade association that tries to attract more multinational companies to come into the country to see where they can assist, how they can invest in the country. The one thing that everybody has been saying is that remove the barriers that make it difficult for countries to start businesses in the country and start contributing to the development of this country, not only economically, but also scientifically. We have quite a number of members who are also prepared to do clinical trials in the country. And it is a known fact that South Africa has among the best facilities on the continent for the conducting of clinical trials. What we need now is to ensure that there is speed in ensuring approval of the clinical, whatever is required for the clinical trials to continue and to run smoothly. All of those things still have to be attended to. We know and we are quite satisfied that things might be difficult, but the regulatory authorities are really trying their best to ensure that investment is indeed something that will be made smoother for everybody. But we all have to work together.
Thank you so much. And I really like that point about the business barriers, because at the end of the day, this is still about business. And I think it's easy to forget sometimes that just those ease of doing business indicators still do tell us quite a lot about the viability of coming into a space, even if through regulatory harmonization. So I want to pivot a little bit to what we've learned from COVID-19. And I know a couple of years back this was a huge global emergency. And of course, although now that World Health Organization has declared COVID-19 no longer a public health emergency, there are certainly aspects that have played roles during the pandemic that can help us go forward better with regulatory harmonization. And I had a question. I think Bada, I know you had just finished speaking, and I wanted to give you a water break, but I don't think I'm going to be able to do that, because I wanted to ask you, your organization has the word innovative in it, which was, I'm sure, helpful during COVID-19. What lessons did you learn during COVID-19, particularly on capacity development? And I mean, humans, behavior change is one of the hardest things to do, and that's really linked to capacity development. What did you learn about how to innovate capacity in COVID-19, and how do we take that forward?
We are very pleased as a trade organization and as part of the broader business community in South Africa that we are able to look back to the way the South African government and the industry, and indeed the entire business community, collaborated in order to ensure that PPEs and other required, whatever was needed for combating COVID-19 was brought to the members of the community as quickly as possible. In fact, Business Unity South Africa, to which IPASA is affiliated, together with other business entities, started something known as Business for South Africa, or B4SA. And it was through that working together that we managed to show that whatever has to be done in order to improve the health care of the community is not business, the business of government alone. The private sector has to be involved. And we are crying out for more involvement of stakeholders in the private sector. If you look right now at the recent regulations that have been introduced by WHO, the international health regulations, well, they are not new, but they keep on being revised. They require countries to have some kind of capacity to prevent or be able to deal with any new health challenges that come about. And that, in my mind, is closely linked to pandemic preparedness. And recently, there was a draft agreement also that means that not only should we ensure that countries are capacitated to be able to deal with any new health threats, but we need the North and the South to work together. An interesting aspect of this has been that any research and development that happens anywhere in the world, which has been conducted through government support, should be readily shared with all parts of the world in order for the smaller countries, not smaller, rather the poorer countries, to be able to benefit from all of this. And I believe that it's only through working together that we can be prepared for the next pandemic. And that's what we really are looking at as IPASA. And I have no doubt that business, and not just the pharma industry, looks at all of this in a similar manner in the region.
Thank you so much. Maxwell, are you on the line and can you hear us?
I've been listening very keenly, very interesting, and an apology that I can't be with you in person, but I hope my voice is clear enough to keep some folks awake. I know you probably had a heavy lunch.
We're in the post-lunch afternoon slim session. So Maxwell, I'm glad you can hear us and so glad you can be with us today. We were just chatting about some of the COVID-19 pivots that we all had. And we can see you now too. That's fantastic. Welcome, Maxwell. I wanted to ask you, particularly from PEPFAR's perspective, and more of that donor role, what leadership capacity development did you see emerge in COVID-19? And what of that do you think is critical to maintain so that we can better harmonize the production and distribution of medical and health products and medicines across Africa?
So thank you very much, and I'm very pleased to have joined you virtually, and to thank Elizabeth, Murray, and the team for facilitating the virtual platform. I know in the morning you did hear from my colleague Peter Mamasco, and I know in the room you also have Sophia from the HSS Attaché's office. And for PEPFAR, we've evolved over the last few years, and thanks to COVID, actually, that now we have a new name, and we're evolving to the Global Health Security Bureau. Now, why do I say the Global Health Security Bureau? Because what your question, the question you've raised is quite critical, because we realize that, and I think for most people in the room can identify with this, that when the world shut down, there were no flights, there was no transportation, there were issues where you couldn't even move between cities, and even within cities, that we still thrived and survived because of systems that existed. I won't say that we take full credit as an investment from PEP for being 20 years old, but the instruments and the systems that we put in place as part of a public pandemic response when HIV was declared, and I believe that those systems across the world did really play a critical role for countries to better be able to actively, in their own way, of course with guidance from folks like WHO and other international health organizations, to mitigate and manage the COVID pandemic. With that said, I think the 20-year investment from PEPFAR is one thing that we've now then moved forward and said the HIV is moving towards a 95 percentage coverage. We only have about 10 to 5% of the population that are living positively to be identified and to be put on life-saving treatment. And so with us as PEPFAR, we believe, and other donors as well as UNAIDS, I hope UNAIDS made it to the meeting, is that we really appreciate that not only do donors, and I have heard my colleagues on the panel mention partnership, that countries, based on the COVID response, countries are actually taking leadership on making sure that they are part and parcel of the solution and also the prevention of future pandemics, utilizing what we already have appreciated as systems that are in place. Now, Second, to your question, and going back to an earlier conversation this morning, what would I recommend that we really think about? One thing that is quite critical and that we perhaps we do musical chairs, and one of us always checks out because the chairs keep getting smaller, and the smaller piece of and the chair actually in this case is the finance. So if I can give you that analogy, and for those who know me from the previous meeting, I like analogies. The chairs are going to get small. We're going to have fewer chairs around, but we're still going to have more players. The question is, how do we become more efficient to make sure that with the little that we have, we maximize in terms of the efficiencies we've gained? And what do I mean by that? One is we need to think about, and I'm glad you've raised the issue around capacity building. We do need to, and I think one thing we've really not done quite well is to document our lessons learned from COVID. We've moved on from COVID and we've gone back to the regular, and I keep laughing, I keep telling my friend, no one is sanitizing anymore. I'm one of the few people who wears masks when I get on a plane, so I look very weird. But I think we've gone back to our norm and forgotten where we really needed to have just very basic things in place to really help our health systems prevail. Second is, in terms of diversification, is adaptation. What each country is experiencing when it comes to regulation is very unique, not unique to one country per se, but perhaps to a region. So I've had folks talking about partnering across different countries, across different regions. But I think the issue around regulation also needs to look at diversification and to see, as I mentioned, the musical chairs, what resources are available so that we do extend those investments to make sure that within a region, within a country, we do have reliable, efficient, and cost-effective ways of managing and mitigating, and also preventing any new diseases or managing diseases that exist. And finally, as just to wind up for the first thing, is we need to rethink about capacity building. I think we've been talking about capacity building, but in the new age post-COVID, and I'm glad that the panelists have mentioned it, and I appreciate them. I don't know if you've all realized that the frame of thought that each of them have presented in terms of capacity building has been a very unique approach. And how do we then think through on what is this new thought process of capacity building? Because it's not just about human resources. What kind of human resources do we need? What kind of equipment do we need? Today I was just talking to my wife, and she brought it to my attention that mammograms, unlike before where, they used to use two very, it was a very hideous process because it really used two heavy equipments to press the breast. But now there's technology that is actually much less intrusive. It's much easier to do a mammogram without really projecting both men and women to a rigorous and painful process. So there are technologies, there are innovations that we can actually take up. But the question is, as again, and I just wind up with these two perhaps thoughts for the group to continue having a conversation on. Accreditation and regulation reform requires financing. Now, the financing part we can easily talk about because we know it's shrinking, but we can really prioritize. But accreditation in terms of the global approach that we've been having with leadership from, Geneva-based organizations or Europe-based organizations, if you're going to be talking about the new Africa, and we hear about why Africa today, I know the US ambassador to Kenya keeps talking about why Africa. Now we could say, why South Africa? Why Botswana? Why Malawi? Why Namibia? And I think that's where we need to think about how, as SADC, does SADC come up together to see how they can come up with model policies that Peter Mamasco talked about this morning. How do we come up with regulatory policies and reforms that would allow for generic production that are actually accredited and that meet the quality of functions that are by instrument and design allowable by WHO, WTO, and other health agencies globally. So I'll leave us with that thought in terms of perhaps rethinking how we collaborate and partner and build off of the efficiencies of what we've learned from COVID based on what we've learned and documented so far. Thank you.
Thank you so much. That was really helpful input, and I really appreciate the messaging of how do we become more efficient and sustainable with resource environments that are changing and also generally decreasing. How do we do more with less? And I think we can pivot to in the final sort of section, which is this future-looking lens on capacity development, which is saying how do we future-proof this environment so that in 2 to 3 years' time we're not having another conference on what are the capacity development challenges that we face for regulatory harmonization. We're actually having a conference that says, hey, what did we try in the last 2 years? How did it work and how did it not? And how can we scale the positive elements of what we know to already be true? So with that, I wanted to pivot, and maybe Ranga, I can ask you first. You know, adaptability is something that's now come out from almost every panelist. What are the actual skills that we need to do to equip, whether it's regulators, whether it's the people making the regulations, the policymakers, or the government officials? What are the specific skills that we need to start building to help them buy into regulatory harmonization, to help them develop across different country lines and borders the regulations that work for more places? What are those adaptability skills that we need to start integrating into our capacity development programs now so that the humans and the people behind these regulations are building sustainable systems?
Well, I'd say the first thing would really for all of us to embrace the word change. Embracing change will set our mindset to accept that there are new ways of doing things and there will always be new ways of doing things. And for us to all then have that same voice, obviously harmonization helps us to have that same voice if we're embracing the same ethos and sharing that thought process. So I would say that it would be key for continued efforts of engaging and understanding and people accepting change and adapting to the new ways of doing things. As I touched on earlier on how clinical research has new ways of research with doing adaptive platform trials, which is something that was unheard of before. But then it's because of looking for innovative ways of doing things and bringing treatment efficiently. And what we've been talking about, faster access. So it's really about embracing change.
Thank you so much. And Dr. Zinga, maybe to go to you, if we're thinking in the future about better regulations, and if we're thinking about a world in which 5 years from now we want to see success, how do we measure that success? Because we have to put an M&E plan together now to make sure that we're going where we want. So what do you see as capacity development success in the next 5 years?
Obrigado. O Translate não está a funcionar. Eu entendi perfeitamente para os próximos 5 anos o que é que nós devemos fazer para ter sucesso, para ter um impacto na autoridade reguladora de medicamentos de Angola. Para isso, há um elemento importante. Primeiro, temos que manter sempre as formações atualizadas para os novos desafios. Avaliarmos nossos pontos fracos para serem eliminados e irmos mais além. E fazermos um casamento dentro da organização regional, que é a SADC, Nzazibona, e também com a AMA, porque a AMA permite, de certa forma, garantir, harmonizar as diretrizes em África. Como cá foi dito, há várias regulações de diferentes países que podem, de uma forma, fazerem uma determinada resistência face ao cumprimento das normas internacionais. Aqui, o grande maior objetivo é estarmos alinhados com o objetivo comum. Qual é o nosso objetivo comum? Termos as leis que concorram para o desenvolvimento do continente africano. Essa é a primeira coisa. Desenvolver a África tem que ser o nosso maior desejo, o nosso maior sonho. Isso nós temos que fazer. Termos políticas claras do desenvolvimento farmacêuticos. Termos políticas de harmonização do registro de medicamento, como temos feito na Zanzibar, tendo essas políticas bem alinhadas, que sejam cumpridas em Angola, em qualquer parte da SADC ou em qualquer parte da AMA de África. Deve ser o nosso maior desafio. E, atualmente, a grande questão que estamos a falar aqui é a digitalização. Nós, em África, estamos muito atrasados na área de digitalização, na área de soluções informáticas. Temos que ter expertise, temos que ter mais formações, temos que ter soluções, softwares comuns, para que não venhamos a gastar muitos recursos. Namíbia usa outro software para o registro de medicamento, Angola outro, África do Sul outro. Sabemos que a África do Sul é a grande potência, a Safra é a grande potência. A Safra tem que dar exemplo, tem que ajudar a potenciar os outros países. O porquê que eu digo isso? Porque a vida é imprevisível. Imagina esse momento eu estou cá, na África do Sul. Se eu for em Angola, num país em que a regulamentação é fraca, o medicamento que entra lá é de baixa qualidade, se eu estiver lá doente, qual é o medicamento que vão me utilizar? Qual é o medicamento que eu vou utilizar? É o medicamento daquele país. Por isso nós temos que manter uma comunicação comum quando falamos de medicamento, temos que exigir o medicamento que seja utilizado no Marrocos, na África do Sul e Angola, tem que ter os mesmos padrões. Esse tem que ser o nosso maior desafio. Obrigado.
Thank you very much. It's greatly appreciated, and I really like the point on digitization. And I know the previous session did speak about that as well. But when we think of capacity development, I think it's just an important point for us to bear in mind is that with any digital solution, capacity development is required of the people developing the solution, but also the people using the solution. And I think anyone who's worked in healthcare, particularly primary healthcare, knows the frustration of trying to roll out a digital solution and having clinicians just say, "Ugh, this is too complicated," and then go back to paper. So I think that is definitely something to build into any system that tries to use digitization for efficiency. The last question I wanted to ask before we go to the audience was for Bada. And your work in bringing partners together is quite amazing. And I think all this talk about capacity often assumes that there is an audience that is just stagnant and waiting to hear something that we have to say, and when we have a recommendation that they're going to do it. But we know that this isn't the reality. So when we think of the capacity of our partners, I guess I have two questions. One is, how do we bring those partners together to listen and to do things? And two, what training and capacity development and equipping do we need to do for those partners to help them understand what we want to do and agree to say yes and partner?
The first thing that I think we need to do in answer to your first question is, it is very necessary for all stakeholders, all partners, to get into the same room from time to time, share notes, and look how far we are, and learn from one another's good points, and get to know some to-dos and things that shouldn't be done or repeated because of the experience that people have had. I learned earlier and in my reading that Zazibona has got to a point where a central portal is either being piloted or has been completed that will allow the submission of, that will allow for one submission that's going to reach all regulatory authorities in the region. And the platform also allows for a collated response to that submission. What one would want to see eliminated, certainly something that my member companies would want to see eliminated, is the next step then that needs the company that's making the submission to then go to each and every one of those regulatory authority and sort of repeat the same step. If we can get to a point where capacity building has managed to eliminate that second step, I think that would bring us quite closer to what has been intended through the Reliance pathway. And I think only through that way will we be able to say that indeed a lot has been done. And as I said, we need a lot of collaboration among the partners. I must just point out one thing, that it must be some level, there must be some level of regret among regulators in this region that AMA seems to be up and running long before we have had our own regional regulatory authority. And I think that's something that we really need to accelerate, that will actually improve the region's ability to participate more meaningfully within the African Medicines Authority and really ensure that we participate and we contribute to the rest of the continent. But we need to look at measures to build that capacity in the region. Thanks.
Thank you so much. I wanted to go ahead and open it up to the floor. We've got about 15 minutes left. So I just wanted to go ahead and open it up. Do we have questions from the floor? Someone must have a question. The post-lunch slump. The post-lunch slump isn't that bad.
The questions have been answered.
You guys are such a great panel. Well, then I'll ask a question. I've been asking all the questions, so I'm asking this question. Someone's got to come up with a... yes, I didn't even have to ask one. You see, in the back.
Okay, just one question from my side. I just wanted to understand if the skills that we are talking about, have they been identified, and is there a process that is being followed to make sure that that capacity is being, filled?
Do we want to take a couple, or do we want to respond one-on-one? Oh, okay, great.
Yes, just in particular to add to that question, when we look at the future skills we need, like AI and those kind of things, if you're thinking about the capacities to address these new technologies, genomics, AI, et cetera, from a capacity building point of view, I just want to add that as well.
Yeah, those are two great questions on sort of like the standardization of skills development, and I think making sure that if we're going to do it, that everyone across Africa is learning the same skills so that we don't have differentiation and differences between them, particularly when it comes to new things that we're all having to learn, which is things like AI, which I still don't know how to use. But anyways, I'm going to go ahead and open it up to the panel, particularly on this idea of skills alignment. Who wants to jump in first? Bada, go for it.
I will steer clear of AI. And I would like to say at two levels, I believe that there's been a clear identification of skills. In the first instance, as WHO leads the discussion around a draft pandemic agreement, they have indicated a willingness to train people from regulatory authorities around the world, while one might not know the details of what the training will entail, they have clearly identified what it is that's required to bring to the same level those regulatory authority that might be lagging behind. Secondly, I want to believe that each and every regulatory authority has had its own identification of skills required, of weaknesses, and they would have looked at ways that they can improve either internally or with the help of those countries that are in a better position to help them. We might not know the details, but I have no doubt that they have been identified.
Thanks so much. Other panelists want to come in on this idea of skills alignment?
Yeah, I think just adding on to what Badis just mentioned, that it's obviously a case-by-case basis. Like earlier on, we were talking about vaccine manufacturing, and then when you look at the analysis, it's specified that it's the technology transfer skills that are needed, developing antigens on the continent. So it's all a case-by-case basis, but I believe that in all cases, the specific skills have been identified. Thank you.
So so the interesting is that we know the specific skills, because I would say, again, as someone who is increasingly feeling age when it comes to tech, because I don't know how to use ChatGPT. And I tried it once and I typed in a question and it said it couldn't answer it. So I don't know, I kind of just said, okay, well, never mind. But it is an interesting point, because as we start seeing innovation accelerate so much quicker with tech, we don't even know the skills that we need yet. And I guess that speaks to adaptability. And in markets where we don't necessarily have time to analyze something from the back end, build something up, because again, we're trying to future-proof ourselves against pandemics we don't even know when they're coming. What systems, and maybe if I can ask what partner support, thinking about donors, what system can we put into place to facilitate better learning and innovation within regulations? How do we make learning about regulations and innovating them a core part of moving ahead and not just something that we do on the side? Dr. Zinga, do you want to reply? Is that your...
No, I said the translated doesn't work.
Oh, okay.
Doesn't work.
Oh, I apologize for that. Shame it's not just ChatGPT. Maybe if I could go, while we're sorting the tech out, if I can then say to the other two panelists, Renga, Bada, for innovation, how do we root that into what we're doing now? Do we need to do any changes?
I would say change to the extent that Rangarirai mentioned, that we often are very hesitant to accommodate change. But I have no doubt that people in the various regulatory authorities are very well aware the kind of innovation that is needed to get them to the next level. I wouldn't want to assume, being from the industry, that we know what's best for the regulatory authorities. But it's through interaction that when they ask, we are then able to suggest to them, this is probably the way you could do it because of our experience from working with regulators in the North. But by and large, I think even in this instance, one has to assume that they are aware of the kind of innovation that is required. Yes, we have to instill innovation into everything that we do these days.
Great. And Dr. Zinga, I just wanted to give you a chance to comment as well. Sorry about the technological problems.
Tá bem, obrigado. A inovação é crucial. É de extrema importância para a indústria farmacêutica, a indústria de dispositivos médicos. O porquê? Só para recuarmos aquilo que houve com a vacina da Covid. Foram estudos a tempo recorde. Como sabemos, tudo tem o seu rácio, risco e benefício. Toda inovação sempre há de acarretar resistência para que as pessoas possam assumi-la. Estamos a viver num mundo que caminha à velocidade da luz. É importante que nós abracemos a inovação. Como eu falava, os softwares informáticos para a saúde é importante. Imagine eu aqui, por exemplo, com um dado meu, as pessoas conseguem entrar na base de dados para saber o que é que eu tenho, o que é que eu sofro na área de saúde. Por isso, é importante que nós abracemos a inovação. A farmacovigilância, por exemplo, a notificação de reações diversas de medicamento, que acontece em qualquer parte do mundo, em um segundo, todos nós já temos conhecimento. Nos Estados da América aconteceu essa reação de medicamento, X casos que foram a óbitos, X casos hospitalizados. É importante. Quem não abraçar a inovação, a modernização, a digitalização, por mais que estude, torna-se analfabeto. É importante que abracemos isso. Por mais difícil que seja, é a nossa via que devemos seguir. Obrigado.
Thank you very much. We greatly appreciate it. So we've come to the end of the discussion now, and I just wanted to quickly wrap up with, oh, sorry, one more question. Apologies, we have time for one more?
All right,
Quick question.
And this is for Dr. Zinga. Dr. Zinga, we do appreciate the fact that Angola is a newly regulated country, and we have been speaking a lot about capacity building. And having shared this, can you please share what the thinking is going forward with regards to regulatory flexibilities? For example, with regards to the labeling requirements, to have the labeling to be in Portuguese language, are there any flexibilities of perhaps looking into the QR codes? And my second question is that with regards to resources, we have heard from some of the regulators that there are resource constraints within the national regulators, and for this, that's why issues such as reliance are being looked into. This having been said, is the regulator enoughly capacitated? Are they looking into a phased-in approach in terms of applicants submitting marketing authorization applications, or is it going to be a phased-in approach? Obrigado.
Obrigado, muito obrigado pela pergunta. Aqui saio satisfeito porque foi bastante correspondido. Em termos da rotulagem em português, em Angola, a nossa lei comercial, todo produto que entra no país pode ter todas as línguas necessárias para maior comunicação. Para melhor entendimento, deve ter a língua portuguesa. A Armed realiza sessões de encontro com as companhias de medicamento para dar a conhecer, sensibilizar, de maneira que as pessoas tenham conhecimento as medidas que são tomadas. Nós temos o nosso site, temos o website da Agência Reguladora de Medicamento e Tecnologia de Saúde, como um canal de comunicação onde nós colocamos todas as informações necessárias, como é que deve ser exercida a atividade do exercício farmacêutico, em Angola. Quais são os requisitos para abrir uma fábrica de medicamento, requisitos para abrir o depósito de medicamento, requisitos para a fábrica, requisito para registro de medicamento, isto é, marketing authorization. Temos lá todos esses requisitos. Temos a ficha de notificação de reação adversa e outras informações úteis para os nossos utentes, para os nossos parceiros, para permitir o fortalecimento institucional. É necessário essa comunicação. Aqueles medicamentos que não estão na língua portuguesa, que são medicamentos importantes para o uso do país, nós, por requisitos específicos, podemos deixar esses medicamentos que entram no nosso país. Por requisitos específicos, tem que se fazer uma declaração ao Ministério da Saúde, concretamente à Agência Reguladora de Medicamentos, explicando a valência, a importância desse medicamento para a saúde, para que esse medicamento seja introduzido no nosso país. Mais uma vez, repito, até nesta data, nós ainda só temos 2 medicamentos registrados em Angola. Obrigado.
Thank you so much.
Hi, Andrew.
Yep.
I know we're winding up. May I just add one thing? And I have a feeling we always miss out on this. There's one key group, and I think you being a strategist will figure this piece out easily, that with every industry, we have institutions called academia. One of the things I've come to appreciate over the last few years is that academia is one incubator for innovation, is an incubator for risk-taking, it's an incubator for us to try new theories and prove them. And that is why you have people doing PhDs and proving theses and writing papers that then inform science and beyond. So I'm just going to ask that as we are thinking through the question you've just asked, is to see how we can also be incorporating academia, because if you look at most institutions, including regulatory authorities, they have to send someone to a training institution. How do we then also use those training institutions and reform them so that we are not looking at post-training and people in the workforce to try and address some of the issues we are raising today? How do we also start from that and to sort of reform those institutions to better equip and build capacity? I think that's the final what I had, but thank you very much.
Thanks so much, Maxwell. You cut off just as you were saying thank you very much, so I'm going to assume that that was it being done. We are now over time, so I just wanted to take a moment to wrap up with a few key thoughts and ideas that came through in the session. I think underscoring everything with capacity development is this idea of adaptability. Everyone spoke of it in different ways, saying, either the skills themselves need to learn how to adapt, people must learn how to adapt, financing needs to adapt, and so do systems. So I think, acknowledging that about capacity development and understanding that we're actually working with people at the end of the day, and people need help to adapt. So as we're thinking of capacity development, it's not just what are the right skills, it's what is the right process, what is the right platform, and what is the right long-term strategy for helping people be comfortable with adapting and being okay with the unknown. And I think as humans, we're often really not okay with the unknown, but we have to be when it comes to responding to different health and changing threats, changing health threats, or anything else. The other point that I wanted to raise was really on this idea of communication and diplomacy. How do you tell the right story? And I think, Maxwell, your point that you just made is really important for this. because it's asking this question of who needs to be in the room to tell us the different pieces of evidence and data and experiences that we need to share the story of what needs to be done. Oftentimes, if you look at health data and, whether it's at provincial, national, district level, people can see the data, but they don't necessarily know what that means for strategy. To do that, you need all sorts of different people in the room. You need the policymakers who know what needs to be done with it, but you need the academics who can take a problem, step back, and think about it for a while in a safe space, push it and pull it, and then come up with something at the end of it. Just as much as you need the regulators to come up and say, well, what is possible and what is not with that data. Everyone's got to be a piece of carving out that story, then that story can be used to achieve what we want to achieve from it. We also got a lot of information on different training paths, particularly in order to attract more investment and more buy-in from more people, particularly on regulatory training, business barriers, and different frameworks needed for activities such as trial, approval, and delivery. And I think, at the end of it, we're all trying to work towards a common objective. And the big question we need to keep pushing is how do we make the platforms available to help build that capacity, the human capacity, the equipment capacity, the innovation, to make sure we're working. Do we even consider AI a partner? We might have to get to that stage where AI then does become a partner that we have around the table. How do we all work together to make that capacity come to life? With that, I think I'm going to conclude. And thank you again. Thank you, panelists, for being up here today. And thank you all for sitting with us during the afternoon period. Thanks so much.
All right, thank you so much, panelists. So now we're moving over to the audience participation portion of our sessions. So I'm going to call up Matthew Schwab, our country manager for Southern Africa at USTDA, to help facilitate that. So everyone take out your cell phones. And remember, these were the questions. If you guys can all sign on to menti.com, and there's the code. So over to you, Matthew.
Good afternoon, everybody. So we are about to enter our last session of the day. So wanted to wake everyone up before before that last session. So as Elizabeth mentioned, if you could all go to menti.com, there's 4 questions on there that we're looking to get some responses to, and you'll see these are kind of questions we've been thinking about throughout the majority of the day. So the first question that we want to ask, and as folks respond, you'll see the responses come through. So the first question is, what few words or short phrase best describes the biggest challenge you see in realizing regulatory harmonization across SADC? And so I'll give you a couple minutes to respond. We have a couple responses coming in. So one is interoperability across the regulators. Another that we've talked a lot about is coordination, right skills to right resources. Excellent. Yeah, no, these are all themes that we've been hearing throughout the day. Any other thoughts? Enabling legislation and mutual trust. Excellent. Political drive to implement. The political will to do so and leveraging off the existing experience in SADC. Tension between mission of NRAs and delegation of power. Fragmentation, alignment of national legal frameworks, predictability of regulatory pathways, trust among NRAs, if I haven't read that one. Wonderful. I think that's great. Why don't we move on to the next question now? What would you recommend that other regional economic communities adopt from the Zazibona experience? Let's give people a minute to respond. Zazibona's the best, all of it. Digitalization, excellent. Having a strong host NRA for a rec. Close collaboration of heads of agencies. Great. Sharing resources and fees structuring. Don't duplicate efforts and skills. Okay. To be pragmatic and to be agile. Excellent. Start small and improve continuously. To start where Zazibona is now in adopting technological advancements, communication with Zazibona to learn best practices, and then continuous growth and engagement. Align M1 requirements. And can we scroll down a little bit? I think we've got one below there. Learn from lessons. Great. All right, let's move on to the next question. So now the opposite. What would you recommend that other regional economic communities avoid? Give folks another minute. Okay, duplication of efforts. Delays in stakeholder engagement. Right, duplication of effort. So these are challenges that maybe we've seen with Zazibona that if it had been handled differently, they might have not occurred or could have been minimized. Developing local systems without aligning with regional ones, lowering international standards, regulation for single territories. Okay. Having differing standards of approval and final decision being made by NRAs. Okay. Duplication of work. Some recurring themes here. Excellent. Then I think we have one more question. All right. So the last one. What is the most important insight you've gained from these discussions? For me, I think I heard a lot about communication and the need to really ensure that there's coordination between different sides and thought leaders and whatnot. That, to me, has been a recurring theme throughout the day. Others think that political will is needed to drive harmonization, that political will is critical to driving success, willingness of stakeholders to get this right, collaboration among stakeholders is critical. We need to accept the need for change. Always helpful to have regulators and industry in the same room, excellent. Adaptability and trust. Efforts for continental harmonization. Our biggest gap is translating academic methodologies into more practical solutions. And engagement and collaborations align stakeholders. The need for legislative framework reform. The agility to enable access to AI. All right. Wonderful. So now that everybody is awake, sorry, more came in. People are really awake now. Where did we leave off? Engagement and collaboration, we did that. The need to involve academia and training in OT and AI. Integrity is a priority of the various agencies. That regulatory agencies are aware of harmonization and challenges to implement harmonization efforts. Don't let perfect be the enemy of good. And harmonization needs to be operationalized. Excellent. All right. Wonderful. So with that, why don't we move into our last and final panel that will be discussing industry and stakeholder perspectives of pharmaceutical and regulatory pathways. I'm going to call up our moderator for this session, Dr. Skumbuzo Nguzwana. He's the founding board member of the Federation of African Pharmaceutical Manufacturers Association. Thank you.
I guess even the mics are tired. Good afternoon, everyone. So my name is Kumbuzo Ngozwana. I'm from a company called Kiara. I have the pleasure of escorting the afternoon session. Never a great job, but fortunately, I'm accompanied by a great panel. I'm going to call up the panelists. I'll also ask them to introduce themselves in the interest of time. I'll make a few opening remarks and then we'll get right into it, and I hope that it will be interesting for all of you. So the first panelist is Lawrence Evans from USP. I think we had our interactions a few years back on the chlorhexidine project. Lawrence, good to see you. We've got, and I hope I'm pronouncing it correctly, Nzetselele Kaho from Bombra in Botswana. We then have from Perth, we've got John Paul Omolo. And then from Mozambique, Dr. Tanya Sitoy. And lastly, from Pfizer, Puvi Naidu. If all the panelists could please join me, and as they do, maybe just a few comments to get us going. Having worked in this industry and having been an advocate of local manufacturing and having been involved in some of these regulatory processes and harmonization for more than a decade, closer to 15, 18 years, it's quite encouraging for me to see that the discussion nowadays has moved beyond whether Africa needs to produce medicines or not. It's moved beyond questioning the capabilities of local companies and the capacities of African regulators. I think with a number of our regulators now attaining ML3, I think we have 5 now, with quite a number of them in the background, the discussion is shifting, and maybe rightfully so, to more important issues like, convergence. We see AMA, we see other initiatives, but also things like serialization, because as I always remind people, substandard and falsified medicines remain the last pandemic on the continent that has yet to be addressed. And I think with the maiden story still so fresh in our minds, we dare not forget that. So the question today is, what do we do to move towards convergence in the regulation of both medicines and medical devices? How do we make sure that we bring in place best practice, the adoption of global standards, and that this are spread across so that we don't have regulators that are left behind, or there are issues around trust if a product is registered by one regulator versus the other. So with all of that, I think to unpack some of these issues and to delve deeper into the role of industry and development partners or global public health partners, as I said, I'm joined by an esteemed panel. I'm going to ask them to introduce themselves, and then I'll kick off with the first set of questions. Some are specific to certain people, some are cross-cutting. So let me start with you, Lawrence, if you could introduce yourself, and then I'll move through my panelists, and then I'll come to the first question.
Thank you for that. Lawrence Evans, USP, Senior Director, Global Health Technical Programs.
Hi, it's Puvi Naidu, Cluster Lead for SSA for Pfizer.
Good afternoon. My name is Kasolofete Samson, Manager for Complementary Medicines and Cosmetics at Botswana Medicines Regulatory Authority. Thank you.
Thank you very much. So without wasting any time, we've got 2 panelists on the screen. I do apologize. Please, if you could go ahead and introduce yourselves. Do you hear me?
Yes, loud and clear. Thank you so much.
Please go ahead and introduce yourself.
Thank you so much. And it's my pleasure joining you all. And my apologies, I wasn't able to be there with everyone physically. My name is John Paul Omolo. I'm the Africa Regional Lead, R&D Policy and Advocacy at Perth. It's my pleasure. Thank you.
Thank you. You can go ahead, ma'am.
Good afternoon to all. My name is Tanya Sitoi. As John Paul, I couldn't attend in person, but I will be here virtual, and I am the CEO of Mozambique Medicines Authority. Thank you.
Thank you very much. I think in my eagerness, I forgot to look at the screen. I do apologize for the oversight. So I guess we'll kick off with the first question, and this is specifically for PATH and USP. We know that significant progress has been made to implement regulatory convergence in Africa. The question then is, how can these successes be leveraged to fast track the operationalization of the African Medicines Agency? In the background, we know there are political issues. More countries still need to accede to this and ratify the instruments and whatnot. But at a practical level, at an operational level with the countries that have come on board, what can we do to try and fast track this process?
Well, you're right. There's been a lot of success and a lot of work that's been done thus far. I think, at a minimum, definitely want to build off the work of the REX as well as the various technical committees within the AMRH, those technical committees. It's because a lot of the foundational pieces are there. But something I also want to just really focus on and maybe hit home on is the part about governance aspects really needs to be addressed. And what I mean is, we're trying to get to the point where operationalize AMA. We want to get to that point. But then in terms of how will these other these other groups, like for example, the REX and the TCs, interact in terms of that governance structure? Because again, it also relates back to one of the points that you mentioned about, countries buying it, meaning when I say countries buying it, the political will, and because we don't want those type of things to really then stop approvals or delays in medicines. But again, I think there's a lot of work that's actually been done again, that's, to build off of in that particular area. The other aspect too is, I think, you've seen the several countries on the continent actually have their maturity levels have actually, been observed to be maturity level 3. But not only that, but I think those that actually have various expertise in certain regulatory functions, leverage that with those countries that may not have those capabilities just yet. Because I think there still need to be more one-on-one type of interactions with some of the countries, whether it be done through some MOUs because again, to really facilitate the whole point about reliance. We've seen that already in terms of with South Africa as well as Egypt signing an MOU. When I've heard there's been already some interactions involved there, but I think almost as if a tweening type thing with those that are still trying to improve their processes versus, getting assistance from those regulatory authorities that do have expertise in some, in particular, specific functions.
Thank you. John Paul, if I can come to you, same question, please.
So thank you so much. I think I would really want to start by congratulating the 27 member states that have fully ratified the Africa Medicines Agency, and in tandem also congratulate the NRAs that supported the process of supporting countries in regulate or even ratifying the Medicines Agency. This is a good way forward and a good way of showing synergy within the continent. And back to your question, when we are looking at the progress and maintaining the progress into the phase of AMA operationalization, I would like to speak about 4 key things. One, for us to maintain and leverage and fast-track operationalization of this regulatory convergence, we would like to see more of knowledge sharing and best practices. As AMA is coming into operationalization, we would like to see more collaboration among NRAs and the regulators. We would like to see a better cohesion and better coordination through the AMRH initiative, where lessons learned are being put in place and all these successes are able to be converged. And especially when we're thinking about sharing of knowledge and sharing of best practices. The second thing is that as we are coming into the actual operationalization, the mutual agreements and recognitions needs to really come into place and should be encouraged. Over the last 1 year, we've seen a number of countries getting into MOUs for reliance. We saw Zimbabwe and South Africa. We saw South Africa and Egypt. And we would like to see that this is more encouraged, because these agreements would allow reliance on assessments conducted by trusted NRAs and through trust processes, and therefore we would be able to streamline approvals and reduce duplications. The third thing that I would really want to mention that would help fast track this operationalization is the pilot programs and demonstrations. Technically, we have seen the African Medicines Regulatory Harmonization coming up with mechanisms or rather pilot programs to look at how will AMA operationalize. How will we go about joint review processes? How will countries uptake some of these processes? And you saw towards end of last year, beginning of this year, some of these pilots going out. And we need to start putting more emphasis, especially on the complex molecules or products, and understand how that will impact technically the regulatory landscape in totality and what we need to address along the way. Because those pilot programs are really important, and they would help us foresee future challenges and address them now. And lastly, is that as we are thinking about strengthening regulatory system across the entire 55 member states, we need to also look at the regional centers of excellence. We have so far about 9, or the latest, I think there are now 10 regional centers of excellence. And when we are looking at this, that will help us distribute equitably the resources that are available within the continent. We know that we have limited resources. Earlier speakers spoke about the limited capacities within the continent, but the regional centers of excellence should be able to help us harmonize and efficiently and effectively utilize the resources that are available within and without the continent. And that would be able to help us strengthen the agencies also at the national and at the REC level. Thank you, and back to you.
Thank you very much. So, taking the same question, but now with a slightly different slant from a regulator's point of view, you are at the cold face, you are dealing with these issues on a daily basis. Obviously, we have Zazibona, EAC, ECOWAS, and other. What are the key areas? What are the potential landmines that we need to avoid in order to be able to successfully implement this regulatory convergence based on your experience and learnings from what has happened so far?
Thank you for that question. So I think looking at how the discussions have been going out today, there's been mention of some of the barriers that some of the national regulatory agencies would have faced, and that mostly would be to do with the legal framework. So I'd suggest that as we go about with harmonization at a continental level, we also try to engage and facilitate each NRA through the regional agencies to make sure that we are aligned in our legal frameworks.
Okay. So that's the biggest issue by far.
Yes, once that is the line, then most of the things can then fall into place.
Okay. I'll come back to you. I just want to ask Dr. Sitoi the same question, and then I'll come back to the issue of funding as well. Dr. Sitoi, from your vantage point heading up the Mozambican Authority, what are the impediments to implementing this regulatory convergence from a regulator's perspective?
Thank you. Can I speak in Portuguese?
Yes, please.
Ok. Em primeiro lugar, eu penso que o principal constrangimento que nós temos como reguladores é, de facto, a questão da legislação. Para implementar, nós estamos num ambiente de harmonização muito bom, que é aqui a nível da SADC. Implementamos com algum sucesso com bastante sucesso, na verdade, o Zanzibona. Tivemos muitas oportunidades, muitos casos de sucesso, mas também tivemos alguns constrangimentos. E um dos constrangimentos foi, de facto, a questão da legislação. Isto porque cada jurisdição tem a sua própria legislação e quando se trata de adotar uma decisão feita em um outro país, mesmo que seja a nível da SADC, nós encontramos alguns constrangimentos. Ultrapassamos, encontramos algum mecanismo através do protocolo de saúde da região, ultrapassamos constrangimentos e agora vamos avançar para o processo de registro centralizado, que penso que é um bom exercício também para a implementação da agência africana. Em termos da agência africana, aquilo que eu vejo como constrangimento neste momento, principalmente na questão de ratificação, como se disse cedo, dos 55 países africanos, só 36 até o momento é que ratificaram, mas prende-se também por questões burocráticas e legislativas. Eu posso dar o exemplo de Moçambique. Nós assinamos o tratado em 2020 e desde 2020, hoje passaram-se 4 anos que estamos à espera que a Assembleia da República, porque o processo em Moçambique tem que ir à Assembleia da República, estamos à espera que a Assembleia da República ratifique o tratado. Portanto, são 4 anos que perdemos neste aspecto. Portanto, para agilizar o processo de harmonização e tornar mais eficiente, eu penso que nós temos que ter um olhar um pouco atento para questões legislativas, legais, que acredito que seja um processo um pouco complicado, mas não impossível. Temos o caso do Zazabona e encontrar mecanismos de cada jurisdição reconhecer as tomadas de decisões feitas a nível de que foram feitas em iniciativas de harmonização. E muito obrigado.
Thank you. Oh, sorry, you wanted to say something?
I can just add maybe 2 lines to say that the legal framework extends beyond just the medicine regulation, because I think with the speakers that were here earlier on spoke to how you are also working with other divisions within the country. So legislation for the NRA just alone takes a longer time. And now when you also have to look at all the other organizations that you're working with, like your customs, and we also have Port Health in Botswana, you also have BPS, you have to align with all of those organizations to make sure that your law does not impede, but there's some sort aligned all together. So it takes even more longer time. But like the CEO has just alluded, it's not impossible. It's a process, but it's something that will take longer than we would anticipate.
Thank you. Puvi, industry obviously has concerns and has expressed this concern. Studies have been done in the past, obviously, by industry that showed the impact on patient and patient access. What role can the private sector play? And I know Bada alluded to the issue of capacity building and more collaboration, but in your view, what role can the private sector play in ensuring that this regulatory convergence is fast-tracked and, most importantly, implemented in a sustainable way, in an appropriate way?
So I think we probably mustn't forget the fact that EMA aims to revolutionize healthcare in Africa and to address the healthcare disparities within the continent and to promote access of medicines to patients. I think the fact also that there's, about 85% of sub-Saharan African countries are involved in some type of reliance mechanism or reliance initiatives or harmonization initiatives, I think bodes well in terms of EMA's mandate and what they aim to achieve. And I think it is about industry being able to support those initiatives and to be able to provide feedback on what's working and what isn't. So, I think on a day-to-day basis, from an industry perspective, we can see some of the challenges that are there. And I think it is about the ongoing collaboration with the regulators to actually get EMA, off and to ensure that it works in the way that it is intended to. I think other ways that industry obviously will support is, if there's any financial requirements through transparent channels, capacity building. But I think what is important is that it is a partnership, and it's something that we need to consistently and continuously drive and be able to provide feedback on.
Okay. And so, as a follow-on question, what role then do you see specifically in engaging with industry? Would you want to see the regulators do a lot more of, when it comes to, the technical guidelines, their adoption, their proper implementation? Because one of the common complaints of industry is, we don't know what they really want. This is what the guidance document says. We submitted this way, but this is what we get from this, evaluator, and this from there. So we are not finding each other somehow. And I think from an industry perspective, it will be important with our regulators here just to say specifically, guys, this is what we are looking for. And I know it's a very unfair question, but at least I know you are equal to the task.
Yeah, and I think, some of the earlier panels and the one that I was involved with previously with other industry colleagues is that harmonization is key. So what we do want to see is, can we have one dossier that it can be submitted across the continent that addresses the needs? And I think without having specific requirements, yes, we know the Module 1 documents are country-specific, but is there a way to align those? The second point, and I think there has been some discussion, is about the languages across and harmonizing that. I know that we had been part of a lot of discussions within the trade associations as well to drive some convergence in terms of the labeling requirements across Africa. And, I think it's about implementing those. So yes, there are discussion points, and there have been documents that have been done, but it is now about implementing those. I think those are probably the two key areas, and it comes down to the one main area, which is the harmonization effort.
Okay. Maybe turning on to our regulators as well, just to follow this thread. One of the issues that keeps being raised why we are not able to fully implement this harmonization is the fact that some regulators, I'll call it departments, or they are fully, situated in a Ministry of Health. They report into the Ministry of Health. Their budget is determined by the Ministry of Health. They are not fully autonomous or even semi-autonomous, which brings then the question and the complication that whatever fees they collect are really what keeps the regulator going. Just turning to the regulators maybe to understand, is this is it a fair reflection? Is it one of the impediments that the reason people are not, or regulators are not happy, maybe that's the wrong word, are not fully buying into this, is you are basically saying, let's go through a centralized process. It means you starve, especially some of the smaller regulators. Would that be a fair assessment?
I think from where we're coming at, I think the way you have deliberated it is exactly as it's been coming about. But what I'll say is that it is true that in most instances, regulators are usually funded by the government, and you find that governments are also trying to say, as regulatory authorities, you should also find ways of sustaining yourselves in the near future. So if we bring up to say we start submissions that are done centrally and we don't have to pay through the NRAs, I think it's a conversation that we have to continue on engaging on. But at this point, I don't think it would be fully possible now. But it's something that we can fully engage on to say then, what does it mean for the national regulatory authorities going forward? What plans do we have to say, how are we going to align to make sure that each country is also able to have a say in the regulatory procedures being done, in all the technical working documents being done?
Thank you.
Thank you.
Dr. Sitoy, I'll come to you now, maybe just moving on to Lawrence and John Paul. From your vantage point, having worked extensively, both organizations with the private sector, assisting companies to get WHO PQ or develop products or whatever the intervention might be, what would be your top 3 recommendations to the private sector players on the implementation of this regulatory convergence and their readiness to be able to operate within that, that new system that whilst maintaining very high global standards? John Paul, the floor is yours, sir.
Thank you so much, Skombozo. That's one of the billion-dollar questions that, when I hear about, scares me a little. But it is one of the most critical and important questions that I think when we get all the responses, we should be home and dry. In the space, in the continental space of strengthening regulatory system strengthening, the private sector plays a very critical role. And we've spoken about, their role and the regulator's role. But over a period of time, we've seen a lot of mistrust between the private sector, especially the industry, and the regulators. And these two entities tend to be working like enemies, yet they need each other. So what are some of the recommendations that I would put in place? 2 important ones for me. 1, that if we need to create a level of trust between the regulator and the industry, the data sharing and transparency needs to be there. That would create a mutual level of accountability from both the industry as well as the regulator within the space under which the two are operating. So we need to strengthen data sharing, and of course within the parameters that would be allowable, that enables the regulator to trust on the information they receive as they're reviewing the dossiers, as well as entrust the industry that their information is under a key and lock and will be protected within that specific space. The second thing that I would want to mention is that industry needs to be part and parcel of an advocacy and dialogue space. I love the conversations and the series that USTDA is already happy encouraging within the continent, this being the second series of the 3, and that this kind of conversations with industry in place and creating a space where industry and regulators and governments as well as academia, what I would call the quadruple helix, is sitting and having. This enables companies to also advocate for regulatory harmonization, but also participate in policy discussions while also trying to come up with a create of a balance on some of the current teething issues on regulatory harmonization. And of course, we'll also foster, dialogue between the industry and the regulators. So making sure that industry does not just sit within the industry space, but they come into the policy dialogues and have a mechanism of engaging more often with the regulators and other players within the space. Thank you, and back to you.
Thank you. Lawrence, over to you.
Yeah. So I'm going to build off the, just the last comment that he mentioned, then mention another point. Definitely in terms of the stakeholder engagement. I mean, it's actually really good practices in which, regulatory practices which you should be following, whereas whereas the manufacturers are engaged, especially when there's new policies and things that are coming out, because they're the ones who these policies are going to impact. So you want to make sure that you're getting their feedback. Again, it's not about, the point about trying to just over-regulate things, but making sure that you appropriately regulate. Because I think that sometimes there's a misperception on that end that from manufacturers and things that regulators can over-regulate things, and then vice versa. It can go back and forth, but I think that piece needs to be in play. And one of the things that I recognize just happened, I think this year or last year, was if you look at some of the AMRH initiatives, they're finally starting to have I don't even know if it's a technical committee, but a group where it's actually where the manufacturers are involved. And it didn't dawn on me till we've been part, USP as well as PATH and others have been part of these technical committees for so long, but that aspect wasn't there. And they are the ones who are using these regulations and these policies, and trying to get that feedback, but it wasn't. But, I'm glad, it's moving forward, and that involvement will be there. I think it's so key and vital to make sure, at least from that regional level, things are there. And I know it varies, some regulators are really good about, the stakeholder engagement, and some of them are still working through that. But I think it's one of the things I know that we've actually, as an organization, we've pretty much helped in terms of trying to facilitate that process. And then also, when you think about it, is when regulations do come out from the new policies, is to actually have it over a staged process. And again, it's going to vary by the size of the manufacturers, because everybody can't do these things, at the same time because of just their abilities. So I think that's, I just wanted to build off that, because I definitely agree with John Paul was saying in terms of, that particular aspect about involvement with the manufacturers. The other point I just wanted to mention too is, sometimes I think, manufacturers aren't necessarily aware of all the regulatory pathways available. And again, and sometimes, what can be done, and let me also mention this too, even with regulators. Again, I use it as an example. The collaborative registration procedure, CRP, that WHO has, whereas, it was mentioned earlier, if there's a pre-qualified product, and it's a way to actually then facilitate that review. Whereas when I last looked on WHO's website to see how many of the African countries, the regulatory authorities have actually signed up for it, it was like 36 or so. So not all of them were there. But again, that's it. You think about harmonization and things, and then just convergence, that is one simple way to do it. To make sure then again that they have those, they make use of things like that. I'm gonna give you an example of why it's actually so necessary. It wasn't in Africa, but it was in Central Asia. We noticed that, hey, they weren't using this for TB medicines, or for any medicines that WHO pre-qualified, one country. So the first thing we did, we worked with the country to then, hey, make sure you sign up for CRP. Then after that, develop internal policies and processes on how to get it done. Then also speak with the regulator, with manufacturers that are ventures, to then, hey, come up with a guideline with their input. After that was done, within 6 months, they were getting products that were, that went through this facilitated review that was taking years to, it was like 120 days. So again, there's things out there that already exist. And so building off of those, and and I think it can, work from both ends in terms of both regulators as well as manufacturers being aware of those, and even, just utilizing them. So I just wanted to just conclude on that point.
Thank you. I want to move back to Dr. Sitoy before I go to the audience. And this question is, I mentioned when we started that, the issue of substandard and falsified medicines, or counterfeit in the old terminology, remains one of the silent killers and silent pandemics on the continent. We've seen, surveys where 64%, 70% of drugs as important as anti-malarials were found to be substandard. Dr. Sitoy, what can we do about that? And specifically, is serialization anywhere near becoming a reality on the continent? I know there were a number of NRAs that had plans or ambitions to have introduced, if I recall, as far back as 2019. Where are we with that, and what can be done to fast track it to protect public health? Thank you.
Sir, can you repeat the question?
The issue of serialization to ensure the integrity of the medicines that we use. Obviously, our supply chains are very porous, the borders are porous, and lots of substandard and falsified drugs come in. Technology is one way to counter that. Our NRAs haven't really embraced it, or they are not enforcing it. What can we do to fast track that process so we are able to protect public health?
Ok, thank you. É uma pergunta muito importante e conveniente. Ultimamente, as autoridades reguladoras têm estado a trabalhar com vários mecanismos para detectar produtos falsificados. E um deles é o uso de tecnologias, vários tipos de tecnologias, dependendo de cada país. Primeiro, deixa-me dizer que esta é uma preocupação que une não só, que une, aliás, as autoridades reguladoras, a indústria e também os políticos, os fazedores de políticos. Então, isto é uma oportunidade, de facto, para nós combatermos este flagelo. Nós temos iniciativas várias. Temos o caso, por exemplo, do uso de true scanners à porta de entrada ou nas inspeções de enforcement para detectar produtos falsificados. Temos várias iniciativas a nível global de track and trace para produtos farmacêuticos. Sei que há uma grande reunião agora em abril, em Oxford, em que se vão juntar autoridades reguladoras, organizações não governamentais e indústria farmacêutica, onde se vai discutir mecanismos e mecanismos eletrónicos de combate à falsificação de medicamentos. Para o caso específico de Moçambique, nós temos dois mecanismos eletrónicos, falo de eletrónico. Temos um mecanismo e um que está em pipeline, que está que estamos para implementar. O primeiro é o uso do TrueScan, e o TrueScan tem nos ajudado bastante. Temos relatórios de redução da entrada de medicamentos falsificados e vamos, até o fim deste ano, lançar a nossa iniciativa de Track and Trace. Nós aqui chamamos de selagem dos produtos, ou seja, todos os produtos farmacêuticos serão obrigados a ter um selo em que esse selo poderá ser lido à porta de entrada, desde a saída. Como sabem, Moçambique é um país maioritariamente importador, temos muito pouca produção local. Portanto, o produto será rastreado desde o seu fabricante até ao consumidor final. Estamos numa fase muito avançada de implementação deste procedimento e penso que é uma iniciativa que não é só de Moçambique, mas também de outros países africanos, porque é de facto uma realidade a falsificação de medicamentos. Há países também que adotaram outros mecanismos, que é o controle de qualidade, também a porta de entrada. Nós também temos este mecanismo, mas é um mecanismo pouco sustentável, é difícil, é pouco sustentável, requer muitos recursos e pensamos que a adoção de mecanismos eletrónicos, portanto, é o futuro, é a saída para a solução deste problema. E o track and trace, penso que é o rastreamento dos produtos, penso que é a solução. E neste aspecto, a participação ativa da indústria irá ajudar bastante. Portanto, a advocacia da indústria irá ajudar bastante aos órgãos reguladores. Muito obrigado.
Thank you. Before I go to the audience, maybe one or two other, oh, sorry, please go ahead.
So before you go to the audience, just to add on to what Dr. Sitolo was just mentioning, I think she has highlighted very important points. And I'll also just like to say this will take us to some of the conversations we had earlier on where you're doing post-marketing surveillance activities and pharmacovigilance activities where now you are engaged in the actual clients and the professionals to say if you have any adverse reactions, please report. So now you find that with those aspects in place, say you have clients now adhering to the pharmacovigilance activities and also the sampling being done by post-marketing surveillance is done, you find that now the challenge is going to be with the laboratory facilities that you have, and there's some sort needs upgradation, and this is where now I think possibly earlier on when we're speaking to donors, it's something that you could have raised to say with laboratories that we have, I think the industry as well as the funders that are out there can maybe try to also assist in that aspect, which also brings me to the other question that I just answered on fees, because we're trying to have as little money as possible to try and have the state-of-the-art lab equipment that we're also able to just not rely on registration processes, but also have the post-marketing surveillance and enforcement as well as your pharmacovigilance. Because like you're saying, falsified medicines is something that we really have to address and not shy away from looking into. Thank you.
Thank you. So for all the panelists, before I go to the audience, I have two questions. The first one is, we're talking convergence here and AMA and all these interesting developments on the continent. What do you see as the role of the WHO PQ process in the future? Let's assume in 2 years' time, AMA is fully functional, well capacitated. Where do you see WHO PQ, especially in light of the fact that most of the people who take part in those processes obviously come from our regulators? So that's the first question. You can choose that or the second one. The second one is perhaps more towards the development partners. One of the concerns that are raised consistently is you have a lot of very good partners that are doing very good work on the continent. Most of these are vertical standalone programs. There's duplication, there's wastage of resources, and if we have to be frank, sometimes, fights for territory or space. What can we do to make sure that we bring these institutions to work together? As you talk about regulatory convergence, how do we bring these global health partners to also converge so that their interventions are not haphazard or uncoordinated, and that we move in tandem to build this capacity and this convergence that everybody's talking about? I'll start with you. You can take one of the two, and after that, we'll go to the audience.
Thank you for those two difficult questions. I'll take the first one to say I'll run with the 2 years that you stated. So looking at WHO being a global agency assisting with CRPs, I would say we still, even if AMA is to implement or strategy implementation plans as stated, it will still be growing, and there will be still a lot to learn in terms of challenges that come about with being a global agency in assistance or who is regulating products. So I would say in the next 2 years, I must still have to learn and get some of the capacity building from WHO. But in terms of in the long run, maybe that's something that we'll have to converse and discuss to see how do we align the global, the continental, and the regional, as well as the NRAs, to see where each one fits into the regulatory space. And I think that's a discussion that we should be having just from the start now, so that as we go in and converge, we're aligned as each other grows, and to avoid the duplication that you have been stating. Thank you.
Thanks for the questions. I think I'll take the first one as well. I think WHO will still play a very important part. And I think when you talk about a fully capacitated regulator, in any instance, I don't think it is something that will ever reach. So definitely the WHO and WHO PQ and CRP processes, I think, will still play a very important part in being able to utilize those pathways to basically assist EMA and what EMA aims to achieve. And I think then for EMA to use this sort of surplus, if they ever have, that resource to maybe drive other types of regulatory pathways.
I'll try to maybe touch on both of them just a little, if you don't mind. Yeah, the WHO one, maybe can put it like in two buckets with WHO. So one from the normative standard setting side, and then the PQ or pre-qualification side. I think in terms of the normative side, yeah, definitely the role is going to continue to be there. I mean, that's what they do. And there could be things whereas maybe AMA can have an agreement with them where they can, adopt, well, they have the ability to just adopt those policies, so it can actually help them from a resource standpoint. Then they have technical expertise as well that they may not have, and so working together, that way. So I think that role will still remain, with WHO. And then if you think about it from the pre-qualification process, whereas, PQ has a role in terms of certain products that are really for, UN procurements. So countries, they have other products as well. I mean, every country has way more products that need to be approved and will not necessarily go through the pre-qualification process. And so there's some, and so I think, PQ, yes, they can still have those, but you can use it, as mentioned, from the CRP process, but I think how you can engage them, but then the AMA still be able to address those things that are really where it's high priority, where they're not covering it, that actually are needed for the continent.
Tanya, if I could start with you online. So there were two questions. The one was around the WHO PQ. Do we still, or how do you see the WHO PQ process then interfacing with AMA once it's fully established? The second one was around global development partners and multiple programs and how we sort of coordinate that, bring that together as well so that we are not wasting scarce resources, and we implement programs that are coordinated for maximum impact. Okay. You can take one of the two questions.
Ok. Em relação à OMS, só para acrescentar aquilo que já foi dito pelos colegas do painel, eu penso que a OMS vai continuar lá a dar assistência técnica, a apoiar as agências reguladoras no país e também na própria agência africana de assistência técnica. De certa forma, não. É preciso que se entenda que a OMS dá algum conforto técnico às agências reguladoras. Nós vimos agora, por causa, por exemplo, das vacinas do Covid. Foi uma situação em que era muito difícil tomar a decisão se introduzíamos e se introduzíamos, qual vacina introduzir. E a OMS teve um papel para nós, como reguladores, um papel crucial em termos de recomendações técnicas. E, portanto, eu vejo a Organização Mundial da Saúde como o processo de pré-qualificação também como um processo contínuo e que penso que deve ficar lá para dar fundamentalmente assistência técnica, não só aos países, mas também à agência africana quando ela estiver operacional. Em termos dos parceiros, dos outros parceiros, se entendi bem a pergunta, temos vários parceiros que trabalham ou dão assistência técnica aos órgãos reguladores, certo? É esta a pergunta. Como é que podemos juntar para não haver duplicação de esforços? Bom, minha opinião pessoal é que eu acho que de facto os parceiros têm que se organizar um bocadinho. É a minha opinião pessoal. Que tem que se organizar porque nós recebemos muitas solicitações, várias solicitações de vários parceiros e que já vêm com uma agenda própria. Recentemente, a OMS criou um fórum de parceiros em que penso que inverteu o papel, em que os órgãos reguladores, as agências reguladoras ou os ministérios da saúde solicitam apoio para determinada atividade ou para um plano de atividades e veio a calhar oportunamente, porque quase todas as agências neste momento estão a desenvolver os seus planos de desenvolvimento institucionais no âmbito do alcance do nível de maturidade 3 e com base nisso, portanto, os parceiros vão selecionar aquilo que são atividades de interesse dentro dos planos de desenvolvimento institucionais de cada agência, ou de cada país, ou de cada Ministério da Saúde. E assim facilita o trabalho. Mas a minha opinião é que estes parceiros todos, tem que haver um fórum onde é discutido que tipo de atividades vai se implementar e como é que se vai implementar, mas com base nos planos de cada país e não ao contrário. Esta é a minha opinião pessoal. Muito obrigado.
Thank you. John Paul, your
Nothing.
comment, any one of the two questions, please.
Thank you so much, Kumbuzo. I think I want to handle the two, but very fast. On the first question around WHO PQ, I think we will not be able to fully unpack the future of WHO PQ if we don't look at the rear mirror on the history of WHO PQ and then look at where we are and where we want to go. So if you look at WHO PQ, by and large, it was meant to address the issue of substandard and falsified medical products in lower middle income countries. So if that was the key and the core of WHO PQ, where are we right now? We are at the space where a number of our regulators are getting stronger in terms of the regulatory systems. We have five NRAs that have achieved ML3, and some are even aiming at ML4 for certain health products and technologies. We have AMA that is coming into the space that will for sure be able to get us to the point of stringent regulatory authorities. What am I trying to say here? We have a phase under which the WHO PQ will still be able to support in the process, but we must also make it nimble enough not to deter where Africa is going. We are going into the space where we would like to see more manufacturing happening, more research and development happening within the continent, more of these products being utilized by the continent for the continent. And at the end of the day, we would also like to see major procurement agencies acquiring these products, at least for this continent. We've seen through the AVMA process of Gavi, we've seen PEPFAR coming in, and therefore there needs to be a rethink of the WHO PREQ process, even as we are strengthening the regulatory systems in Africa through AMA and through strengthening of the NRAs. There needs to be a conversation of how to even start integrating the WHO PQ process into the current processes of at country, rec, or continental space. That's it. The second question was about the vertical programs and how to ensure that we increase our efficiencies and avoid duplication. I think it's not a matter of should, it's a matter of must. In the space where we are working, resources are very tight. And here we are talking about financial and technical. Again, we are thinking about doing more with less, right? And we cannot continue working in a chaotic environment where everyone is doing things and duplication is the order of the game. We must recognize that if we don't work together, then we will as well not contribute to the unity and reliance of this within the continent, but create confusion. And this is where I call upon the national regulatory authorities to create that coordination. There's a lot for everyone. We know the journey NRAs need to make. I mean, we only have 5 that have achieved ML3. We're not saying all NRAs must achieve ML3, but there's still a huge gap. There's still enough room for every partner, development partner, to come in and plug in and support, move the pin within the REC or NRA or AMA and strengthen that ecosystem in totality. We just need to create a level of coordination, whether at AMRH level, where there's a lot of coordination through the AMRH initiative. There's a partnership platform that we are all members of, at the CIC that is being coordinated by WHO. We can also do the similar thing at REC level and at country level, where all these efforts are coordinated and NRAs are at the core because they know where the gaps are and how to fill in that. And partners should just come in to address where the needs are at the country level or continent level. Thank you, and back to you, Skumbozo. And thank you for that question.
Thank you very much. I think we will open it up to the audience. You have the freedom to ask what you want to ask, and you can call on any one of the panelists. So if you want to ask a question to all of them, I'll ask them to be brief because I'm acutely aware of our time limitations as well. Any takers?
Yes, Maxwell here. And John Paul is a friend, but he knows I'm always also going to challenge him, but also to the panelists. He's raised a very important question, and I think it came out from the previous conversations on the space of donor engagement and how we are really intentionally and by design trying to really align ourselves with some of the systems we have. And I'm glad that's why I read USTDA efforts that bring PEP board and also Andrew and with the South African mission, you really supporting this and diversify the various departments within the area that would fit from this conversation. So to my question, this has raised it.
Sorry,
for example, PEPFAR is being reimagined and is being reformed in lack of a better word. How do we look at other international, financial, or other institutions that could bring to the table enabling factors in a position to address some of these teething issues? Because I think there are resources that they could, in terms of them not losing the gains they've made, to make sure that possessions that become the continuation of what they began. So my question is, how and where is that is to be incorporated into some of the conversations happening. Or
John Paul, I'm not sure if you got that. There was a little bit of static. Hopefully, we're able to get at least enough of the question to be able to answer.
Sure, I think it was breaking a bit, but I got a bit the gist of it. So actually, if I got you right, you were asking, how do you come in to be able to know where to support? Is that the gist? Just recount that, please.
yes, and not just supporting it in the traditional way, but challenge it in that Swarth is looking at things differently. For example, if Gates are looking at things differently, Global Fund is looking at things differently. Where do we position what we are discussing now in the remit of successes to show them that these are critical parts of sustainability beyond the investments and gains they've made?
Okay, no, great. I think I got it. And thank you for that question. Really important. And we are seeing, sorry, and he's dropped off. We are seeing a lot of efforts happening around regulatory, coordination of regulatory work across the continent. I think at the moment, the best place to start from would be the Africa Medicines Regulatory Harmonization Initiative, which brings all the NRAs, all the RECs, all the partners, and the donors within one room, and we are able to discuss different components and different aspects, right from blood and blood products, diagnostics, devices, therapeutics, the policies, medicines policy and regulatory reforms. So there are several technical committees that are there. So I think when it comes to the actual regulatory work, which then fits into the AMA space, or from a technical aspect, AMRH initiative would be the best place to start and then spread. But when it comes to now regulatory harmonization and the nexus of regulatory harmonization and trade, there's some conversations that are happening already at the moment where between AUDA and EPAD and the Africa Continental Free Trade Area, and they're bringing together partners. That would be a good continental space where you can also plug in, because PEPFAR is a procurer by and large, and you also realize that there are also efforts by Africa CDC to look at the pooling mechanisms that are within the continent and how to enhance the pooling mechanism. So there are few things that are cross-cutting, but the African Union agencies are trying to coordinate partners and agencies. And I think PEPFAR needs to be as well on the table to be able to help and also influence, but also support by and large, not just financially, but also technically on some of these aspects, especially when you're thinking about pooling mechanisms and how you would be able to drive products and procure products through a pooled mechanisms within the continent. When we're thinking of the major disease areas, how do we do that? What tools do we use? How do we verify that these are the real products? And that is already conversation that is happening within Africa CDC under the Platform for Harmonized Africa Health Manufacturing Platform that is led by previously PAVM, but it's also going under restructuring. Over.
Thank you. I think we don't have any more questions, and I'm getting a signal as well that we are out of time. I think just to wrap up, I mean, it's very clear that we still have a long way to go. But, to paraphrase Isaac Newton when he wrote the famous words, the immortal words, "If I have seen further, it is because I have stood on the shoulders of giants." He obviously attained part of his monumental achievements based on the work of those that had come before him. And I know when you talk of harmonization in Africa, people always say, it took Europe 45 years to do this, you guys will never do it. I think we've seen enough, and there's enough evidence to say, if we continue to do the right things and to literally build on that which has been done by others before, we can also go further. And at some point, we can also say, The real words now that Newton said is, a dwarf standing on the shoulders of a giant can see further than the giant. So hopefully our regulatory authorities at some point will also be up there with some of the best. Thank you to the panelists. I wish we had more time. It's obviously late afternoon, it's graveyard shift. And I thank you for your contributions and wish you a pleasant late afternoon, early evening. Thank you. Bye-bye.